and which is the best way for you to reach there without struggling too much. During our times when we passed out, there was no internet and there was no as much networking as we can see today. But with these so much of networking and so much of information also comes a lot of noise. So it is very important for you to sort of, sift through the details and choose what is good for you. There can't be a right answer or a wrong answer, but we will still, sort of nudge you or guide you towards how you can make your decision. So to begin the proceedings, I would like to introduce Dr. Taral Nagda, who is my teacher, a very beloved colleague here in Jupiter Hospital. And as you know, he is a person of national and international eminence in pediatric orthopedics. Dr. Taral is going to give you a completely different perspective. Unfortunately, due to the rains, he's stuck and he will not be able to make it here in time, but he will join us later on in the day. But let us hear from Dr. Taral Nagda regarding his journey in his career, which he managed. Can you start the presentation? At the outset, people joining online can start putting in the questions in the chat box if you have any. At the same time, we would take the questions from the floor. I would like to invite Dr. Nandan and Dr. Nikhil to also be with me, and we will start with the proceedings. We'll start with Dr. Taral's talk.
Hi, my name is Dr. Taral Nagda, and I want to confess here that I'm a non-fellowship trained pediatric orthopedic surgeon, and that's why I have put this degree STOP, and this stands for Self-Trained Orthopedic Pediatrician. In my life, after I finished my MS from KM Hospital, I did houseman's post at Wadia Children's Hospital, and then I joined as lecturer back at KM. And during this time, I visited Dr. Ashok Johari, Benjamin Joseph, several other people in a Hi, my name is Dr. Taral Nagda, and I want to confess here that I'm a non-fellowship trained pediatric orthopedic surgeon, and that's why I have put this degree STOP, and this stands for Self-Trained Orthopedic Pediatrician. In my life, after I finished my MS from KM Hospital, I did houseman's post at Wadia Children's Hospital, and then I joined as lecturer back at KM. And during this time, I visited Dr. Ashok Johari, Benjamin Joseph, several other people in a non-fellowship format to learn pediatric orthopedics. I did go to US, but that was an observership for 3 months to various centers, and I came back and self-trained myself as a lecturer and associate professor at KM Hospital. I'm going to share some of the secrets and concepts with you, all of you who have come here with the hope of getting a great fellowship program for the future. The first concept I want to share is learning is not just limited to your MS or fellowship, it's a lifelong process. Most of the surgeries I do now, I've learned outside my learning domain. I've learned on my own. Hip preservation, for example, I learned 5 years back, the Ganses approach. 3D printing technology and uh, some of the newer advances in augmented reality I'm learning now. So learning never stops. Most of the actors do the roles which they were never taught in the acting school. And similarly, most of the surgeries you will do will never be part of your training. You will have to self-learn them. Fellowships are still needed. They are your connect between the dream and the reality, between learning.
I'm sorry for the technical glitch. I think online there is a fair bit of echo. We have got a Dr. Taral here with us. I'll just get him.
Ashish, do you want me to join directly? Share and
Taral sir on camera on and co-host करना. So can you share your screen? We can see you.
yeah, I can share the screen. No, it's a disabled participant screen. You'll have to make me co-host.
It says that you are a co-host here.
Yeah.
Can you try?
Okay. Am I being seen now?
Yes, sir, you're audible.
Okay, shall I start?
Yes.
Hi,
Okay.
my name is Dr.
No,
Taral
it's a
Ladka
old.
and
One second. Just give me a minute. Yeah. Can we start? Ashish?
Yes, sir. Yes, sir. We can start, sir.
Okay. So again, I'm confessing as a non-fellowship trained or a self-trained orthopedic surgeon, and that's why I put this degree STOP. And this should not stop you from doing anything in life. STOP was self-trained orthopedic pediatrician, and I just want to say that learning is a lifelong process, and you never stop learning. I want to share my life history that I was a resident at KM Hospital. And then after that, I did a housemanship at Wadia Children's Hospital, where I developed interest in pediatric orthopedics. There were no fellowships at that time. So when I joined lecturer's post at KM, after my lecturer's post, I used to go to Dr. Johari's place and assist him and learn from him. And it was a very different kind of fellowship when he would not utter a word and I would try to learn just by observing him. And this continued. I used to practice what I saw at his place at KM. I have not done a formal fellowship. Even I went to US for 3 months, and that was 3 months observership. But the good part was that I could read and do a lot of things at KM as a lecturer. What I also want to sort of share is I used to teach a lot, and when I taught, I learned a lot, and Ashish would vouch for that. So most of the actors don't do roles which they are taught in acting school. Similarly, most of the surgeries I do now, they were not taught to me in my post graduation or even later on. A lot of things I do now are self-taught. For example, hip preservation surgery is something which I learned just 5 years back, and now I'm learning 3D technology and sort of augmented reality, and all these things are happening now. You'll practice now. Dr. Mullaji never learned uni-compartmental knee replacement in his fellowship. In fact, his fellowship was in pediatric orthopedics. So, people do different things in life than what they are taught in fellowship. Then why do we need fellowship? We still need fellowships because that's the connect between the dream and the reality. What you're going to learn and what you're going to practice, there has to be a connect. And this bridge is fellowship. Fellowship allows you to learn and imbibe a lot of things, and the processes by which this happens during your fellowship period are of difference, and that's why it's very important that you take this period very, very seriously, because you have focused learning during fellowship period as compared to your residency period. There is an aim, there is a goal, there is a purpose, and that's why fellowships are different from any other learning tool. The key word is future focused learning. And future focused learning is towards what you want to become. It's not towards what you are. And the whole emphasis on problem solving, critical thinking, and skill development. That is what you do during your fellowship. it's very important to realize that fellowship is not the only way to do this. You can have observership, you can have courses like BOS has category courses, focus courses, you can have online talks. OrthoTV and ViewMedi has all the material you require to learn a given specialty. So it's not necessary that if you don't get a given fellowship, you will not learn. Secondly, fellowship is training from one person, but you should try to learn from multiple people. And the online sort of a presence allows you to learn from multiple people at the same time. So these are some of the courses which BOS and a lot of other people, other institutions all across the world have and get access to that. It's very important to know that if you are interested in joint replacement, for example, doing TKR is not the only thing you will learn. You have to know many other things. You have to possess many other skills, and it's important to realize that. So this is something which is very important. When you do your MS or DORTH or DNB, you get a qualification. When you do your fellowship, you get a skill level. What is important is competency. Knowing about knee replacement is a qualification. Giving an exam and passing that is qualification. When you're able to do it or assist it or do it partially with an assistance, it's a skill level. But when you are able to do it flawlessly, and if you're able to manage complications, and if you're able to give a long-term result, that is competency. And that is your aim during your fellowship, to be able to learn the art and science of giving the best long-term results. So you can use your skills as a qualification for a role. You can say that I have done fellowship under so-and-so person, but not your qualification can substitute for skills. And definitely they don't substitute for your competency. So competency is something you want to achieve. And when you want competency, it's not just knowledge which is important. You have to learn teamwork, responsibility, very important commercial awareness, decision making, communication, leadership skills, audit and results, trustworthiness and ethics, problem solving and organizational skills. So all these skills become part and parcel of your being, and fellowship should give you access to some of them. And lastly, I want to say is that the purpose of fellowship is to achieve a flow. This is a concept by Mihai Csikszentmihalyi. You should read this book, because there is a competition between skill and challenges in life. When you are at low level of skills and challenges, the life is, has apathy or boredom. It's like treating a simple fracture, and if you have below average skills. If you have a difficult fracture and below average skills, if you're not trained, then that leads to worry and anxiety. But if you have a simple fracture and average skill, that leads to boredom. So these are not acceptable in life. If you have a slightly difficult fracture and average skills, you are aroused, but still that's not purpose of your life. If you have a difficult fracture and extraordinary skills, you get a sense of control and enjoyment, but still that is far away from fulfillment. What you require is, for example, to treat a very complex fracture and have extraordinary skills. And when you have that, that gives rise to enjoyment and fulfillment. And this is known as flow, where the skills and challenges balance each other. The purpose of fellowship is to give you this balance between the skills and challenges. When you are a resident, you are in comfort zone. Once you finish residency, you are in a fear zone, because there is no self-confidence. You get affected by so many opinions. Fellowship gives you that learning opportunity. It gets you exposed to the challenges and problems. It allows you to acquire new skills. It extends your comfort zone and prepares you for the growth zone, where you become a consultant, where you will find a purpose, you'll find your dreams, you will set new goals, and finally you will conquer your objectives and conquer the world. So just re-looking at this, the first talk of this today morning, all of us have learned that learning is a lifelong process. Doesn't end with fellowship. The key is future focused learning. So just fellowship is not enough. Look beyond that. Even if you don't have fellowship, keep learning. It's not just a qualification. Look for skills and look for competency. Look for those in people whom you're doing fellowship with. And if you do that, fellowship will be your part to your future, and not just your future, and success, but also fulfillment and the sense of flow. Thank you very much, Ashish. Thank you for having me here, and I hope to see all of you back in the evening or early afternoon once I'm back from Nashik. Thank you. We can't hear in yeah. Those who are on the Zoom can't hear. I think the sound is muted. Yeah. Just unmute it. Yeah.
Hello, am I audible on Zoom?
Yes. Yeah. Yes, it is. Yeah.
So thank you so much, Taral sir. We'll be having questions and discussions at the end of the session. Our next speaker needs no introduction. It is none other than Dr. Ram Chadda sir, who is a giant in the field of spine surgery. He has done his training from Sion Hospital, where he was a faculty for a considerable amount of time. He currently is very involved in teaching and training residents and fellows, and has a long-term fellowship under him. He has also sent us a recorded talk.
Key dynamics. As we evolve through the process of education, we go through various stages of training, and we to peers, to mentors ourselves, and someday maybe role models. Role models are those who have inspired us. We may have not physically met them or connected with them, but they are legends who have been the innovators and who have actually created the roads on which we walk. Then comes the mentor, the one who has physically handheld us, walked us through our entire journey when we are mentees, trainees, proteges. A mentor is someone who shares their knowledge and experience to inspire others to reach their goals. Professor Nandulad, Professor Ingalalekar. A mentor is someone who sees more talent and ability within you than you see in yourself and helps bring it out of you. They have halo parented me as we do to our colleagues and younger generation. They have created a wisdom bridge, enhanced the flow of information, knowledge, and wisdom, shared experience and intuition in developing discernment between what is right and what is wrong. They've been kind in all their actions, soft in their speech, and have calmness in their demeanor. They've taught life skills and learnings which blend wisdom and technology in orthopedics and traumatology. They've helped us not just prove but improve, and they have created within us the desire to excel. Then we have our peers. Peers are those with whom we work each day and spend time each and every day as we walk our path. And I quote Henry Marsh here, "It takes 3 months to learn how to do an operation, 3 years to know when to do it, and 30 years to know when not to do it." It's with our peers that we actually follow what our mentors taught us. These are various peers who have also walked the talk with me. And then finally comes the stage when we like to create our own legacy, where we hold an umbrella above others. These are the proteges whom we try to make better than ourselves so that they can achieve more than we could or we were able to. This is the ladder of maturity, and it's a progressive phenomenon. It begins with a situation when you don't know that you don't know. That's like when you enter orthopedics or any form of training. And then you gradually go up to a stage where you finally know that you know, and you do it so well that you will do it so well every time unknowingly. It's like getting a driving license. You play with the gears as a 16-year-old, then you get a learner's license, then you're taught how to drive, and finally you're driving so well that you're doing it at an unconscious level, and you can reach point A to point B without an accident, without a Google map. How does this happen? Well, it is maturity. You don't become a Buddha overnight from a Buddhu. It's not an instant awakening. It's unconscious incompetence. I don't know that I don't know, which becomes conscious incompetence. After 6 months or a year of training, I know what I don't know. Then comes conscious competence around the time that we clear our examinations. I know that I know. Knowledge is there, but experience is still not there. And then over the years comes unconscious competence. Whatever I do, I'll do it well. Incompetence is because of lack of information, understanding, and experience, while competence comes by listening, contemplation, and then implementation. Maturity is a progressive phenomenon. And to achieve this, mentors need to inculcate within the mentee a desire to align themselves with highest work ethics. What is this? This is Disneyland, and I quote Walt Disney. Whatever you do, do it well. Do it so well that when people see you do it, they will want to come back and see you do it again, and they will want to bring others and show them how well you do what you do. That is what a mentor needs to inculcate in a mentee. Quality begins on the inside and works its way out. Quality of what we give to others comes with the quality with what we have. What we have depends on what we do, and what we do depends on what we are. Be truthful and transparent, and that will enhance performance and develop final trust. Always align yourself to the highest work ethics. There will be times when you will be unhappy. And why is that so during your training days? Because in pushing the lower, the higher delights. That's a caterpillar to the left, transforming to a butterfly to the right. Just when the caterpillar thought the world was over, it became a butterfly. It's the end of the world, said the caterpillar. It's just the beginning, said the butterfly. Struggle, suffering, challenges, tough times are words of a man being pushed without recognizing that the higher is delighting. When you say that the caterpillar is being pushed, look at it as a butterfly being born. Every time man is pushed, the creator delights. Every time the mentee is pushed, the mentor delights. He helps us choose between pain and pleasure, between right and wrong. Instincts, part of the limbic cortex from within, and conscious, part of the neocortex from without. Horizontal exposure gives us vertical expertise. In pushing the lower, the higher delights. Our patients come to us with a lot of hope. They wait outside our clinics. It's when we touch them, feel them, interact with them, share empathy and compassion, that hope becomes belief. And finally, when they shut their eyes and go under anesthesia, letting you operate on them, they develop trust, hope, faith. belief, trust. They are all part of that particular full assurance in the heart, an acronym for faith that we need to develop from mentors to mentees and in future. It will only happen where the heart, the head, and the hands are in sync. We have to balance the heart and the head. Wisdom in the heart overcomes the worry in the head and empowers the hand. As mentors, the mentees need to have a balance between experience and evidence, which is expertise. Experience tells us why from the heart, the purpose of doing something. Expertise tells us how, the head, the process. And evidence tells us what, the product, which is with the hands. Always begin with why. Why are you doing something for the patient, surgical or non-surgical? The decision is more important than the incision. Decisions are made on your value system, your virtues, your training, what you have inculcated from your role models and mentors. The value system does not succumb to peer pressure, vulnerabilities, fad, fashion, and influence. Intuition needs to come from within, and tuition comes from the outside. Take decisions, make them right. There are no right or wrong decisions. You have to take the decision from within and work towards making it right. And how does this happen? This happens based on two pillars: communication skills and teamwork. In communication skills, it's 7% the spoken word, verbal, 38% the voice, vocal, and 55% the visual or body language. This is Mehrabian's 7-38-55% principle. It's verbal, much less than vocal or tonality, and much less than visual or body language. Why do we need a team? We need a team because you must see someone else's strength as a complement to your weakness and is not a threat to your position or authority. And I quote Ratan Tata: if you want to walk fast, walk alone. But if you want to walk far, walk together. We and not me is the road to success. When I becomes we, illness becomes wellness. Always remember, mentors need to inculcate this into the mentees. They should have a passion for purpose, compassion for their colleagues or co-workers, and dispassion for the designation, the position, or the power. This mention to the corner, to the left, Mahendra Singh Dhoni, I think he's an epitome of a mentor. He is very passionate about his purpose, winning the trophy, has extreme compassion for his colleagues. Look at his team. And he's dispassionate. He's right at the rear while he's handed over the trophy to his entire team. Be humble in aspirations, graceful in success, but resilient in failure. Be vulnerable. Be fearful. Each one of us as mentees are just rivers. It is said that before entering the sea, a river trembles with fear. She looks back at the path she has traveled from the peaks of the mountains, the long winding road crossing forests and villages. And in front of her, she sees an ocean so vast that to enter there seems nothing more than to disappear forever. But there is no other way. The river cannot go back. Nobody can go back. To go back is impossible in existence. The river needs to take the risk of entering the ocean, because only then will fear disappear. Because that's where the river will know it's not about disappearing into the ocean, but of becoming the ocean. A mentee has to evolve and become a mentor. Always remember that you should strive in your effort as a mentee, as a protege, as a river, or as a Jivatma, and then surrender to his grace, the mentor, the role model, the ocean, or the Paramatma. God bless you. All the best.
about more is like a dil ki baat, stuff which I feel a little strongly about, not necessarily completely structured, but I think things which are important, especially for the younger bunch. And I was asked to cover in terms of fellowships. There's some stuff I will talk about there. Research, which I think is something we are very much lacking in, and need to work up. Academics, especially structured, but I think things which are important, especially for the younger bunch. And I was asked to cover in terms of fellowships. There's some stuff I will talk about there. Research, which I think is something we are very much lacking in, and need to work up. Academics, especially for those of us who are in private practice, and what you do in clinics or clinical practice. So fellowships, today I think the likes of our seniors, they are generalists. Today more and more we are tending to get into certain areas and not do everything. So to get that amount of exposure, to get that amount of confidence, certainly you need fellowships where there is volume. And even those of us who want to do mainly trauma, even trauma is actually becoming a specialty today with the kind of trauma that is occurring now, which we didn't used to see when we were training. Which kind of fellowship should we be looking for? I think the importance here is to become a specialist in a region, rather than a specialist in a procedure. I've stood on the stage with a well-known arthroplasty surgeon, and who says that, I know nothing about high tibial osteotomy, so I don't do it. I think that is not the right way to go. If you are doing a particular region, you should know much about that particular region and not just be a surgical sort of technician. There is a talk I noticed later today about interdisciplinary stuff, and many of the good orthopedic surgeons, especially in America, where it's easy to move from one sort of specialization like engineering into another, they've brought all their knowledge of engineering into orthopedic surgery. So even today when I am talking of, say, I'm teaching Elizarov principles or whatever I've learned about Elizarov, a lot of that is useful for me when I do arthroplasty. So this cross-fertilization is important. Should we be doing it after MS, which is the current trend? I don't think an orthopedic surgeon after his MS is mature enough to even really make that decision as a general rule. There may be exceptions. And I think having a good general orthopedic experience is important, because even say when you're doing arthroplasty, you're going to see fractures. There is always something of this happening in the other side. And it's good to have a good amount of general orthopedic experience for a couple of years, because ultimately all surgeons will peak not very early. Surgeons really start peaking 40, 45. And you have to train yourself to be the lambe race ka ghoda. It's not a matter of getting out of MS and then starting work immediately and making lots of money. I think once you're well trained, then automatically work does happen. Many of us, when we've trained in particular techniques, we trained abroad. I think today most cities in Mumbai, in India, will have adequate experience or adequate volume and high quality work in things like spine, arthroplasty, trauma, and therefore it's not absolutely necessary to go abroad for fellowship. And as most of us who have been abroad will be able to sort of vouch for the fact that in the West also shit happens. It's not that only we do crap. And Gora also jhoot bolta hai. It's not that only we talk about it. So you have to look at the quality of education that you are getting. Yes, if you want something under your name in terms of on your visiting card, that's fine. But if you want really something to learn, then you have to do a fellowship, and a fellowship takes time. These 2 weeks, 3 weeks, 6 weeks, which become fellowships on the visiting card, really are of no help in your own personal development. Research is important from the point of view of, to me at least, primarily as an audit and as a self-improvement. Am I doing things well? Are things happening the way that I want them to happen? If I have treated 10 non-unions, have all of them healed? The ones that didn't heal, why they didn't heal? So as a part of a regular sort of self-improvement program, we lack as students, I know as a consultant today, I lack a very strong research culture. You put me in any surgical situation, I can find my way out of it. But in terms of research, no. And why is that? Because we did not inculcate that culture. All the work that we did was clinical. And it's time, especially for the younger guys, to kind of bring this as part of your work. Because if you have not written it down, if you have not published it, there are n number of people who will go with this. I have done 25,000 cases of this and 5,000 cases of that. The strength with which you can sort of argue that, you know, my 20 cases of XYZ are published and this is what we found. It deflates a lot of these empty claims, apart from the fact that it helps us to improve. What do we research? We don't really have the facilities for some earth-shattering basic research, but certainly the simplest stuff, taking a single question, we can look at answering it. For example, one of the things that I am looking at now, very simple. When we do a high T-well osteotomy with the way that I do it with a fixator, is the posterior slope changed or not? Right? I think that's important because opening wedge shows you increase the slope, closing wedge shows you reduce. If I can show that with this, the slope doesn't change, which is what I believe, that is a small point or a small step kind of ahead. And even if you don't have large volume, which in private practice you may not, but you can certainly, you know, publish case reports, case series of some interesting stuff. And I think this should start from the level of post-graduation. Just like postgraduates, by working in a sort of relatively harsh environment of working hard, pick up a lot of things. Publishing research also should happen in that. Old horses like me also have to learn new tricks, but that is difficult now. If you do this from post-graduation or from a younger age, I think it is certainly better. And now we have quite a lot of people who are actively sort of propagating this research agenda, and I think that's a good thing. I found teaching to be my most important way of learning. When I have to stand on a stage and talk or teach the Elizarov method or whatever it is I'm talking about to 30, 50 people who are otherwise supposed to be the cream of medicine, I can't sit and bullshit them. So I have to have my stuff very clear. I have to have my understanding very clear to be able to teach something. So I think that is, for me, self-help also, and it's a way of sharing whatever it is that we know. And today, I think even in the private sector, this is happening because traditional models of teaching are completely going down the drain. The guys who are supposed to be teachers take salaries for teaching and service. Unfortunately, that is not happening in a lot of places. And if you look at most of the successful people, they will be good teachers also. I think most of the people who are doing good work take that time to teach and spread their message. And as I said, there's more and more quality teaching now happening in the private sector. You cannot divest the teaching part from your practice. Now, as far as the clinical part goes, the one thing that I can say with personal experience is money, fame, etc. is something which can come, can go away very easily. Your own reputation is something which nobody else can snatch from you. You are the only person who can put your reputation down the drain. And being ethical and being successful, these are not two mutually exclusive things. Today, there's so much talk about the problems with medicine. And all of us are very gung-ho about defending ourselves. Oh, we do good. Of course we do good work, but we do wrong stuff also. Which of us can't afford a good meal? We don't need pharma companies to pay. If we go and we go for a conference, we will go in a 3-star. And when a pharma company takes us, it has to be a 5-star. I think nobody kind of says this to ourselves because we are scared that, okay, we will be taken as, or it'll get out into the public. But it is true. Gut practice is true. You can justify it all you want, that, oh, the whole world is doing it, etc., etc., etc. But then, you can justify almost anything if by that way of justification. So, ethical practice is a symposium in itself. You can spend half a day talking of ethical practice. But I think that is something which is very much doable, and you will see, if you look around, you will see very many examples of ethical practice, and I think those are the ones to be followed. Today, doing research in a private practice setup is not difficult with things like your ability to take pictures, your ability to scan stuff. There are enough gadgets around which you can use to keep a record. You may not start writing today, but whatever you are doing, if you keep a record of them, that is not difficult at all. But I think the two things which are important are the creation of some kind of a team. And these teams would be your own peers, where you're talking of not specifically group practice, but people who gel together well in terms of doing research, and also subordinates. Because you yourself as the individual star performer, the days of KT Dholakia, I think, basically are gone. There's no more single star, who's the best surgeon in the city. Never going to happen. And the more we build up our team or our subordinates, the more we are free to sort of sharpen the axe, because you have to do your work and you have to keep up to date with simple things like when we got out of medical college, V nails and K nails was what was. So we learnt interlock nailing, which today's resident is staple. We learnt it on the job. So this is an area where we are never going to stop learning. And I think mixing up all of this is the key to maintaining yourself in terms of the cutting edge. Thank you.
नहीं शेयर नहीं करायचे डॉक्टर मिलिंद चौधरी ऑनलाइन आहेत. Thank you very much, sir. And Dr. Taral Nagda and Dr. Mangal Pariyar have joined us online. And I would introduce our next speaker, Dr. Milind Chaudhary, who is joining us from Akola. He's just flew in from Japan last night and unfortunately couldn't be with us in person due to these circumstances. Dr. Milind Chaudhary is a mentor to a lot of people. He is a leader in the field of Elizarov, and he was one of the pioneers of Elizarov techniques in the country. When we were training in KEM, we have only heard legendary stories about him and how he trained with the man Elizarov himself, and was a fellow with Dr. Dror Paley. Today, he's here in the context that he's running a successful fellowship program for the last 35 years. And he's got fellow number 104, 105, which is going on. So it's a very good structured fellowship program. And this is where Dr. Milind Chaudhary comes in to talk to us about it. I welcome you, sir. Good morning. And you out of your jet lag.
Hi.
Welcome, sir.
Thank you, Dr. Ashish.
You can share your screen, sir.
Yeah. Host as disabled participant screen sharing.
So we'll make you a co-host now.
Okay.
Yeah, you are the co-host, sir.
Okay. Right. So, yeah. So thank you very much, Bombay Orthopaedic Society, and especially Dr. Ashish Fadnis and the organizers of this course for kindly inviting me. I hope I'm qualified enough to speak. I'm going to give a rather plebeian talk, a rather simple, talk, which is based on, the nitty-gritty of, conducting a fellowship program. So what you see over here is the photograph is the statue of David by Michelangelo. Now, some of you may have had the good fortune, at least in the faculty, of seeing it in person, as I did, as a very young and impressionable intern in Firenze, in Florence. It was crafted by Michelangelo. Very few of us know that the name of the person under whom he apprenticed. He apprenticed under Master Ghirlandaio, who was a very big name in those days, but Michelangelo's name remains. So the difference between apprenticeship and fellowship is what we are trying to, put across, that an apprentice can eventually go on to become a great master himself, but so can a fellow. Apprenticeship was a concept in the medieval times when you had to learn your craft, not necessarily through universities, but by apprenticing yourself to a specific person who had the licenses without which. So that part is taken care of by our residency. Now what we have is the possibility of learning, extending our learning beyond what our teaching institute can give us. So here's going to be a brief talk on the possibility of clinical fellowships at CFIT India, that's Center for Elizarov Techniques, at the small city of Akola, which we've, and this is going to be a brief talk about what you can expect and what you may not expect out of a fellowship. So you will get to learn a lot from the patients and the combined experience of CFIT India over all these years. And of course, from me, which is going to be one of my privileges. It's one of the privileges of my professional life to interact with young surgeons and to also learn in the process and to be able to teach and refine the understanding of. We have had the privilege of being the longest continuously serving center for limb reconstruction in India since 1989. And that means you have the ability to see a lot of things. You have access to data that goes back almost all the way to 1990. We also have publications in all these important journals, OCNA, the JBJS, JPO, North America, IJO, etc. And these have been co-authored by fellows. So we have had the privilege of hosting at least 104 surgeons so far. And we've had the privilege of, sharing our experience in all these countries, over the years, multiple times. And also not to forget the smaller ones like, Egypt, Poland, Mexico, etc. So as a young surgeon, what does all of this mean for you? You get to learn and see, you get to immerse yourself, you get to participate, you get to learn and see these topics. You get to learn almost virtually everything about limb lengthening and advanced deformity corrections. You get to participate in a chunk of pediatric orthopedics, which is pediatric deformity correction, pediatric lengthenings. You get to participate in, tendon transfers and the treatment of cerebral palsy. Most important, on a day-to-day basis, you get to participate in post-trauma reconstruction, which is the need of the hour, and it's the unsung epidemic of India. It's the the continuously present status in India is the post-trauma sequelae, which at least 10% of this humongous load of of the dubious distinction of having the largest road traffic accidents in the world means that we have the most fractures. Recently, I was in Japan and they have very little road trauma for various reasons. And we have so much. And at least 10% of these go on to non-unions. This is a 30-year-old statistic. Now with the high energy trauma, with so much required, so many residuals of bone gaps and shortening and deformities and infection, we have this stuff going on every day. And it can extract every ounce of your skill, ingenuity, patience, and hard work to give these people a good result. What you'll also see is club feet being treated at all ages, from tiny babies from the first day after birth, because I had the privilege of not a fellowship, not an apprenticeship, but of observership with Dr. Ponseti himself in the year 2002. You also have the ability to see a lot of knee and hip joint preservation. So this is what you're going to have, and much, much more. You get to do the clinical exam. You get to refine yourself in clinical examination, muscle charting, gait analysis. I remember the time I spent in Children's Orthopaedic Hospital. I watched Dr. Miss Perin Mullah Firoz, who headed the CP unit, and Dr. Eddie Bharucha was the neurologist who came there. And they would see the patient and touch him for a couple of seconds and then dictate the muscle charting and the clinical examination. We learn to do muscle charting for all the neurological cases. We have this myelomeningocele, we have, CP, we still have residuals of polio, which we treat almost every month. So you learn, and you'll be able to do routine trauma, and with special emphasis on casting techniques. We have this thing about plaster casting. It's the oldest known tool in the armamentarium of the orthopedic surgeon, and it sees the maximum use either before or after, the Ilizarov and the sophisticated technology. So you'll see all of this in the latest. You will get to do preoperative evaluation, the post-op care of external fixation, which is such a specialized topic. And more important, you will learn record keeping, statistical analysis, and watch this, presentation skills and publication discipline, and much, much more. You'll learn the art of presentation at local, regional, state, national, international conferences. Do you know that in Akola, over the last 20 years, we have a clinical meeting going on non-stop every fortnight? I do not believe any city in India has a clinical meeting every fortnight. We present cases and all the fellows get to present every fortnight 2 patients, which they have to work up and study and answer tough questions. And what can you also expect to do? Our fellows, the diligent ones, have won 3 gold medals of the Masala Wala Best Paper session in Vairok. Do you know, young folks, that it's difficult to get your paper into the Masala Wala session? 3 of my illustrious fellows, Dr. Lakhani, Sagde, and Agarwal, have won the Masala Wala gold medals. So it can come when you are sincere and you have the ability to imbibe. You can learn the art and science of publication in general, specialty, or index journals. So let me give you a brief overview. This is Pratik, who co-authored the double level fixator assisted nailing paper with me in the British JBJS. This is Bhushan Sagade, who had the privilege of, being the author of the congenital posteromedial bowing. We actually have the largest series in the world, 28 lengthenings in this extremely rare condition. And all these fine folks, Dr. Naeem Jagani, Dr. Ishani, all of us have worked very hard on this. This is a paper on the newest high tibial osteotomy, co-authored by one of my recent fellows. This is an old paper in JLLR, 9 years old, with so many of my fellows who visit. This is another one recently in JLLR on intra-articular osteotomies. This is another one with a lot of my visiting fellows on new management, and so on and so forth. There's a lot of ability for you to participate in this and gain credit. So you can be prepared for a life of high earning and a highly satisfying career, because you can fall in love with what you do. Well, you get to stay on the campus, and be taken care of. And in return, what is expected of you is, of course, simple things like hard work, sincerity, initiative. You need to do a lot of reading if you want to make use of your time, because knowledge is expanding explosively. Do you know what is the single largest attribute that a person in today's world can have to succeed? Is the ability to learn. Learning how to learn is going to be the one skill that you need that will take you forward. Okay. And of course, what you need to have is a desire to serve the population, because serve your patients, do what's needed. You need to be able to have the desire to participate, such as this conference we hosted last year. Do everything that's needed. So I'll share this very brief video with you.
I'm from Goa. I'm a limb reconstruction surgeon, and I have had the proud privilege of being a fellow of Dr. Milind Chaudhary in the later half of 2004. The most important aspect which I learned in my fellowship was the ability to identify problems and the capacity to make a decision in what direction it would help the patient the most.
This is Dr. Aditya Apte from Thane. I had the pleasure of working as a clinical fellow with Milind sir at CFIT Akola for 1 year. By the end of my fellowship, I was confident enough in performing all complex Elizaro and deformity correction surgeries. During my tenure, we also published 3 papers in international journals, and I was able to present our work at multiple national level conferences.
I am Dr. Ravi Badiadra from Surat. I did my fellowship last year. Unique aspect of this fellowship was I was able to learn Elizaro from basic to advanced. The number of patients was so good, so that I was exposed to variety of cases like deformity, non-union, infection, limb length discrepancy, and also congenital deformity. And the treatment with white, Elizaro, hybrid fixator, LRS, hexapod. And I also learned importance of plaster technique. And now I'm confident enough in approaching this kind of complicated cases.
So are you ready for the journey into the world of the art, science, and practice of limb reconstruction? Thank you very much, Dr. Ashish and Bombay Orthopaedic Society, for giving me the opportunity. I had the privilege of working as an unofficial fellow with one of the greats of BOS, Dr. Nandu Lad, as well in 1987. And it's been a privilege of my life to share this journey of learning with younger folks. Thank you.
Thank you so much, sir. Our next speaker, Kenny, sir. He's a pediatric orthopedic surgeon. He's done his training in he further trained in South Korea, in US, and in Eastern Europe. And he maintains a busy practice, but always takes time out to come and teach every possible way. He's been associated with research, academics, and learning all throughout. So I welcome Dr. Swapnil Kenny, sir, and I request him to share his thoughts.
always a difficult task, especially when you're following such illustrious surgeons. Having said that, I have the opportunity of being here, the privilege of interacting with all of you all. Also, probably the opportunity to wake up from the slumber, which most of us and you guys start or have started this morning with. So before I actually move on to my talk, I would need answers to questions in my mind about you guys as the audience. Now, what I want to know from you, any one of you or from a few of you, why are you starting it? Just let me do what I want to do. Yeah. So from, yeah, thank you. So what I want to know from you is, what do you guys feel is the difference between senior residency and fellowship? Anyone? Any one person? Difference between senior residency and fellowship? Nobody knows. So the probable difference is that in senior residency, you get to do more than what you get to do in fellowship. What I'm trying to imply is that senior residency or residency is underrated and fellowship is way overrated, for the simple reason, because in residency, not only are you exposed to all the elements of orthopedics, but you also get many, many more opportunities to do hands-on training, which you may or may not get in a fellowship training program. Now that nobody is interacted with me, let me ask the next question. Let's see if you've woken up. So why do you feel you need a fellowship? I would want a show of hands. Do you feel because everyone seems to be doing it? Anybody? Show of hands as you raise your hand up. Yeah, one person has said because everyone else is doing it. It adds to your CV. Few of you. Better salary? Absolutely. Improve quality of care? Almost everyone. So I suppose that is where we come from. At the end of the day, it's also about improving the quality of care which you give to your patients. But how do you actually validate the quality of care? Now, the Six Sigma concept is something which was described by an engineer working in Motorola in 1986. And what essentially is the Six Sigma strategy? Six Sigma strategy essentially is improving the quality of a skill or a product. And how do we do that? By quality management methods, by trying to define something called as the value targets, so that you reach a level which is almost near the normal curve within 6 standard deviations of what is perfect. So the idea of quality care per se is to try and reach a level of care which is almost equivalent, if not better, than the standard level of care which has been prescribed. And trust me, like in films, it's said that only 3 reasons why a film works is entertainment, entertainment, and entertainment. Over the last 20 years of my practice, what I've realized is that career sirf 3 चीजों से चलता है: quality, quality, and quality. Everything else, your hype, your number of cases, your PR, your family physician network, everything is secondary. So how does one define these fellowship goals? If you look at the Six Sigma strategy, they have given various steps or stages by which you can actually self-evaluate yourself before, while, and after doing a fellowship. And these steps are very clearly defined. So when Sachin goes or used to go to play on a particular ground, other than analyzing the opposition, he would also come and look at the pitch conditions and then decide how he was going to bat. Similarly, when you're looking at a fellowship or when you're joining a fellowship, there are a few questions which you need to ask yourself and answer them. Where are you coming from? Are you coming from a government institute? Are you coming from a private institute? Are you coming from a postgraduate institute? Are you coming from a medical college? Where are you at present as regards your own skills? And this is somewhere you don't have to lie to yourself. You have to ask yourself, okay, where do you stand today as regards your skills, your surgical skills, your presentation skills, your academic skills, your research skills? The third thing you have to ask yourself is your goal aligned with the plan which you set out to be? Whether this fellowship is going to get you that. We get a lot of people who refuse senior residency at Bhabha Hospital and then go for an obscure fellowship somewhere in southern India where they are the 10th assistant of the 4th fellow of the surgeon, saying that this is a fellowship. Now, does it really count for anything? 10th assistant, the 10th fellow of the 4th assistant? No. You know, the tag really doesn't have any value, but at the end of the day, we had a fellow coming to us after working for 4 years with a joint replacement surgeon, and Nikhil will endorse this, and he didn't really know how to hold a periosteum elevator. Is that the way you want to go ahead? Probably not. And will this training program help you achieve these goals? If you want to do, say a joint replacement surgery, you cannot go to Dr. Milind Chaudhary's center at Akola because the fellowship is available, right? It has to be aligned with what you want to do in life. The next thing is, when you're on a fellowship or when you're in training, improvement is very important. Now, 24, it is 12 months a year, whether it is raining, whether it is cold, whether it is warm, whatever it is. He need not train because he is Lionel Messi, but he does that. Why does he? Because he needs to improve his skills. So it's an ongoing game. It's an ongoing process. You need to improve your communication skills. It's very important. You will not get a patient on table unless you convince the patient, right? To convince a patient, your communication skills have to, your clinical examination and diagnostic skills have to be good. Otherwise, you will go wrong. We've seen patients, neurological problem, and people are operating their club foot, not understanding that the cause of a club foot is actually a spinal dysraphism with a tethered cord. If you treat a club foot with a patient who's got a tethered cord, it will always recur, right? The next is observational skills and learn to imbibe. Look at the master, what he is doing. Not only in his surgeries, his demeanor, the way he holds an instrument, the way he dissects, the way he goes through soft tissues. It's so important. And that is where this power of observation comes. And you need to develop or inculcate it over a period of time. Most important, research skills. Tomorrow, when you go abroad for any fellowship, okay, the only way they will quantify or recognize you is by the number of papers you've published. Nobody is going to ask you कि मैंने यहाँ पे इतना काम किया था, वहाँ पे इतना काम किया था, इतना cases किया है, or your logbook. They're only going to see your publications, and if they are in good journals with international repute and index, only then are you going to move ahead. The next part, which I am very, very passionate about talking, because I see a lot of people lose control in today's day and age, is how you control the things which do not matter in the long run. Unimportant aspects of life. Being present on social media, having a nightlife, non-academic distraction, being on non-scientific forums. So all those things are important. Yes, I completely agree, but not during your training period. You will probably have a good amount of time later on once you're established to have all these things. But when you're training, please be on the job. Do not take shortcuts because they will lead nowhere. You need to define what you need to do in life as you need to define what you need to do in a training program. What do you need to learn specifically from a training program? At the end of Dr. Mangal Parihar's training program, if you learn how to plan a surgery, how to put the wires, okay, that's all you need to learn. You need not learn the high funda surgeries, high table osteotomies and those things. The basic stuff, that is what is important, and then you can evolve over a period of time. How much depth do you need to go into, right? You cannot be a medial compartment surgeon, right? You cannot be just a medial compartment surgeon only doing a high table osteotomy or a unicondylar knee arthroplasty. You need to go much beyond. You need to define whether you want to be generic or you want to be specific and how specific you wish to be. Level of research, again, very important. It is something which is underrated. We have so many cases coming to us in public hospitals. Nobody bothers to publish. Then you get an email 1 year down the line, sir, I'm in the UK. I desperately need a publication. What should I do? Boss, you were here for 1 year. What the hell did you do? And most importantly, your academic goals. Whether you wish to get into a teaching line, whether you wish to get into private practice, or whether you want to measure of everything. The next important thing is your personal audits. Every time, every month, every day, every week, you need to sit back and think as to what you have learned, whether it has made you a better surgeon, whether it has made you a better clinician, whether your core competency skills have improved, your scientific knowledge of a particular specialty, the way you speak about a particular specialty in which you are, has that changed or is it the same? And whether you've become a little more proficient in finding solutions to a complex problem which your peers or your colleagues may not. Again, a complex statement to make, but what I'm trying to say is that, are you trying to see now that you are finding solutions to problems, or the problem is still there in your mind? If the problem is still there in your mind, you need to go back to the drawing board and start learning. So again, these are the 6 ways by which you can analyze, do a self-analysis and improve, control, define, and measure. Now, unfortunately, because we had to kind of switch from Keynote to PowerPoint, maybe a few slides may have an issue. But I'm going to share my fellowship journey as regards what I learned in addition to academics. And what I've learned is that interpersonal relationships are extremely important. Now, this is a child who has obstetric brachial plexus paralysis. And to examine this child, you may know all the tests, but do you know how to keep the child calm and examine the child? That is what should a fellowship teach you. How to interact with a person and get better at doing and examining patients, in this case, children. The second thing I have learned is a keen sense of observation, which you will never have in your residency because it's a very busy practice. But here, when I see this child getting up and having a positive Gowers sign, I know that I'm dealing with a Duchenne's muscular dystrophy. I did not go beyond it. But a keen sense of observation helps. So the next time when you are in your OPD, please observe your patients. A lot of stories can be seen without being heard, without being told. The next thing I've learned is that the devil is in the details, and every surgeon worth his salt who believes in preoperative planning will tell you that the devil of every surgery is trying to break it into small pieces and planning each and every detail. So every difficult surgery, if you look at it, is essentially about breaking it up into simple parts and then planning each part in detail. And eventually what you felt as a confusion and you put the pieces together, you will be surprised that your jigsaw is completely solved, right? So plan, 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 and plan. I do see a lot of people coming to us at Bhabha Hospital. We do a lot of deformity corrections. Unfortunately, none of them come with a plan. They just come, they wake up in the morning without even taking rounds. They just come there, and when you ask them questions, they are completely blank. So they do not come with a plan, but they feel that you should allow them to do surgeries. Now, if somebody doesn't come with a plan, how are you going to allow them to do surgeries, right? So planning is extremely important, because unless you plan, you cannot foresee what issues are going to be there, what complications may happen, and how you can overcome them. So this is in essence about the devil being in the details and your level of surgical planning. So this happens the evening before the surgery. Every case is planned and every case is then executed as per the plan. The next thing which I have learned is essentially about the power of illumination and magnification. Again, something which is totally underrated. Imagine I see residents today operating at the same level of table which the mama has set in. Okay, not bothering about how the OT lights have to be kept. And that is a crime because the table moves in all planes. Okay, you can have your lights, you can wear a illumination, you can wear loops, and it makes a huge difference in the long run. Okay, this is something which I learned in my fellowship. Positioning of the patient, height of the table, illumination, the use of magnification, again something which is totally underrated, but something which you need to learn and inculcate in your practice because it makes a huge difference. The next thing I have learned is the necessity for long-term record keeping. Okay, when you keep records and when you need to deliver lectures 10 years down the line, your records will help you. Nothing else will help you. So you don't need to derive a picture from the internet. Okay, all your records will fall into place. So this is a case of a post-septic hip sequelae where we have done a PSO followed by a lengthening. And we have a follow-up of over 5 to 6 years in this child with the entire post-operative story of this child. Now, this is such an important teaching slide. In one teaching slide, you're teaching about a post-septic arthritis, you're teaching about a PSO, you're teaching about lengthening, you're teaching about deformity correction, you're teaching about alignment, and you're teaching about clinical examination. The next thing which I have learned, and again, the slide is screwed up because of this issue, is precision over pace. Okay, we have this thing about being a very fast surgeon. Being fast is not being efficient. Having said that, you cannot spend 14 hours over a scoliosis correction. That is also not correct. But precision is important. Like this case which we did, a double level osteotomy, which is a coxavara and a proximal femoral osteotomy. We had to be precise in doing our corrections so that we could restore the neck shaft angle and at the same time correct the proximal femoral deformity, right? So planning, but also precision over pace. The next thing which I have learned is taking calculated risk and having a plan B and a plan C. Now, this is a girl who came to us, 2 failed surgeries for torticollis. She actually had a spinal problem and a secondary torticollis. She had a missing C1 arch from one side. So she underwent a 3-stage surgery. The first stage was release of the torticollis, which included a pediatric orthopedic surgeon, a spine surgeon, an ENT surgeon, and a plastic surgeon. So that was the plan B, plan C, plan D, and number of teams working. Then she needed a halo traction, then a halo waist, and eventually a OC2 fusion. So this is how you need to take calculated risk, but at the same time, have all your plans in place. What I've also learned is the merit of recognition that comes with research. And this can only come to you if you're diligent in starting research from day one. I have been very fortunate to work with people and publish over a period of time in international journals like JPO, JBJS, International Orthopaedics, and Acta Orthopaedica. They could not have been possible had it not been for working diligently, keeping cases, and publishing them over a period of time. So extremely important that you publish, especially when you have the time. I've also etched a very strong bond with mentors, and this helps big time. This helps you in taking a lot of those decisions in life where it is more than it may be a decision of practice, it may be a personal decision, it may be about a particular case, but knowing mentors, being in touch with them, and maintaining that kind of a camaraderie is extremely important when you are training and even after training. I've also learned to work as a team player and conduct a lot of scientific events thanks to the team. This was a team in 2015 where we did the Golden Jubilee Wyrock. Not that I've learned it from a fellowship, but I have learned that when you work as a team, you can only succeed. When you work individually, you have your own limitations. Last but not least, what I have learned is that you need to give back from where you've learned. So developing an inclination to teaching and the hunger to learn. Unless you have this inclination to teach someone else, you will never learn. And this is true even in your registrar's post. When you're teaching your houseman, you will go back and read. And when you go back and read, you will learn more. So you will become better only by teaching, not only by reading. So to summarize my talk for today, Fellowships are like symbiotic relationships, right? Now just think of the symbiosis between Jay, Viru and Thakur, right? They came because they wanted money. He came because he wanted to kill someone. At the end of the day, we have a blockbuster, probably the biggest blockbuster the country has ever seen, or one of the biggest. So fellowships are symbiotic relationships. They don't only last till the period of the fellowship, but they can last for a lifetime. So please develop these relationships when you're training. Also, it's a two-way street, right? You can't only get things, you have to give a lot. In fact, you have to give more than what you take back. Because unless you give more, you will not get the same cake which somebody else who works hard receives. So essentially, the give and take tells you that the more you give, you will get a bigger chunk or a bigger piece of the cake. Now, this is metaphorical, but you will learn more when you're willing to work harder and willing to give more. If you're going to be the 10th observer of the 4th fellow, you're not going to get anything, right? Hands-on is something which you will benefit from, only get when you're active and interactive. Thank you.
Thank you. Thank you, Swapnil Keni sir, for a very insightful talk and sharing your journey. So we'll now be moving on to the next session, and that is, I want to ask the delegates who are present here if there are any questions for the first session. We have time to take maybe a quick question or two. All right, so we'll move on to the next session, that is opportunities in various subspecialties. So in this session, we'll be talking about different subspecialty options in orthopedics. And the first speaker is Dr. Siddharth Shah. So Dr. Siddharth has seen the best of both worlds. He has done a structured fellowship in India, the structured fellowship of ASSI, and has also done a fellowship training in Nottingham. So he's the best person to discuss about opportunities in spine surgery. We welcome Dr. Siddharth.
No. Present.
So you can either ask questions during the discussion, which is there, or you can put it on that Slido app, which we have said. So we've received a few questions. If you agree with a few questions, you can just upvote that so that questions will be taken by one of our panelists. Okay.
The first slide, can you? Yeah, that's not the first slide. Either the first idea. Good morning. Thank you for the BOS team for inviting me for this talk. This talk is basically structured on the subspecialty training in spine surgery. It's based on my experience and my journey through the training up to this point where I've recently started my own practice. I hope you find it useful, and I'll be happy to take questions at the end. Spine surgery has been known since Hippocratic times. That time we were more assessing ailments. The earliest record of a textbook is in the early 90s. But now we've come around to more specialized techniques. We come to endoscopy, uniportal, biportal, minimal invasive, tubular retractors, prone lateral positions, lateral airlifts, and so on and so forth. Our dissections have become smaller, our incisions have become smaller, but our spectrum of surgery that we can do has definitely gone wider and wider. So as long as we keep the eye on the target, there is no end to what we can achieve from a spine surgery. This has been partly aided with the advancement technology. We have the O-arms, navigation, high definition optics, cameras, exoscopes, all of that has sort of created a whole metaverse of instrumentation to help us do what previously was thought not possible in terms of what a spine surgeon can achieve in their lifetime of practice. Now, extrapolating all of that to understand where we are in India. So we have a very highly specialized spinal care, which tends to be patient-centric. And this is something which we realize when we go overseas, where some decisions are not based on patients, some decisions are based on cost. But here we tend to have a practice that is more patient-centric. There's a high impetus on endoscopy, minimally invasive surgery, both from the surgeons as well as from the patients who come to us asking that we want to do a stitchless keyhole surgery. There are select centers which we do have access to O-arm navigation, but the cost tends to be an issue with regards to access to these facilities. But the crux remains that we have a large volume of spinal practice in the country. There's a huge patient base. And as a spine surgeon in practice, you will come across every possible pathology from the skull to the sacrum. So the aim of fellowship should be to averse yourself with every possible pathology that you can see in the spine. And that's why your training or the center where you train at becomes very, very important for you to get that experience and exposure and confidence to learn exactly what spine surgery entails. Now, most of this has been talked, but just to give a brief idea of, I basically feel there are 5 main aspects of fellowship: the patient numbers, the opportunity for your hands-on learning, the academic appreciation where research, publication, conferences comes in, the access to recent advances, latest technology, latest procedures. These are things which your mentors would be doing and which you would be able to see and learn yourself. And the access to technology, O-arm, navigation, etc. So we extrapolate that into the spinal fellowship, then 2 modifiable factors come in: your technology, the O-arm, navigation, robot, neuromonitoring, your access to these things, and recent advances, because if your mentors are the ones who are doing MIS, endoscopy, anterior surgery, then you will be able to see them, learn them, and incorporate them into your own practice as you go ahead. So what should be the aim of your spinal fellowship? We often fall into this thought that higher cutting means a better fellowship, which absolutely is something I don't agree with. Surgical skill development is only one small part of your development as a surgeon. It involves more factors, starting from clinical assessment, reviewing imaging, extrapolating the findings of that imaging onto the clinical status of the patient to help you make a decision. And it's that decision-making skill is what requires the most training in your life. Once you reach that point, then you can move on to understanding how to manage complications. And then finally, most importantly, is the interpersonal skills and how to interact, handle, and speak to patients, because that is where you will manage your practice in the most effective way. Dr. V.T. Ingradikar gave a talk in my very early days of fellowship. It was a VIROC talk, and where he said that there is a particular chronology to learning spine surgery, and one should not skip a step. And I absolutely believe this step. These days, we often think that I should definitely go in for a fellowship, let's say in minimally invasive spine or some other form of fellowship where you want to skip a step and not focus on the basics of spine surgery. I believe your basic should start with learning how to do an open spine procedure, because when things go wrong in the more complex procedures, it's the identifying the landmark, clinically assessing the patient on table, which is going to be a salvage. So as long as you don't skip the base of the pyramid, the reaching to the top is much easier if you know your basics quite well. So whom we turn to? We turn to peers, colleagues, web resources, and teaching courses like this one, which the BOS kindly organized. So if we talk of hubs of spine surgery, these are the broad places where we can find spinal surgical training in quite depth and detail. This list is not exhaustive. There will be much more to these, but these are the prime ones we would focus on within the purview of this lecture. So if we broadly split them, we can divide them into those where we have a prospect of long-term fellowship and those where are more amenable to short-term training. Number 1 on the list is definitely India. And this comes out of personal experience where we have access to fellowships in India, both which are societal through the ASSI or the Indian Orthopaedic Association. But we also have the option for having direct mentorship, where you interact with a mentor directly and pursue a fellowship based on mutual agreement. We have both the options available, which vastly increases your availability to access the training which you need. The big advantage of any fellowship in India is the opportunity for academic growth. We have vast numbers of training programs, cadaveric courses, conferences, lectures, teachings, which goes on immensely throughout the year. And you as a trainee would have a great access to them, which is affordable. And that is a big factor, because once you go overseas, you will realize that any course, any cadaveric session you go to is a big hole in the pocket, which is not the case when you're training here. So you should definitely use the time in India to access as much training modules as you can, because they are freely available and accessible. One part which is more of a practical perspective is that training in India gives you an idea of local population, how to handle patients and interact with patients who are more adept to our population or our way of doing things. And it helps you with understanding nuances of private practice if that's your goal to come back at the end and work in India. Moving to UK has a wide spectrum of structured fellowships. They are available for long term. You also have the option of individually subspecializing in things like cervical spine, pediatric deformity, lateral procedures, anterior procedures. So you have multiple subspecialty training inside spine surgery also. There are different pathways, which I guess Nikhil is going to talk about, but we have an option of going via MRCS and also without MRCS to go to the UK. And these, some of them even tend to be Royal College accredited. So you end up getting convocated from the Royal College and have a certificate for that. And the good part is that all applications are centralized to NHS jobs. So you don't have to faff around looking at 10 different places. You can find that in one centralized directly. Speaking of other countries, Canada, Australia, Singapore all have opportunities for long-term fellowships. The disadvantage is that none of them have a centralized application process. So you need to individually go and apply to each university directly. But the good thing is that most of these places have websites which are very fairly informative. The point to note is all of them sort of list their own strengths, scope of practice, and spectrum of specialization. So it requires a good amount of research on your part to know what you want from the fellowship. And that way you can tailor down to what your institutes of interest are and then apply. The application process, the documentation is fairly standard and you can easily find that on any website. But it's just knowing where you want to go is where the crux lies and where you need to absolutely work on your research bit to decide. Short-term fellowships are at multiple places. That depends on what your subspecialty interests are. Like you go to Korea, you are more focused on endoscopy. Germany gives you more access to endoscopy and complex spinal work. The language barrier tends to be an issue in the longer term, but it's amenable to shorter fellowships. In USA, long-term fellowships requires you to have USMLE because you need to go through SF match, which is like the matching procedure, which it's like a counseling. But for shorter fellowships, you are amenable because you have certain societal fellowships where you can go visit a particular center for a couple of weeks and have an experience either as an observing fellow or a short-term fellow. Hong Kong gives you access to more of spinal deformity and complex procedures, but again, it's a short-term procedure or short-term fellowship that you're looking at. The caveats for all these applications is that, and this is the most important bit, there is a 2-year lead time from when you apply to when you eventually end up going there. Because the procedure, the documentation, verification, referencing, visa, everything, registration with the local medical council, all of that takes time. So it's important to keep that time frame in mind because you may have finished your residency now, but you may end up going 2 years later. So what you do in that 2 years needs to be planned. So you need to start working backwards and start preparing for it in a way that you don't end up wasting time before you go, just doing something which you were not planned to do. So keep that timeline in mind. Some prior experience in spine surgery is definitely preferable. And that comes down because there is a huge volume of applications now, which is coming through to all fellowship programs. So if you have some experience in spine surgery, that definitely gives you an edge above the other applicants. Publications, presentations, a robust CV, references is all very important, and some further speakers are going to speak about that. But all of these go to a great length in sort of putting your application at the top of the pile when you eventually go down to the interview stage. Now, if we come to the societal fellowships, many societies offer fellowships which are short-term or long-term. Most important for me, top of the ladder, is the ASSI fellowship. It's a 2-year comprehensive structured training program under exceptional mentors. All of these mentors are at the top of their field, and learning from them gives you the best access to any training that you will find anywhere in the world. It is backed by theoretical training as well, because you need to give an exit exam and you have a thesis. So it does give you that impetus to even have the theoretical bit of learning besides just being practically oriented. It gives you, again, exposure to academics nationally, and again, adaptation to local Indian work is something which is a plus point, which goes to any ASSI fellowship. Usual deadline is around June to July. AO Spine gives you access to both short-term and long-term fellowships, requires AO membership and a previous attendance to a AO course, but these guidelines are now being relaxed, because AO has come up with, if you have got a fellowship, then they give you an option of just registering for a course upcoming, which is going to be in the near future. You don't necessarily need to have had a course in the past. You need to go through a national fellowship before you can apply for an international one. And usual deadline for application is around 1st September. But if you see from that map, and that map is from the actual AO website, there is a wide range of host centers all across the world, except the US, where you have access to AO fellowship. So pursuing that does give you a wide spectrum of where you can go and apply for your fellowship too. The SRS gives you fellowship which are more deformity centric. So if you have interest in pursuing spinal deformity, then SRS is a good place to be, because the number of fellowships they award is quite big. So it's a very good chance for you to get a fellowship from there. It are usually short-term fellowships, couple of months, but they also give you educational scholarships. And these are good because the scholarships are for you to go and attend an SRS annual meeting or the IMAST, and which is a good way to expose yourself to what's out there. And that is sponsored by the SRS. So the application is centralized, so you don't need to apply multiple places, and you can just go to the SRS website and apply. Our usual deadline is around March. The SICOT, APSS, IOA, Indo-American Spine Alliance all have different fellowships which are available, which can be researched and applied to directly from the societies. Now, coming to observerships, and I feel observerships do play a small role in overall spectrum of training, because as an observer, you get to do what we call as observational learning. It's not about learning one thing from one person, but it's about learning the same thing from different people. And that's where you can develop your own understanding or way of how you would do that same thing if it was you who was operating that patient. So it's a great way of learning different ways of doing the same thing. It's a different vantage point to the same center point of attendance. Not all centers have all technologies available. So, and within the restraints of cost and time, you can spend a short amount of time as an observer at different centers and get access or understanding of different technologies which are out there and which you can learn from. Now, my journey, this talk has been on my journey from the time I finished my orthopedics to the time where I eventually got my FRCS. So in this time, it's been a balance of ASSI fellowship, which has been a long-term fellowship in the UK, but also small 1-month fellowships or observerships, as you may call, by multiple societies. And they have really given an enriching experience. So I would definitely urge everyone to apply for as many different varied specialties of fellowships that you can, because they will play some part in your ladder of progression to reach where you want to go in your practice ahead. And if I were to list 5 main points as take home from this journey, they would be these 5 things. 1, define your goal well, define your needs from the fellowship well, because it's not just about applying randomly to every fellowship. It's about applying selectively to a particular fellowship which will benefit you. So research where you want to go and reach out. Don't shy away from discussing with colleagues, peers, everybody who is here on the panel. All of them are here to help you out and to help you guide towards that decision that you want to make. Plan ahead. Your lead time is something that you definitely need to keep in mind, because that's going to be something on your timeline, one factor always comes in. The more you farther away you are from the time you passed your graduation, that at some point may count as a negative point in some of your applications. So you need to be very well focused in terms of timeline as to when you want to go for a particular fellowship. Application has to be absolutely robust, because it's your application that's going to convey to the panel who you are, what you've trained as, what your personality is, and what your interpersonal skills are. So review, re-review, ask a colleague to review, but make sure your application is robust before you submit that press button. And in my personal opinion, an Indian training is a must, something for everybody to consider if they have that at some point in their life. Thank you.
Thank you, Siddharth, for a very in-depth overview of scope of spinal fellowships. And you seem like somebody who's really done a lot of research for finding your own fellowships. And I'm sure all of us will agree with that. Our next speaker is Dr. Mandar Agashe, sir. He is a pediatric orthopedic surgeon. He has done his subspecialty training in Wadia Hospital in Korea and in US. He specializes in the treatment of pediatric hips. And I invite him on the stage to take us through his journey and tell us about the opportunities which exist in India and abroad in pediatric orthopedics.
Thank you very much to Bombay Orthopedic Society, to Ashish, to Nandan, and the entire team for inviting me for this symposium. So I'll be talking to you about fellowships in pediatric orthopedics. So pediatric orthopedics, unfortunately, is not a very, very popular field. I don't know, can we have a show of hand of anyone who is at least remotely interested in pediatric orthopedics? Are you at least a few? I hope to convert either three of them to either a few or more, or probably they will say, okay, we are not interested now. Anyway, so fellowships in pediatric orthopedics, how, where, and at what stage? I would like to acknowledge my colleague, Dr. Chasnal Rathod, who we discussed quite a lot about how to make this presentation. We started our journey in fellowships almost 12 years back after we finished our basic Wadia fellowship. And this is a combination of both our journeys. So why do you want pediatric orthopedics as a career? Well, basically, so when I started off in orthopedics, or even as a student in KEM, I had a few mentors. One of them was Dr. Taral Nagda, who was my lecturer when I was a student and an intern at KEM. And Dr. Binoti Sheth, when I started my senior residency in KEM, she was my lecturer. And typically, senior residency is a time when we decide where we want to go. Passion or interest, pediatric orthopedics it has a long learning curve. It's a difficult field to start and difficult field to practice. And you really have to have a good amount of passion and interest in order to go to pediatric orthopedics. And you should be able to deal with all aspects of orthopedics for that child. So you should be able to treat its trauma, metabolic conditions, deformity correction, tumors, some basic knowledge of spine also. So this is a field which requires a knowledge about every aspect of orthopedics. Why you should not? So this was encapsulated today morning when I parked my small little Aura next to Ashish's Mercedes. So please don't do it for the money. Pediatric orthopedics is one thing which doesn't pay much, at least in the start. But so if you are very financially oriented, you can probably go out for coffee. So pediatric orthopedic fellowships. So this is a pyramid, right? Your training has to be a pyramid like this. And the foundation has to be your first fellowship. So the first fellowship has to be after 1 year post MS or post DNB or post degree, which means that you should have a good hand skill by the time you start pediatric orthopedics. Pediatric orthopedics requires a lot of hand skills. They are very small incisions, very small kids. So you require a fairly basic, good surgical hand skill when you start off. This first fellowship has to be the longest fellowship. It has to be at least 1 year minimum. It has to be preferably hands-on. Should deal with all aspects of pediatric orthopedics. It should not be limited to one subspecialty of pediatric orthopedics, and always in an Indian fellowship. Do not start applying for foreign fellowships and start going for a 3-month fellowship at the start of your pediatric orthopedic career. You will be completely lost and you will have lost all perspective with this. This is just a list of all the fellowships which are available. I'm going to discuss with a few of them here. The first and foremost is, if you are wanting to pursue a career in pediatric orthopedic, this is one place where you have to apply, which is the Wadia Hospital for Children. This is a 1-year fellowship. There are totally 4 fellows which are taken every year, where 2 fellows are taken every 6 months. 2 of them are POSI accredited. One is an MEHS fellowship and one is an institutional fellowship. It's an excellent place where you get excellent hands-on, very good research opportunities, and very good foreign fellowship options. Most of our fellows at the Wadia Hospital, they have gone on to do excellent foreign fellowships through our recommendation and references. So this is a place where you have to start your pediatric orthopedic journey. This is our team, and we deal with all aspects of pediatric orthopedics, right from hip to spine to tumors and upper extremity surgeries. We also have a very good fellowship at the SRCC Children's Hospital, which is at Haji Ali. This is our team. We take 2 fellows per year. This is a 1-year fellowship, of which one of them is a POSI accredited fellowship and one is an institutional fellowship. Again, a good hands-on with good research opportunities. The fellowship guide is Dr. Taral Nagda, and me and Chasnal and Avi are the co-consultants there. Sancheti Hospital has very good fellowship. Again, we know all this great person, Dr. Sandeep Patwardhan. He has a 1-year fellowship under him, of which one of them is a POSI accredited fellowship. There's not much of hands-on here, but there's fairly good research opportunities and foreign policy options. A few notable fellowships. Everyone must have heard of Professor Benjamin Joseph. The legacy of Dr. Benjamin Joseph is continued with Dr. Hitesh Shah. This is one of the 3 places in India which has an MCH in pediatric orthopedics. This is a 3-year course. Again, it's debatable whether you want to stay at one place for 3 years, but this is one of the foremost place where there is a lot of research in Perthes disease. Ganga Hospital under Dr. Venkat Das has a very good fellowship, especially in pediatric hip and pediatric trauma. This is a 1-year fellowship, very good work here also. And CMC Vellore has a very good fellowship. Again, a MCH, which is a 3-year course. This is more of a research oriented rather than a hands-on, more of a hands-on fellowship, but it is something which you can add as a good place for a CV. So once we have this good first fellowship foundation, you then go on for the international exposure. I feel that we should get an international perspective before we start off our career in pediatric orthopedics. And this should be after at least a year of Indian hands-on pediatric fellowship. This should be about 6 months to 1 year with some subspecialization. Most foreign centers have some form of subspecialization, and that is where you learn a small niche in pediatric orthopedics. The common places for fellowship are Singapore, Korea, and Hong Kong, and there are some centers in Canada and UK also. I'll be just talking to you briefly about this. So NUH fellowship in Singapore is one of the most popular fellowships for pediatric orthopedics. He's Professor James, who is a great friend of India. He comes to lots of our Indian conferences. There's a very good fellowship, which is a 6-month fellowship, which has hands-on, which has good stipend. Not much of research, but again, it's a very good fellowship if you want to start off your international career here. And here the main focus is pediatric sports as well as general orthopedics. Hong Kong does have a good fellowship, though it's not of very good repute in the last few years. Korea is one place where many of us pediatric orthopedic surgeons in India have worked in. So this was where I worked at Guro Hospital. Sandeep Vaidya is my very good friend and colleague. Swapnil also did his fellowship at the same place, which is Guro Hospital. It's about 6 months to 1 year. It has got a very good fellowship in pediatric orthopedics and deformity correction. excellent research opportunities. I published more than 10 publications in absolutely top-end journals in the 6 months that I was there. So it's a very good place to have publications for, and you also get a fairly good stipend. Yonsei Hospital also is a very good center where Dr. Chasnal did her fellowship. This is a 1-year proper clinical fellow program. You get very good hands-on. This is one of the very few places where you get a good hands-on work. And here the subspecialty is cerebral palsy. There are a few shortcomings. Language is a barrier, though there are most of the people in the hospital, they know English, and outside there is still some language barrier. And food is also an obstacle, especially if you are a vegetarian and you are, it is a bit difficult to live in Korea with the food there. Fellowships in the UK, there are a few fellowships. What is important to know that only DNB is recognized, MS is not recognized if you have to go by the medical training initiative. There are almost 16 centers, of which the foremost is the Great Ormond Street Hospital and the Sheffield Children's Hospital. If you want to do something in pediatric orthopedics, I suggest that you take an affiliate membership of the POSI, which is the Pediatric Orthopedic Society of India. There are POSI accredited national fellowship programs, just like they are there in the ASI. There is something known as a Professor K. Wilkins Fellowship, which is a 6 weeks to 12 weeks program, which is an observership in India, which is again gives a very good perspective of pediatric orthopedics. POSI has started collaboration with the Canadian Pediatric Orthopedic Society. So every year, 1 to 2 fellowships are given, which are 1-year clinical fellowship programs in Canada. So you can apply through here. Same way with the POSI UK fellowship. Once you have done this, you go for short observerships or short fellowships in some niche field. So there are subspecialties in pediatric orthopedics also. We have pediatric hand, hip, pediatric spine, sports medicine. So you'd have some niche specialty in pediatric orthopedics also. So there is a POSNA COUR program, scholar program, which gives an opportunity for you to go to a place for 3 to 6 weeks, similar to the POSI K. Wilkins program. I did my pediatric hip fellowship for 4 months at Rady Children's Hospital, which again is an excellent program if you want to learn about pediatric hip. And there's a CP and neuromuscular disorders program at the Sick Kids Toronto Hospital, which again is a very good place to be. Wherever you want to go, however you want to go, you have to be diligent, you have to be sincere, and you should be able to write up papers for your boss so that it improves your own research skills. Thus, I'll try to give the take-home points with the help of my journey itself. Start off with a general fellowship in India. I was in BJ Wadia Hospital as a chief registrar and a clinical fellow for 2 years. Then go ahead and do a intermediate grade fellowship, which is at least for 6 months. So I was at KUMC Guru, where I learned about pediatric orthopedics and deformity correction. Start off doing something niche. So I did my 4th-month pediatric hip fellowship at the Rady Children's Hospital, and then do short observerships like in Sick Kids and in Prague, which can give you a different perspective of life in pediatric orthopedics. Thank you so much.
Thank you so much, Dr. Agashe. And I'm sure a few more of our residents today will be tilted towards choosing a career in pediatric orthopedics after your talk. Our next speaker is Dr. Dipit Sahu, sir. He is a very eminent shoulder surgeon who has trained in multiple centers of repute all over the world. He's trained for a long time with Dr. Laurent Lafosse in France, who is a pioneer of shoulder surgery. And he's going to talk about opportunities in shoulder surgery and how to make a career as a shoulder surgeon. So I invite Dr. Dipit Sahu, please.
Thank you, Nikhil. Thank you very much, BOS, and excellent organization of the course. And I like the idea of the course that it's only about fellowships. And the burning question, I think, in everybody's mind, I think, is that the talks and all are okay, but fellowship milegi kaise? And I will get to that, how to get into a fellowship, because I have witnessed firsthand just recently my fellow getting into a good fellowship program in almost all the places he applied for. So I will speak about his journey, and then the second part of my talk will be later on the opportunities in Europe. So a bit about the fellowships, shoulder fellowships, then the journey of how to get into a fellowship. Because I'm sure, I mean, people who are scouting for shoulder fellowship, they know that they are very far and few, very, very few shoulder fellowships exist. They exist in the Western world, and everybody is trying for them. It's very difficult to get into shoulder fellowship. Now, searching for them is very easy on the internet, but how to get into one is probably very difficult. Now, how many of you are interested in doing a shoulder fellowships at least? Okay, there's quite a lot. So, you find one fellowship in Canada or Australia, there will be at least 150, 200 people applying for it. So how to get into one is also very important. I will be speaking about it. And but first, the shoulder fellowships, there are 3 components which will be important for your fellowship training. So understanding shoulder science. In your MS orthopedics, you are not taught anything. It is very difficult to learn anything about shoulder surgery in MS. So I think your shoulder surgery training begins after your MS, definitely. And there is a hands-on component in every fellowship that you go to. The last component that I'll be speaking about is your scientific inquiry, developing that attitude and academics and how to go about it. Now, this book is what is touted as the shoulder book. If you have ever spoken to a shoulder guy, this is a very old book by Matson, is a very famous, legendary shoulder surgeon. So this shoulder book is read by many people, and they proposed by many people also. But what about this book? Should you read any book? Should you read this book? Or should you read any book at all for shoulder surgery? So we've got Tom Cruise for that, telling you something about the books.
The F-18 NATOPS contains everything they want you to know about
shoulder surgery.
I'm assuming you know the book inside and out.
Damn right.
Yeah,
that's true.
You got it.
So
the F-18 NATOPS.
Sorry. That is exactly what should you do with your books. It is not at all important. I have not read a single shoulder surgery book in my entire life. I practice only shoulder orthopedics, nothing else. So if you are planning to read a book, I think that is what you should do with it. Now, these are the understandings that you probably do not learn in your while you're reading a book, while you're doing a post-graduation, or if you can learn how to do a cuff repair, labral repair by watching videos. What you do not learn and what you are supposed to learn in your fellowships is when not to do a cuff repair, when not to do labral repair, what not to do in frozen shoulder, and how to bail out of a complication. So probably very important is not giving a negative result. Early in your career, you can give a positive result. He will not send you 10 patients. You give a negative result, he will stop 10 patients from coming to you. So more important than learning all these surgeries is when not to do a shoulder surgery. Shoulder orthopedics is very unforgiving. So these things are actually of more importance than just learning how to do a cuff repair. Now, this is a fellowship curriculum which is followed in many places and followed almost everywhere if you go for a 1-year fellowship, if you do it with anyone. So first 3 to 6 months are just spent in learning the very basic approaches, cadaveric anatomy. So you go for courses, a cadaveric course, cadaveric anatomy course. You are sent to the course. You take part in the course in organizing. We've organized courses. So you learn for the first 6 months, it's only cadaveric courses and anatomy, reading MRI, diagnosis, scopy. Your basic learning starts only after 6 months. Therein comes your procedures, performing basic approaches and performing a joint replacement if you can get to that level. But it's how much you know that takes you to the next level or how much you can do. Now, hands-on training, of course, exists in most of the fellowships if you do it for a year. And this is what we try to teach our fellows. And this is how I was taught by LaForce. Now, you are doing a procedure, of course, and wherever you go wrong, the fellowship master, he corrects you, he teaches you how to do it correctly. And this is there, but it starts only after 6 months. And this is the right way to go about it. Now, the third component is developing an attitude of scientific inquiry. You spend 1 year in shoulder orthopedics, you will have an attitude of questioning everything. Now, this is an important aspect, to develop an attitude of questioning everything. Probably not very important to publish. You can be a very successful practicing orthopedic surgeon if you don't publish. I don't believe you got to publish to be a very successful orthopedic surgeon. You don't have to publish anything to be a successful orthopedic surgeon. But if you develop an attitude of questioning everything and questioning most important things, you do improve and advance shoulder science, and that leads to a peer recognition. So these are all issues that you learn when you're doing a fellowship. Now, this was my fellow, and he trained with me for quite a long time. And he had developed good skills, but he was very frustrated. I'm sure many of you are, that he was applying to places. He was telling me, I'm applying everywhere. He was applying to Australia. He was applying to Canada. Almost everywhere he sent an email. He said, I'm not getting a call anywhere. Nobody is trying to at least interview me also. He was not getting any interviews. And for 1 year, then he just told me, I do need an international experience. And I agree with Mandar there that after you've done an Indian fellowship, only should you go for an international one. So he had done with me quite a long time, but still he was not getting any international opportunity at all. And I'm sure you know that it's very, very difficult to even get an interview in shoulder orthopedics. There is a very bad ratio. There's a very demand supply gap. You will have one fellowship somewhere and everybody would have applied to it. And they don't care about you. Seriously, the fellowship masters do not care which medical college you graduated, where you're coming from. They will look at your CV. So I told him, I told him that I'll give you an opportunity, but you have to work hard. So then he worked hard with me. He, in 1 year, then he did publish papers, multiple papers. 3 of the papers were in Journal of Shoulder and Elbow Surgery. So publishing in a subspecialty journal is looked very positively in your CVs. So anybody, any shoulder surgeon anywhere in the world, if he sees you published in Journal of Shoulder and Elbow Surgery, and JSCS or Journal of Shoulder and Elbow Surgery as is known, is a go-to journal for all shoulder surgeries. It is a fountainhead for all knowledge. So if they see you've published in JSCS, it's looked on very positively. So first of all, he published. I mean, there were not too many papers. In a year, you can do hardly 2-3 papers at the maximum, because international journal publishing is very, very difficult. Now he did 3 papers, and then I gave him a little opportunity to work for SACI. So SACI is the Shoulder and Elbow Society. I'm the secretary there. So I gave him an opportunity to lead a consensus survey of the shoulder panel. So I made a SACI task force. He was a member of the task force. He led a Delphi consensus survey of some 20 expert surgeons to arrive on a statement on grade 3 AC dislocation. Now, this survey was officiated by SACI, but when he put it on his CV, he got many interviews. His entire interview went on this survey. What did you do? This is a very, very recent experience that I'm talking about, because he just landed a fellowship in every opportunity, Australia, Canada, everywhere. Now, you should become a member of your academic subspecialty. I agree with Mandar over there also. So become a member of the subspecialty. See, if you do not become a member of academic society, it doesn't matter to the academic society at all. There are many members, but there is no excuse for not becoming a member. You send a CV internationally and they see that you're not participating in the subspecialty, what is already existing in your country. It is not very positive. It doesn't matter too much, but it is looked on very positively. You are already in a subspecialty, you're doing something about it, you're participating, you're going ahead with it. So his entire interview, it was on web, it was on Skype or something, but they asked him a lot of questions about what you did on this survey, because it is getting published. Now, after this, he got an opportunity everywhere he applied. 1 year he had spent doing this, 1 year he had spent training, no opportunities. And after that, just recently, he got into Australia. He refused it. He got into Canada. He probably will be going at, I'm not sure, but he's got many, many opportunities. Then he applied for this. There's a thing called Indian American Shoulder Elbow Surgeons. There's a group and a couple of Indian American guys, very highly ranked guys. They have a traveling fellowship, but it's very prestigious. It looks very good on your CV. You build connections. It's a very good thing to do. So SACI and Indian American Shoulder Elbow Surgeons, they have a sort of an understanding there is a traveling fellowship each year. Okay. Now we have to recommend fellows. So he got into there also. Now there were a couple of more guys, but he probably is going or not going, I'm not sure, but it will be starting in October. So he got selected there as well. So what I'm trying to say is that I only gave him the opportunity, I helped him, but he worked hard, and this is his journey that he got in through each and every opportunity that he applied, which is just as recent as 3-4 months back. So in summary, I think this is what you should aim for. You should have an Indian experience, as Mandar already spoke about. Then you should go for an international experience. You have to be a part of a national academic society. In this case, the SACI, shoulder I'm speaking about, and build an academic background connection. So if you don't have a good CV, you can have a good connection and still get into it. But those sort of connections are very, very rare. A connection can get you into a fellowship also. Thank you.
Thank you so much, sir. Our next speaker is Dr. Dhrumin Sangoi. He has done fellowships in the UK and he specializes in foot and ankle work. Now, this is a very upcoming specialty in India. Not many people are aware of this branch as a subspecialty, as well as centers where specific opportunities for foot and ankle surgeons are available. And Dhrumin is going to enlighten us about the same. So I invite Dhrumin to tell us a little bit more about foot and ankle opportunities.
All right. So good morning, everyone. Thank you, Bombay Orthopaedic Society, for inviting me. And thank you all guys for coming here on a Sunday morning. So I'll be talking about how to get your foot in. Just a quick show of hands. Anyone interested in foot and ankle? A couple of those. Okay. All right. So after every one of you all have come here to see after MS and DNB, what you all need to do next. So if foot and ankle interest you, then that's good news. And why? Because foot and ankle is an emerging branch, it will continue to grow. And we are now turning into a society heading to specialists for their problems. As you can see, the Google search, it is going on for all specialties. So your aim with a foot and ankle fellowship should be hands-on experience that should be sought for. And as we all know that in MS and DNB, we have very limited foot and ankle exposure, especially to elective surgeries. Because that is one thing which is quite neglected, especially in the government hospitals. So you have to leave India for some time, that is sure. But when you are preparing for that, after MS, DNB, what should you do? So most of you all will complete your bond, gaining an operative exposure, get attached to a government hospital, again to increase your operative exposure. So in these two phases, you all can increase your foot and ankle exposure by keeping a look and keeping an eye on those cases and reading about it, and do it as you will do as a foot and ankle consultant in the future. So take those seriously, see the flat foot cases and present it to your bosses, see if you all can do something surgically and correct it if they are struggling. And join a local foot and ankle fellowship, Indian foot and ankle fellowship if you all have time. Now, all this is while you are preparing for your exams and planning to go abroad. So there are a number of local fellowships available. right from Gujarat, Delhi, Bangalore, Mumbai, Rajasthan, Nagpur, and Chennai. So these are the two places where you'll need to be in the next few months. Nagpur IFASCON is being held in August, and all these guys will be there. You need to meet them. And the other one is in October, which is the SICOT foot and ankle meet. Again, there are fellowships, there are Indian fellowships and international fellowships being offered at these places. So please do come and meet these guys. So most of you all will be in this phase, either MRCS or USMLE. You need to clear the exams and all of you want to go abroad. So while you are going, everyone are in these three phases. Number one, go abroad and settle there as a consultant. If you are clear in mind, fair enough, you all can do that. Number three, definitely you want to come back to your home country. So you need to spend 2-3 years and you want to come back and practice as a foot and ankle consultant there. But most of us are in phase two, either stay there or come back. I don't know. So that's completely fine. But the thing is, decide quickly, decide in 6 months to a year's time once you reach there, if you want to stay there or come back, because passing both these exams, you have a license to stay there permanently. So you need to get either into 1 or 3 earlier. So sure way to reach England, MRCS, IELTS, GMC registration. Nikhil will talk a bit more about it, so I'll rush through. There are different names for registrar jobs. As soon as you get MRCS, you get a registrar job. Don't get confused by the names. Keep an eye on it, and you will get a job. NHS always needs a job. Now, which job to take? So first job may not be of your choice. That's completely fine. You are just entering there. I'll speak more about UK, which is my experience. But you need to move quickly onto a foot and ankle job. So keep meeting foot and ankle consultants there. Email them, connect to them via LinkedIn, and build up connections. And you need to spend at least 1 to 2 years as a registrar with a foot and ankle consultant. Whichever hospital you get a job, try and speak to the medical director there to put you with a foot and ankle consultant, because you learn the most there. So this is the structure of hospitals in England. DGH, District General Hospital. These are the small hospitals. They do more elective work, and there you learn the most of the foot and ankle, your elective surgeries, your basic foot and ankle trauma surgeries. If you think that you are going to do more trauma after coming back here, you have a trauma hospital, then you should get attachment to a major trauma center where they see all the mangled limbs, the talus fractures, complicated calcaneum fractures, and all those. Teaching hospitals are another subset where you get to be involved in a lot of research. So these all are 6 months jobs. You can spend more time if you are getting good hands-on at a particular place. So while you are doing this, and as a registrar, you need to get involved. So be a member of BOFAS, British Orthopaedic Foot and, be a member of European Foot and Ankle Society. Attend the courses, the Stanmore course or Swestry course, highly recommended, and you'll gain much, much more from that. The King's Diabetic Foot course, very, very useful. Maintain good connections with your local foot and ankle reps once you reach there. So they will put you through cadaver labs. We have good labs at UK, as in London and in Birmingham by Smith & Nephew and Arthrix. So again, it will be a bit of repetition with other speakers. Involve yourself in research. Take a relevant topic which can be completed in time, because you all are time bound there, 6 months in a job. Along with that, whatever cases you see, foot and ankle is complicated, okay, because we've not seen much here. So discuss the cases with your consultants. What is their thought process? Think, how will you manage this patient if you were a consultant in India? And read about whatever you are seeing in the clinics. Go home and read. Be hardworking. Reduce the work and stress of your bosses by seeing more patients in OPD, managing OT implant orders. All this will help you gain more hands-on. The more workload you decrease of your bosses, the more hands-on you'll get. Review articles are the best. So these are the main important journals which you'll need to read. Sci-Hub is a good resource for getting free articles. Find a fellowship. So this is a BOFA's website. This is all given in the BOFA's website. These are proper foot and ankle fellowships, but these are not for beginners. These are after you spend 2-3 years as a registrar in a foot and ankle hospital in the UK. And these are more for the UK trainees, but you are competing with them. So if there is a vacancy, you will get it. Now, this is a list from north to south where there are good foot and ankle units. So if you are getting a registrar job just after giving your MRCS at one of these places, it's great. Okay, so keep a look on the NHS Jobs website and try and find a foot and ankle registrar job here. Now, during your working as a fellow, so if you got a fellowship, you have to make the most use of it. So read about all the steps of the cases before the operating day. Sit down with your X-rays, MRI, CT. Most important, all your 3 slices, you have to look in detail, axial, sagittal, coronal, to understand the anatomy. The hindfoot, midfoot, forefoot, all works in conjunction with each other. Check out videos on ViewMedi, YouTube. Mentally do the case yourself before actually doing it. You have to mentally masturbate and do the cases before actually doing it in theater. Reflect after the case is done. What went wrong? How could I have improved myself? Go to other OTs in your free time. Even if you are a foot and ankle fellow, go to pediatric OT, see what they are doing in pediatric foot and ankle. Go to peripheral nerve injury, see how they're exploring the common peroneal nerve, see the anatomy. So there are a lot of resources for learning. You have the BOFA's YouTube channel, you have ViewMedi videos. IFA's, Indian Foot and Ankle Society, has a good YouTube channel and a lot of interesting videos. A couple of foot and ankle surgeons, Celine Parek, Lyndon Mason, AOFAS website, and the minimally invasive foot and ankle surgery. So foot and ankle is not just foot and ankle now. There is super subspecialization in foot and ankle. There are a lot of centers doing particular focused work in foot and ankle. So if you go in a district hospital, ankle arthroscopy, you'll get to see everywhere, but there are surgeons who are just doing arthroscopy work, ankle, subtalar, Achilles tendoscopy, everything they do with arthroscopy. And these all places you need to go after you complete your primary 1 to 2 years of registrar training and a fellow training in your main foot and ankle field. You need to go to these places after that. No point going at these places before. Okay. Minimally invasive surgery. This is coming up big time in UK, USA, again, because foot and ankle infection, everyone is worried, and a lot of people are moving to foot and ankle minimally invasive. Again, there are specific centers, specific surgeons who are doing this. You need to find them and go and visit them, see the different perspective. It doesn't mean that you start coming back and do minimally invasive, but you have that in your armamentarium. If any patient needs it, you should be able to do it. So bunions, hallux valgus, metatarsalgia, metatarsal osteotomies, calcaneal fractures, many people now are doing percutaneously, and you'll be able to see that there. Diabetic foot and ankle, Charcot, this is a complete different beast. And there are well-known centers who are managing these problems. So again, you need to go and see them. Not necessarily you get a hands-on fellowship. You can do observerships at these places, 4 weeks, 6 weeks. At least you should understand the fundamentals, the basics of how to manage these patients. Again, deformity correction surgeries. If you think that after coming back, you are going to see more of these patients where external fixators and foot and ankle of frames of foot and ankle, then you can go and spend 6 months around at some hospital where they are doing these surgeries regularly. Pediatric foot and ankle. So this comes more under pediatric subspecialty. I'm just put here as a completion, but there are many pediatric foot and ankle surgeons now in UK where they do a pediatric fellowship primarily, and they do a foot and ankle fellowship, and they primarily practice pediatric foot and ankle. So what is the most important thing in foot and ankle learning? As most of our speakers have said, as Siddharth has said, decision-making. It's not the surgery itself. Decision-making, when to operate. So this patient of flat feet, you are not going to operate all patients of flat feet. When do you need to operate? What to operate? Are you going to do a flat foot reconstruction? Are you going to do a triple fusion to correct the flat foot? What are the patient's expectations? What does the patient want after the surgery? Does he want to run? You need to set their expectations right. Intraoperative decision making. If you correct that heel valgus, which is the hind foot, what will happen to my midfoot, forefoot? Everything is connected there. So you have to see different surgeons and then make your own best recipe. So you'll see 100 different surgeons. They will have all different recipes for a flat foot correction. So you need to see all and then choose what is best for your patient and what you will do. So a bit about USA, which I came to know by speaking to my colleagues. You need to pass USMLE to get a hands-on fellowship. Find which hospitals and programs are IMG friendly. Get a specialty fellowship, even if it's not your first choice. If you want to do foot and ankle, but that's what he said, that even if it's not your first choice, get a fellowship, then it will be easy to get a foot and ankle by your bosses there. And if you don't have an USMLE research fellowship where you get good stipend, you can give your USMLE and then do a clinical hands-on fellowship. So this is the San Francisco match, a bit of statistics which I found out. Foot and ankle had most number of positions which were filled, and there were vacancies. So these vacancies go to IMGs, which are us, International Medical Graduates. And you can see that IMGs matched were 57 out of 870, out of 810 applications. So there is a chance. USMLE is a difficult thing to clear, but you can get a foot and ankle fellowship there. So thank you. And apart from the fellowships, you learn great things from these great mentors. They are all good human beings, and you learn and develop in your personal life as well. Any questions, please feel to catch me on my email. Thanks.
Thank you, Dhrumin, for your talk. Does everyone know what is Sci-Hub? I think that was a very important point Dhrumin made. It is a very useful resource. I don't know how legal it is, but it really helps you gain access to a lot of articles. Our next speaker is going to be Dr. Mohit Kukreja. Mohit has done his residency in JJ Hospital, and he spent a lot of years subspecializing in sports medicine and sports surgery. He's done USMLE accredited fellowships in America. He's going to talk about his experience as a sports surgeon and ways and means to get sports medicine fellowships in India and abroad now. He's also going to talk later where he's going to talk about fellowships in US in particular. So I invite Mohit to kindly take the podium and talk about fellowship opportunities in sports medicine.
So while my talk opens up, I think I would like to take this moment to thank the Bombay Orthopaedic Society for making me a part of this intricate program. I think it's very, very heartening to see such a great turnover for this session. I think it seems like everyone wants to do a fellowship, get trained, get the best results for their patients, and that's a great initiative by BOS. I would like to thank Nikhil for reaching me out and helping me make a part, get into these couple of talks that I'll be giving today. Thank you, Dr. Ashish Fadnis, for organizing such a great program. I would also like to mention that I'm from Grants, and I feel really privileged to be sharing the dais with my mentors from Grant Medical College, Dr. Swapnil Kenny, from whom I've learned a lot in my residency period, and also Dr. Mangal Pariyar. So getting into the game, I think, so just a vote of, so how many of you want to do a sports medicine fellowship? So I think that's a good number. And I think at the end of my talk, it's going to be slightly more. So let's be a champ, not a chump. So I would just discuss who is exactly a sports medicine surgeon. What are the spectrum of pathologies that we address, and why is it so lucrative these days? The status of this specialty in India, and then some opportunities that probably train you in India, and then probably that would differentiate you from your peers in the overseas. Also, I would probably give a list of the available opportunities currently. So sports medicine surgeon, I think that word is just a misnomer. I think it's better to call us an arthroscopic surgeon. And I think if you're equally passionate about athletics and being an orthopedic surgeon, I think it's a great combination and a career in sports medicine. It offers a perfect opportunity to blend your two passions together and to treat patients to get back into their healthy, active life. So we basically are not sports medicine physicians, but we treat a lot of sports injuries conservatively, doing physiotherapy and getting patients back to where they want to be. Sports surgeon, I think, is a misnomer, because I would say I treat 60% of my ACL, meniscus, and shoulder patients who actually are non-athletes. So the reason for their injury would be a motor vehicle accident or twisting injury or any daily activity that would probably harm the ligament or the tendon. So we just don't treat sports injuries. It's not that we just treat only young patients. I think 30 to 40% of my surgeries are rotator cuff repairs, AC joint resections, degenerative meniscus tears in patients above the age of 50. And I think sports orthopedics is a vague terminology that we use, and I think it encompasses almost any injury that a patient might be having of any age while they're trying to be active or pursue fitness. We also try to preserve the joint. So joint preservation is a very important category of our specialty, and it involves osteotomies around the joints. Treating stiff joints is something that I do all the time, and it's less common in my practice, but we have patients who need an arthroscopic release to get full joint mobility even after the disease has worn off. And also treating focal cartilage lesions, so cartilage restoration or transfer procedures, recurrent dislocation procedures. And I think this skill also adds up in your way you treat your fractures. So I think periarticular fractures nowadays can be treated with arthroscopic assisted surgery. So I think there's lots of variety, so less monotony, but I think we are still specific, and we try to cater and do arthroscopy in all major joints like the knee, shoulder, elbow, ankle, and hip. I think wrist can definitely be added if you have a hand and wrist specialty, added to your training. So this encompasses treating ligaments, tendons, cartilage, maltracking surgeries. Also can extend to include fracture surgeries while playing sports or in general, open reconstruction surgeries if your training caters that, and also muscle transfers. Also regenerative medicine is a part of it. So sports injuries as such is any kind of injury that you would have anywhere in the body while you're trying to be active, or any ligament or tendon tear. But I think if you probably become a dedicated arthroscopy surgeon, the commonest surgeries that you'll end up doing will be ACL, cruciate ligament injuries, multi-ligamentous injuries, meniscus repairs or repairs of the ACL, rotator cuff tears, AC joint, or long head of biceps pathologies, instability surgeries, and revision and failed surgery. The less common surgeries that I do are arthroscopic arthrolysis, shoulder replacements, since I'm also a trained shoulder elbow surgeon. So I do shoulder replacements, high tibial osteotomies or cartilage restoration procedures. And I think some surgeries that I do, although uncommon in my practice, are quadriceps, tendoachilles or distal biceps repairs for these tears, tennis elbow releases, ankle impingement, treating with ankle arthroscopy, and elbow replacement. So why is this specialty topping the charts nowadays, or something that is very lucrative? I think the idea of it being minimally invasive or keyhole is something that is very pleasing, both for the surgeon and for the patient. I think minimally invasive is something that is going by leaps and bounds in all fields of surgeries. So the advantages are innumerable: small cuts, no blood loss, better visualization, quicker recovery, low chances of infection, shorter hospital stay, rapid return to work or sports or active life. It preserves the joint. So the idea of the patient, having a chance to preserve his native joint or the joint that God has given us, and avoiding full-blown arthritis is something that is very, very catchy. And I think who doesn't want to be active? So I think even a 65, 70-year-old guy nowadays is a fitness freak and wants to, at least carry on with his daily life, do all his activities. And who doesn't want to avoid a replacement surgery if it is possible at all? I think also why this is so interesting nowadays is because of the many recent advances that we have come up with. So better visualization, better equipments, advancement in surgeries for ligaments, tendon repairs, Also, we are focusing more on repair rather than reconstruction, especially for the ACL now. Rotator cuff tears, we try to augment or add biology, thus trying to, save the native tendon and not do a replacement surgery. Regenerative injection therapy, although purported to avoid surgeries, it's still in gray literature, but something that can be tried for patients not willing to do surgery. Joint preservation surgeries, and of course, using arthroscopy to treat fracture fixation and, add up to our accuracy of fixation. So the status of this specialty in India currently, I think it's definitely advanced because of a lot of expertise. I think a lot of surgeons are willing to train abroad and then come back to their home country to practice. So I think it's definitely developing into a dedicated specialty. Knee arthroscopy is something that is a common skill set now. I think many surgeons in their residency, especially in good institutes, are being exposed to, knee surgeries like the simple ACL reconstructions and the meniscus meniscectomy, like trimming it or repairing it. So they are willing to, start doing it independently into their practice as soon as they started, despite of them being arthroplasty surgeons. I think technology is also something that is on par with the world in India. So I think we have the most advanced techniques available here. Also, I think the young surgeons are, exposed to opportunities where they can get trained in arthroscopy very early in their career, which was not the case when I actually passed out, and we didn't have so many fellowships from the university or private practitioners that was actually existent. So we just had to focus on foreign training for us to get better. And I think public awareness and readiness to get the best treatment at the earliest is something that is driving it. But I think still in India, we have a long way to go. One of the most lagging things right now is probably the availability of the newest technology that can help us treat cartilage defects. So the availability of osteochondral allografts, soft tissue allografts, which were rampantly used in the US when I was training, are not readily available here. The bare implants is something that has come up in the US, but still I think India has to wait for a long time to get it. I think some technology is still available, but it's a costly affair. So sonografts for SCR, augmentation cuff patches are not readily available. And if available, they are very, very expensive. Also, reverse shoulder replacements, I think there are no made in India alternatives to the international standards. So I working in a corporate hospital, the hospital usually charges up MRP to the patient for a reverse shoulder implant. So that increases the cost of the implant immensely. And, it definitely curtails our way we are treating patients. Dedicated arthroscopic surgeons, I think, are available, but are still few. I think our Indian market is designed in such a way that we don't get streamlined arthroscopy patients right away as soon as we enter into practice. We have to rely on general practitioners, referrals. So I think it's coming up, but it's still in the niche stage. Peer pressure to get immediate volumes as soon as you're into practice probably would not help you to be dedicated to arthroscopy, but probably just be a little more generic. Elbow, ankle, and hip arthroscopy is still a niche and still uncommon, but growing. The sports opportunities now are widely available in India. I think that's a great relief for all candidates passing out from their residency. But I think it's very important, like the previous speakers have widely discussed, that who is your mentor? Are you the chosen one, or you actually the lucky one who will probably be mentored in the right possible way, like Dr. Dipit Sahu just described, is it hands-on or is it just eyes-on? So, I mean, a hands-on training in India would definitely help you fetch a good fellowship abroad and then obviously get into the complexities of the field. So it's a good training that you have to gain in India before you actually venture abroad. Is it just an observership? How long is it? I think, of course, it's a great way to start, but it's definitely is not the end, because arthroscopy requires dexterity, requires skills. It's not an open surgery. So you have to spend some time to gain it, before you actually venture into independent practice. Is it one-on-one mentorship model? How many fellows, the program director has for us to know the quality of training that we'll be getting? Of course, I think unlike in the US, we don't have any internal or external audits for the fellowship programs that we are pursuing here. So I think in the US, what I saw was actually the candidate evaluating the program anonymously to the board, and the American board actually taking into consideration all that we feel or we feel is deficient in the program. So I think that actually keeps the program very much on the toes in terms of providing the right kind of training, and gradually, probably in the year that you are in the fellowship, gradually giving you independence of the hands-on. So these are the few sports medicine opportunities that I just kind of searched. Although the disclaimer is that I'm not sure whether what quality of fellowships these are, and how much hands-on you'll get. I think this is something that you all can inquire and then get into this. Dr. Prathamesh Jain is doing his fellowship in Gujarat, but I just saw that he, in fact, not giving a stipend, but actually asking for a fellowship fees. So you have to pay around 1.3 lakhs a month, probably for getting into this fellowship. I'm not sure whether this is worth it, but I think this is definitely an option. So these are the other programs. Ganga Hospital is quite renowned for giving these postdoctoral fellowships, and through FNB under Dr. David Rajan. That has been since a long time, and I probably vouch for it. It must be a great one, because there have been some great alumni from that fellowship, one at St. John's. And these are some of the private practitioners. Dr. Amin Rajani, who I've worked with at JJ Hospital, has a fellowship. Dr. Sachin Tapaswi has a great fellowship, I think. Dr. Ayappan Nair does a lot of complex shoulder stuff, although I think he's probably a shoulder surgeon, but you can definitely go for it. And then some other societal fellowships, so IOA inline fellowships, I think one at Sanjay Gandhi. So sports injury center is something where I went to after leaving my assistant professor job at JJ, to probably get a better hands-on and into the more complex arthroscopy scenario. So this is a great training arthroscopy center, especially dedicated to arthroscopy, affiliated to Safdarjung Hospital, and is recently there's a second building coming up for this. So huge volumes. It gives the training through FNB and SRship both. And then these are some opportunities in South Korea, which I think directly you can just email these guys. The one at Samsung Medical Center is quite renowned. And then, of course, I missed Singapore, although I was trained in Singapore, but there are hospitals in Singapore like SGH and Tan Tock Seng Hospital, which have sports fellowship options, which can definitely be tried. You can search it on Google and just get the email and at least apply. And these guys need a Singapore Medical Council accreditation or licensing, a temporary licensing before you get there. So I think planning ahead, just like the previous speaker said, is very much essential. This is the one in Australia, and Australia has a very streamlined way of application, although you have to individually apply to each fellowship program. But there is an AOA directory where you can just go in and search for all options. The one in the UK, although I have done my MRCs, but I have not trained. I've been trained in the UK, but I think Dr. Nikhil is going to throw more light on it. But there are various options available in the UK as well. And the ESA course fellowship directory is also great in terms of finding an international fellowship, maybe like an observership, but at least getting to know more details about sports medicine. Last but not the least, fellowships in the US. So, of course, like previously mentioned, these fellowships need a US medical licensing exam, completing even step 3 before you actually apply for the fellowships. I matched at Boston University through the San Francisco match, and it was a long road for me, but I think I'll just discuss it later on about my experience. So this is the website for AOSSM, where you can get the list of fellowships. But I think the application process is through SF Match. And of course, once you have step 3 and you're ECFMG certified, you can keep a watch on the post-match vacancies, just as mentioned by Dr. Dhruman. And probably, you never know, even without the research fellowship, you might just end up with a clinical position because they need it and they have a deadline to start on August 1st. So I think you can try your luck. I think you giving USMLE steps is the first thing. So planning ahead is extremely important. I did it after my post-graduation, but I think you can start giving your steps while you are doing your post-graduation, which would save some time. Thank you so much for your kind attention.
Thank you, Mohit. So one or two, so I could see that a lot of people are interested in sports and arthroscopy fellowship. So anything, I would just like to ask you guys, is there anything different about sports medicine and arthroscopy fellowships, which is unique for sports medicine and arthroscopy, which is not there in other open surgeries? The biggest problem is hands-on. Okay, so you need to have those strangulation techniques before you sort of, so that is the biggest challenge in the learning curve. So whenever you choose a fellowship, as what Dr. Siddharth said, that, first do an Indian fellowship so that you get your hands dirty, and then you go on for, as Dr. Mandar said, go for niche and, some specialty surgeries. What we had done is basically we had circulated a Google form to a lot of people who are offering fellowships. Quite a few of them are sports surgeons, and arthroscopy fellowships are being offered. So that form, we will be that Excel sheet, we will be circulating it to you on the Google Classroom or the WhatsApp group which is there. So you'll get a list of all the fellowships across specialties which will be available. So a lot of them are Dr. Sachin Tapasvi, Dr. Anand Joshi, Dr. Narvekar, Dr. Nagaraj Shetty. A lot of people who are members of the Bombay Orthopaedic Society who have contributed to that and who are having active fellowships in the short term, observerships, and long term as well. And because this topic was touched on, I think one of our colleagues, Dr. Piyush, had just been to Dr. Prathamesh Jain. Was it a good experience? Yeah, so I mean, Piyush actually took the step of, investing in the fellowship, finding his mentor, and went there for what was the duration of fellowship, Piyush? Right. So for the people who are attending in on Zoom, there is Dr. Piyush Jadhav, who has just been to an arthroscopy and sports medicine fellowship in Ahmedabad, right? With Dr. Prathamesh Jain. So can you just repeat the things on the mic so that, people online can also benefit from your experience?
Yes, so the fellowship is mainly for the 4 weeks time, and it includes both the knee and the shoulder surgeries. He has a very good volume, or he's working mainly in 2 centers of his own and some other centers as well. So he keeps 2 fellows in that 4 weeks time duration, and both the fellows are assisting him in each and every surgery. So it was a very good experience for me, at least to start with an arthroscopy. I think this number of good volume definitely gives some good idea.
Did you have any arthroscopy hands-on experience before you went to the fellowship?
Not exactly, but I used to assist a few cases during my residency. Nothing more than that.
Okay.
And when I entered for my fellowship with Prathamesh Jain, I was only going for knee cases. But when I left, I think shoulder was something that came up to my mind, and now I'm also interested in shoulder surgeries.
And since then, have you done any fellowships after that?
Yeah, after that, recently I completed one of a short-term fellowship in Italy, in Milan, under Dr. Professor Randelli.
So these 2 fellowships, are you fairly confident of, let's say, tomorrow, if, wherever you're working, there is a basic knee arthroscopy or a meniscus, do you think you'll be able to take it on your own, or you would still want to, for the first few cases, want to do it with someone?
Plain ACL cases and some few meniscus tears, yes, I can definitely do that now. But for some complex, yes, I'll need some assistance and need some more training.
Yeah, so I think your exposure to 120 cases in the short span of 4 weeks is quite astonishing. It's quite a concentrated volume, which rarely one would expect in centers abroad. So you keep it in mind that if you're going for a fellowship for about 4 to 6 weeks, the consultants over there do not operate daily as against to consultants in India. Okay, so that is where, when Dr. Mandaraga Shea and Dr. Siddharth Shah said it is important that you do a basic fellowship here, is Vadia, he would be operating every alternate day, or probably you would have a theater every day, right, Mandar? Every day. So which is not the case abroad. So even when you go as a fellow, Nikhil would agree that, the consultant will operate only twice a week. So you can understand that 7 days you're operating only twice a week. Okay, those 2 days a week you are doing four cases, which means to about 8 cases. So yes, they are a little bit more organized because you get more time to study, reflect, do your audits, research, publish, do other things other than the fellowship. But yes, if you're considering volumes that you need to go to a place for a short span of time and concentrate your efforts, get the most of it, then you need to choose the centers accordingly. So this is also an opportunity for all of you guys to mingle amongst yourself. At what stage of your career, who's planning to do what next, who has done what. So, talking amongst yourselves here in person as against, on Zoom will also give you some perspective towards the end of the day where you're going to head next, especially when you hear talks from Dr. Rajiv Raman about IOA fellowships, Dr. Jamal Ashraf about APOA fellowships, and Dr. Dhaval Desai for the AO, and Vaibhav is going to talk about the SICOT fellowship. So before we move to the next talk, I would like to invite the president of our society, Dr. Sanjay Dar, who has been a constant support to us since the time we sort of, conceived this course and put it to the executive committee, that this is something that we wanted Bombay Orthopaedic Society to take the lead and sort of, do it. So hopefully if we get a good positive feedback, we do it well. So we might sort of decide to repeat it year on for all the residents. So I would just invite Dr. Dhar to, say a few words. And of course, also invite you for his biography.
Thank you, Ashish. It's always a pleasure and honor to be associated with BOS, and all of you, probably the members, are giving me the opportunity to be the president. So I probably am not the right guy to stand here because I have been a middle of the road guy who has just, like a rolling stone, gathers no mass. So jack of all trades, master of none. I went with the flow. I started at Sion Hospital where it was only trauma. Then, probably to your surprise, I did the fellowship in a pediatric orthopedics in South Korea. Probably I was the third person in South Korea. Dr. Sudhir Warrior was the first, Dr. Ajay Puri was the second, and I was the third. And it was a pediatric fellowship all along. And none of us is a pediatric orthopedic surgeon. So then as I said, I went with the flow. In Sion, I worked with Dr. VTI for 2 years and I became spine surgeon. Then I was transferred to Nair Hospital where it was only joints. AVN was very common, so I did only joints. And trauma remained in the core of my heart. So I always love to do trauma, although I do lots of joints now, less spine. So I just want to tell you that don't get disheartened. Fellowships are not the only thing in life. Stick to some mentor. They will handhold you and guide you. So you will realize in next 2 years or 1 year, if people who have just passed, that what actually you love to do it. So it changes. I don't know. Orthopedics is such a beautiful branch. Every branch has something to offer you and challenges you. And I am sure if you're a good thinker, a good skillful person, you will probably love many of it. But fellowships are the order of the day because there's lots of students coming out and everybody wants to do something in a niche segment and create a space for himself. So I think I should not be against the order, but I would suggest all of you at least to have a basic 2 years training or 1 year's training in a general branch with some mentor who probably would guide you through. So India is not a bad place to start it. And as somebody has told you that Indian fellowships initially are good fellowships. And if you get to a high volume surgeon, probably you'll learn a lot. So I wish you all the best. And I can tell you BOS, at least during my tenure, would be trying all these things. In fact, I want you to be mentors, and whatever fellowships you have done, please write to BOS and tell us and inform us so that we can make a pool for the rest of the people to come. So rather than we going to mentors who probably, because of their ego or whatever, they don't write to us. And I'm sure Ashish probably would be in charge of that program. So if you can write to us what fellowships you've done, you can accredit them, rate them. We'll probably make a sort of a pool where we can, at least for the next year students, we can have a better understanding. So this is like rating, any rating, you can give 4 stars, 5 stars, so that people don't get disgruntled by going there and wasting time and then come back with getting nothing. So please write to us, be the mentors for the next batch at least, and tell us how we can improve. In fact, I am trying, and with Ashish's help, we are trying to create a BOS fellowship, which will be a life-changing fellowship. which will be for 2 years, 1 year at least, but I'm about to write to many people around Bombay who can offer these, but commit for next 5-6 years. So that is how it is going to be. So thank you very much for allowing me to speak. And I think about Vairav I'll talk later. Yeah, thank you.
Thank you very much, sir. So there are a few questions which are coming on that Slido, but in case something burning comes to your mind, we will take it once we finish all these talks in this particular session. I just want to tell you, I mean, to break the monotony, there is coffee which has been served outside, so you can just grab your coffee and come inside also if you want to. But do that after this lecture, because Dr. Manit is waiting eagerly to talk to you about orthopedic oncology. It's a very nascent specialty, which is now evolving very rapidly. I think most of the progress right now in orthopedics is concentrated on oncology, and a lot of market driven is in sports and arthroplasty probably.
Since we're doing a show of hands, anybody for orthopedic oncology? I actually saw people get up and walk out. So the numbers are in minus to start with. Any burning orthopedic oncologists? Okay. So that brings it to 0 now, -2 and 2. So good morning, everyone. Thank you, Bombay Orthopaedic Society. We just get this. I'm Dr. Manit Gundavada. I'm the consultant orthopedic oncologist at Kokila bin Dhirubhai Ambani Hospital. My fascination with this subject began early, and it's important that if you choose to practice as an orthopedic oncosurgeon, it is that you are willing to give up the other specialties of orthopedics. So pursuing that dream is rare, because giving up the other specialties of orthopedics is not what we've been all trained to, I guess. So I would like to So we are in the era of limb salvage surgery. Today, patients with bone sarcomas, soft tissue sarcomas have 60 to 70% survival rates. Even in patients with pathological fractures that have metastatic cancers, the concepts of fixations, using megaprostheses, giving patients quality of life is constantly changing. So the era of limb salvage surgery has revolutionized orthopedic oncology. This illustration beautifully depicts that today we are able to reconstruct any bone in the body. The armamentarium for an orthopedic oncosurgeon includes long bone defects which are reconstructed with implants, allografts. We use recycled tumor bone, and like Dr. Ashish said, this field is constantly improving. With the access to navigation, 3D printing, using patient-specific instrumentation, as well as implants, I believe that orthopedic oncology is the fastest evolving subspecialty in orthopedics currently. And I don't blame them because all the other specialties are so far developed. It was time that somebody took on this challenge. However, developing a strong fascination for this subject is basically termed as fatal attraction. This was a term given by Dr. Manish Agarwal, who is my mentor, and he termed this as fatal attraction. The true test of your interests are confirmed only and only after you have experienced one pelvic sarcoma surgery. Either you love it or you hate it. So sites like these are common in orthopedic oncology. You see the bowel, the bladder, the tumor is somewhere in there. This sarcoma took 15 hours to remove and 5 teams were involved when we did the surgery. This is another internal hemipelvectomy, a massive resection, exposure of the visceral structures, 8 hours just to remove the tumor, another 6 hours for just reconstructing and closing the defect. And not only that, it is a lot of things that are a sight to fathom. It's the situation in the operating room, it's the blood loss, it's the surgical duration. And these are a lot of the deciding factors before you actually fall in love with the subject. However, after all of this, if you are still fascinated by the challenge, it is only then you have access to all these exotic reconstructions, you have expandable implants, you have rotating hinge megaprosthesis, you have 3D printing for patient-specific instrumentation. This is a metallic 3D printed hemipelvis that was used for a patient. We have now navigation, and all of this is moving towards a very, very patient-centric care. Once your interests are confirmed and you're willing to give up all the other specializations of orthopedics and practice orthopedic oncology as your mainstay, this journey is not straight. Choosing the right center and the best training is completely dependent on you, because you may need to find your own path. Since most of the people interested in this session are graduates that have trained in India, we'll stick to all of us being international medical graduates. And this was the same for me. A major part of my training was in India. And yet it was the international training that gave me the perspective. It gave me the access to protocols. It gave me a hint that we are at par with the world and providing the top class medical healthcare even in India. And that was a very, very big eye opener for me. Anywhere in the world for orthopedic oncology, there are no exams, there are no degrees. It is only fellowship trained individuals teaching the fellowship trainees. And in fact, even in India, there are no societal fellowships. There is no recognition under a government institute where you can get an MMC or MCI recognition for your fellowship. So it's absolutely important that you choose your mentor and your center very well, because that is what is going to take you forward, and that is what is going to be your basis for training. So as you can see, multiple options in India to choose from an orthopedic oncology course. They are all institutional fellowships. They are all mentor-driven fellowships. You need to apply to each of them separately. They range from Tata Memorial, they range to Gujarat Cancer Research Institute, AIMS. A lot of private institutes as well offer the fellowship, but it's all mentor-driven. What I looked at when I looked at a fellowship in India after finishing was that it has to be a high volume sarcoma center. And that is when I went into research and what all is required. So all the fellowships in India, if they're a clinical fellowship that give you hands-on training, give you adequate volumes, it's a minimum 2-year fellowship, may it be Tata, may it be any other private institute. You look for a structured 2-year fellowship program. And look at the areas of interest. If they're doing 3D printing, if they're doing navigation, if they're doing custom implants, stuff like that, the latest in technology, is it being offered? Is it available? Do they have the navigation software, the equipment? If that is your interest, look at centers that have that and then choose your area or choose your center accordingly. The same applies to international courses. There are a lot of misnomers, a lot of words that use fellowship in their application, a lot of invitations, a lot of emails that say fellowship, but look at the word clinical fellowship. If you're looking to train internationally for musculoskeletal oncology, the minimum duration abroad is 1 year. If it says clinical fellowship, it means they have hands-on training, and it is a clinical as well as a research model. So there is, if you have a clinical fellowship opportunity, you should look for it, but that is only after you have finished 2 years in India. You are sure that you want to practice orthopedic oncology, and by those 2 years, you've almost given up the other specialties. So this is very important, that it's a clinical and research model, like all my other colleagues have said here, that the database is abroad, the data monitoring, the data recording is so robust that you have a lot of things to study when you're there. You can analyze the data, you can publish papers, you can do presentations, and this is a very important thing that will be at your disposal while you're doing your fellowship abroad. So as discussed, the Indian center is your choice. You reach out to a mentor, reach out to the center, look at their volumes, look at their technology. You need to look for a center that matches your interests. And internationally, I can help you by giving you the top 3 institutes globally, where I know people, even through the SF match or the US MLE program, have opted for one of these 3 to be trained internationally. So Mount Sinai Hospital in Toronto in Canada is where I did my clinical fellowship. The Royal Orthopaedic Hospital in Birmingham, they have a very big pelvic and orthopedic oncology unit, and that's where I did my visiting fellowship. And Rizzoli is still on my card, so hoping to do that sometime in the future. Now, if all of these, again, are not societal, you need to apply to them individually. There's a 2-year lead time. My fellowship in Canada was almost 2.5 years before I even got the interview. And it was another 1.5 years, which was another delayed by another 6 months because of COVID. But you need to reach out. They look at your application, they look at your publications, they reach out to your mentors, and they confirm whether you've done good work in India. So doing a robust training in India is extremely important, because your referees are your mentors in India. And a quick short about my journey. Like I said, most of us are trained in India, and we are the international medical graduates when we are going abroad. So I was very lucky to have rotated through the oncology rotation during my residency, and that is how I fell into this fatal attraction trap. But I was warned by my mentor, and I did not get into it right away. I moved out, I did general orthopedics, I completed my bond. I finished a few rotations through general orthopedics before deciding that now I have to get back to my dream, get back to orthopedics, oncology. After that, it was the same journey. I looked at institutions, I went for observerships, I met an institution and a mentor in line with my interests, and he was absolutely keen on taking me on and teaching me to take this further. And that is how I started my fellowship. And like I said, my mentor was extremely instrumental in getting my international fellowship. And it's all a journey that just falls into place if you've done good work in India and you're a good center, good mentor. Thank you.
Thank you very much, Dr. Manith. And the next speaker, I would invite Dr. Suna, no, you are making a co-host. We'll invite Dr. Abhijit Vayegaonkar, who's an eminent hand surgeon and who would be talking about fellowships in hand surgery. To introduce Dr. Vayegaonkar, he's a very good friend. He's the vice president of the Maharashtra Orthopaedic Association. And to give you a brief about his journey in hand surgery, Dr. Abhijit Vayegaonkar has probably done 6 out of the top 8 hand fellowships that need to be done to sort of, do and see everything in hand surgery that is there. I will welcome Dr. Abhijit, unfortunately, who had to turn back to Pune from the, looking at the situation of the rains and the traffic situation in the Ghats, but he's there with us online. So I would welcome him. Abhijit, I'll just make you the co-host.
Thank you. Sure.
Can you share screen, Abhijit?
Yes, I'm doing this right
just a
now.
moment, we'll just make you the co-host.
Is my screen visible now to everyone? Yeah.
We can see your screen, but we can't hear you. So अपना इंटरनेट का प्रॉब्लम है, उसका प्रॉब्लम नक्की ना.
Hello.
Yeah, Abhijit, we can't hear you.
Can you hear me now? Hello? Hello, can you hear me?
Yes, yes, we can hear you now.
All right, great.
You can start, Abhijit.
Yeah, sure. So at the very outset, I'm very, very fortunate to be a part of this fantastic initiative of the Bombay Orthopedic Society. And I want to thank both Ashish and Nikhil for the invitation to be a part of this. And, you know, as I was listening to all these wonderful lectures, I'm sorry, I really wish we had such a course when I was a resident and when I was a fresh graduate. It really would have helped me in a lot of decision making in my career choices. Nevertheless, once again, thank you, and I regret that I'm not there in person to be a part of this initiative. So my charge is to talk about hand and wrist or upper limb fellowship programs, and do indulge me as I take you through this fellowship opportunity. So to all the audience, I would like to pose a question as to try and imagine how important are our hands. And Albert Einstein made a very astute observation in saying that next to the brain, our hand is the most important organ in the body, simply because all that you can imagine and conceive can be created, done, or performed by your hands and the dexterity of the hands that we have. So it's one of the most complex parts of a body, and there is a very intricate and a complex anatomy that involves several structures that allows us for the prehensile function of the upper extremity. And without our hands, it would be extremely difficult to perform even routine activities that we take so much for granted. And it is our hands that make us skilled and valuable workers. And here's a fun exercise, you know, try to tuck in your hands in the palm of your hands and tie your shoes or untie and do your buttons. And it's really not all that easy, right? So you can imagine that the hands, which we take so much for granted, if injured or for whatever reason are not as functional, would cause a lot of problem for our patients. And here are some injury statistics, and of course they stem from some US studies that there are more than 3 million injuries and illnesses that will take away a lot of work hours from the workplace. And a lot of industry, a lot of manufacturing units, a lot of construction activities will involve a lot of hand injuries. And in India, we don't have these statistics simply because we are such a large population and there are so many skilled and unskilled workers without any proper training that are subjected to hazards at the workplace, subjecting their hands to the risk of injury. So what is hand surgery all about? This is a field of medicine that deals with problems of the hand, wrist, and forearm. And for some people, it extends to the elbow and the shoulder. So it's kind of a comprehensive upper limb scope of work. And hand surgeons are those who are trained to care for these problems and operate when necessary. And they would employ orthopedic, plastic, and microvascular techniques to deal with these problems. And here is a list of different problems that a hand surgeon is trained to deal with. And it's very interesting that I was listening to the previous talks and all the astute speakers. This is one branch or one subspecialty where you can really bring to the table skills and techniques that have already been talked about. So even oncosurgery in the upper extremity is something that's very, very upcoming and very challenging. So you can even do microvascular reconstructions along with these megaprostheses and stuff. There is something called as a Capana technique, wherein you can put in a free vascularized fibula graft along with an allograft and, really expand your horizons in treating different problems. So you can treat problems of the upper extremity that involve injury, nerve compression, complex disabling injuries, malunions, reconstruction of birth defects, arthritis that include joint reconstruction and small joint arthroplasty. Sports medicine can be brought under the ambit of upper extremity surgery, and hand and wrist arthroscopy as well as elbow arthroscopy is also within the scope of upper limb surgery. You can perform microvascular reconstructions, brachial plexus surgeries, obstetrical brachial plexus surgeries, tetraplegia surgery, and so on and so forth. So it's kind of a very lucrative and a very, very exciting field. Unfortunately, very less catered to. We are a country of 1.25 billion people. And it would surprise you to know that the Indian Hand Society, the Indian Society for Surgery of the Hand, has only up to close to about 700 or 800 members. So can you imagine that in such a large and a vast country, we have such a small number of hand surgeons? And then to just put things in perspective, Japan has 3,500 hand surgeons in the Japanese Society for Surgery of the Hand, and such a small country. So why pursue hand surgery? Because, like I said, it's a road less traveled. It's an upcoming branch. But, again, an interesting statistic. When I did my first fellowship in the United States at the Klein Institute, half of the hand surgery match programs were vacant or were not taken. Whereas I think the 2015 audit that I remember, the fellowship programs were booked for 2 years. So it's kind of a very large paradigm shift in the preferences in choosing hand surgery as a career option. So in one way, there is less competition, if you were to look at it that way, in getting a position. And it's quite a satisfying branch in terms of work satisfaction, because there is a lot of scope for application of thoughts, skills, techniques, and your mind to treating different problems. Of course, anyone who likes a very peaceful and calm environment, you like to do your surgery sitting down using magnification and listening to some good calm music, this is the field for you. So there's a lot of scope for meticulous surgery and intricate procedures, as well as soft tissue balancing and soft tissue surgery. What are the desirable traits of a hand surgeon? And they always do. Every surgical aspect requires manual dexterity, but more so, I think, in microvascular and hand surgery, because we say it in a lighter vein that an orthopedic surgeon operates with his shoulders. An upper limb surgeon will operate with his elbows. A hand surgeon will operate with his wrists, whereas a microsurgeon will operate with only his fingers. So, manual dexterity is extremely important. You need an analytical mindset, especially when you're dealing with nerve problems, for example, brachial plexus injuries for that matter. You need to have good problem-solving skills when you're dealing with complex reconstructive procedures where you need to perform restoration of hand and upper limb function. And of course, for every doctor, I think not only for hand surgeons, good communication skills and empathy are the fundamental of bringing everything together. And then, of course, each case is different. Here's a very small list of cases that you can really appreciate, and perhaps it might excite you to consider hand surgery as a career option. Look at this particular problem. And I think it appears different to each mind based on your training and your background. Complex injuries such as these, I think they are very differently treated than by an orthopedic surgeon as compared to a hand surgeon. And there was a good study that kind of brought this out as an evidence-based statement. They looked at the differences in treatment of distal radius fractures by hand fellowship trained surgeons, which was a study of the American Board of Orthopaedic Surgery. And they found that hand surgeons would be more comfortable in operating multifragmented intra-articular distal radius fractures or complex compound injuries of the distal radius as compared to the peers who were general orthopedic surgeons. So what is the ambit of hand surgery? Like I said, you can deal with replantation and microvascular reconstructive surgery. This is one such example wherein you can perform replantation of critically amputated digits and restore function. Complex crush injuries can be restored back to having good hand function. You can perform local flaps to cover injuries that would otherwise have a very poor outcome if left untreated. Very distal amputations can also be replanted by using microvascular surgery. This hand, to most of my friends, would qualify as an indication for amputation, and this person unfortunately was advised amputation. But however, with some use of imagination and some microvascular skills, we were able to restore the anatomy of the hand. Now, obviously, this is not going to be a perfect and a very functional and a supple hand, but nevertheless, it's going to be a sensate and a hand with function that is reasonably good. What about this young girl who was 11 years old and had this very tragic amputation? Unfortunately, if a microvascular hand surgeon would not be available, she would be doomed to undergo an amputation surgery. And again, we can employ orthopedic, microvascular, and plastic surgery skills to put that hand back on again. What about pediatric hand and upper limb surgery? So all of my younger colleagues who are considering a pediatric orthopedic fellowship can also think of a pediatric hand fellowship or a pediatric hand scope of practice. So we can treat different problems such as syndactylies, radial club hands, as well as absence of thumbs, and bring back smiles to your patients who will be able to use that hand in a more meaningful manner. For all those who want to be sports medicine surgeons, again, you can bring that skill set into hand and upper limb surgery in the form of small joint wrist arthroscopy. You can perform wrist arthroscopy, thumb CMC, metacarpophalangeal joint, wrist and elbow arthroscopy, and perform complex ligament repairs as well as reconstructive procedures, treatment of intra-articular fractures, and so on and so forth. What about elbow arthroscopy? Again, it's incredible that we have such a small number of people who are performing elbow arthroscopy for such a large population at our disposal. So if you can bring your skill set within the umbrella of hand and upper limb surgery, I think this would be a great use for our patients who will benefit from your skills. We also are able to treat brachial plexus surgeries in the form of primary nerve repairs and transfers, microvascular free functioning muscle transfer. So, for example, this is a patient with a brachial plexus injury who underwent a free functioning gracilis muscle transfer, and a seemingly useless and a flail limb can now be brought to use as an assistant arm to the opposite arm. So it's incredible how different techniques can help our patients who have debilitating injuries to get back function that would otherwise seemingly be impossible. So hand surgeons are those who are able to perform replantation, revascularization, reconstruction from the head to the toe, from adults to children, from skin to bone, oncology, sports medicine, reconstructive surgery, pediatric orthopedics, and so on and so forth. So what are the options that are available, and what do you need to consider before you apply? So there are several different fellowship programs that are available. Some of them have competitive exams to be accepted. For example, now we have the FNB and the MCH course in hand surgery in India, whereas the US fellowships, of course, require you to complete your ECFMG and USMLE. And like most of my peers and my colleagues have stated before, it's always desirable to perform an Indian fellowship before you pursue overseas program. There's only one point I would like to differ on, with all due respect. Although you want to go to high volume centers, even if you go to a low volume center abroad, I think it's important because it helps you with a broader perspective. It helps you apply your mind to research, to creative thinking, to applying thought, and come up with newer ideas, which is the need of the hour. We don't just need to be followers of medicine, but I think it's time for us to be leaders in medicine. And that can only happen when you're not busy being busy. When you're in a high volume center, you're just, kind of in a system where you're just working, and you have very little time for thought and for research. So consider that perspective as well. And of course, know what you want before you go. So that's, I think, also very important. So the fellowship options that are available can be the eponymous or the named fellowships, which are very popular. They are paid, and then you have a stipend. And of course, you need a good CV and good letter of recommendations. You have long-term versus short-term fellowship programs. And of course, you have observerships or clerkships versus clinical fellowships. So within hand surgery also, you can have subspecialty training. So you can go in for a peripheral nerve surgery training program. You can go for microvascular, pediatric and congenital hand, reconstructive surgery, and sports medicine fellowship program. And then, of course, you also need to consider how you see yourself a few years down the line after you complete your fellowship, whether you're going to be in private practice, whether you're going to have your own setup, or you're going to work with corporate hospitals, group practice, or academic programs. So you need to really start planning your career with a long-term goal and then taking short steps when you begin your journey. You also need, like I said, to involve yourself with research, innovation, and mentoring. I think every surgeon who has received fellowships and training should pass on the baton to the next generation. The life of a hand surgeon can be pretty hard and demanding, but of course, once you're at the top of the curve, things become a cinch where you are able to deal with any problem from the shoulder to the fingertip. Here is a list of centers that you might want to consider if you want to, think of a career in hand surgery. For FNB, we have Ganga Hospital and the Sher-e Kashmir Institute of Medical Sciences in Kashmir. We now have a 3-year MCH hand surgery program at CMC Vellore, Stanley Medical College. I'm very sorry, I forgot to mention Manipal here. KMC Manipal is also one of the centers. You have private fellowship programs with different mentors. You have overseas fellowships. Consider being a member of the Indian Society for Surgery of the Hand, because if you're a member of the ISSH, there are very good fellowship programs that are available. We have fellowships under the aegis of the Maharashtra Orthopaedic Association. I was very proud to be the chairman of this committee until the last year. And then you have government-approved fellowships, which are listed here. This is a screenshot of the ISSH fellowships that are available. The Robert Acklin Fellowship is a very, very prestigious fellowship. This is akin to the Bunnell Fellowship of the American Society of Surgery of the Hand. I was a very fortunate guy to get this fellowship as well. And then you have some grants. Dr. Mukund Thatte from Mumbai has given an endowment for an international traveling fellowship. You have inland fellowships and some microsurgery fellowships. The ASSH has hundreds of fellowships listed, but of course, it requires you to be an ECFMG graduate. So we also offer fellowship programs at our center, and we have a 1-year fellowship program along with a 6-month program, along with short-term programs, and we have trained more than 35 national and international fellows to date since 2015, once this fellowship was conceived. Here is my team. We are 4 hand surgeons. They have all been my fellows who have joined the practice. And this is Dr. Balaji, who's a plastic surgeon who has now joined the practice. So we are a team of 6 surgeons, and we provide a fellowship program that caters to the entire spectrum of hand and upper limb surgery. So we are also very proud to be a Center for Excellence in Wrist Surgery of the Asia Pacific Wrist Association and a member of the International Wrist Centers. If you are interested in applying for the fellowship, you can find the information online on our website. We are very active in academics. We encourage our fellows to publish, to present, and to be a part of the leadership in hand surgery. And it's not that we are all the time, confined to the operation theater. Hand surgeons also have a lot of fun, like orthopedic surgeons do. I am an orthopedic surgeon, of course, but then a lot of times we are looked upon as people who are doing catching RBCs. Here are my mentors. There's a Professor Christoph Mathula in the upper left corner. He is my mentor in wrist arthroscopy, one of the leaders in the field of wrist arthroscopy in the world, along with different friends. This gentleman here is now one of the pioneers of ultrasound guided surgery. Again, a new horizon in hand and upper limb surgery. He was recently in Pune and visited our center as a visiting professor. And so there's a lot of scope of collaboration advancing. It all started with this gentleman, the late Professor Harold Kleinert, who was my first teacher in hand and wrist and upper limb surgery. I would want to leave you with this wonderful aphorism by Ronnie Oldham. Everything that you do in life should be about excellence and not perfection. I'm always inspired by this aphorism. I keep coming back to it every single time that I feel low or I feel that I need another, spurt in life. And he noted that excellence is a result of caring more than others think is wise, risking more than others think is safe, dreaming more than others think is practical, and expecting more than others think is possible. Whatever your field of endeavor, whatever your choice in life, I would beg you to follow this aphorism in your careers and in your path. With that, I would once again like to thank the Bombay Orthopaedic Society, my dear friends, Ashish and Nikhil, the leadership of the BOS in conceiving and conceptualizing this program, and to allow me an opportunity to be a part of this program, be with you today. Thank you so much. Appreciate it.
Thank you, Abhijit sir. That was a very comprehensive talk on hand surgery. Hope you're around with us for a few questions. So the next talk will be, after covering a few niche topics, we'll be coming to one of the most sought after fields, that is arthroplasty. And unfortunately, we don't have Dr. Vaibhav Bagaria joining us live, but sir has presented a talk and we'll be playing that. After this talk, we'll be taking a few questions for the eminent panelists who are with us today. So there is a Slido app. While the talk is going on, you can key in the questions that you want to ask, and following the talk, we'll take those questions. Okay.
Good morning, dear friends. It's indeed a pleasure to be here today to talk in this fellowship course. Thank you, Ashish. It's always a pleasure to be there at your invitation, and thank you, Nikhil, for organizing such fantastic course. I truly apologize for not being there in person. I would have loved to meet each and every one of you and have interacted with you in the person. Without wasting much time, let's start with the presentation. I'm aware that most of the people attending this program are those who intend to do fellowship. And I believe that the arthroplasty fellowships are one of the most coveted fellowships on this part of the world. I am Weber Bagaria. I work as the Director of Orthopaedics at the Sir H. N. Reliance Foundation Hospital in India. I also represent CCOT as its national delegate. Now, when we look at the arthroplasty fellowship program, there are few fundamental questions. In fact, that's not just for arthroplasty, but for most of fellowship program. Number one question is, why should it be done? Why should you be entering it? Number two is, who should be doing it? When should it be done? What can be expected? Where can we do it? And how can we or he or she get in a good program? Now, why should it be done? And I always say that it's not necessary for all people to be specialists. There are people who do all these specialties and they do it very well, perhaps even better than doing what a job that specialist would have done. So when you start, we start as a mixture or melange of trauma, spine, sportsman, joint, even to some extent physio, chiropractic. But as time goes on, as we graduate, our skill set changes from novice to experienced and then to eventual mastery. For most people, this would be our career path. If those people who have read the book Outliers would know that ultimately being mastered means doing things, repeating to do the same thing again and again till you get right. I would also like to quote Bruce Lee at this stage, who said, "I don't fear a man who practices 1,000 kicks, but I fear a man who practices one kick 1,000 times." So if you do something repeatedly, if you continue doing actions and surgeries that you are routinely doing, then you'll be good at it. You'll be able to reach a level of mastery. One of the fellowship mentors that I had always told me, and I still feel that eventually, as you grow, you should taper down to only 5 surgeries in life. For me, I know that it's a knee replacement, total knee replacement, partial knee replacement, tibial condyle fracture, something that I love, the hip replacement surgeries, STO, and pelvic surgery. So it's 6 for me at this time. But I believe that's a good fundamental goal to reach for those of us who want to become a specialist. Now, who should do it? Okay. Now, when we look at a fellowship program, either as a fellowship mentor, or if people who come to me, they ask me, am I the right candidate for subspecialty fellowship? So there are a few things that you must look. Do you have a basic qualification? For most people, an MS Ortho, DNB Ortho, or D Ortho is something that is required to get into a fellowship program. The number 2, and that's very important, is that you should have an interest in a particular subspecialty. If you do not have an interest in your subspecialty, it will be a futile effort you will do. It's not necessary that your interest is maintained all the time, but it is important that if it does not interest you, you change the track very early in your career. For example, I started with a spine fellowship program in US, and I did reasonably well in that program. And in fact, I have a publication for OKO and OKU. So all kind of cadaveric work I did, but I realized early in the course of fellowship, that's not what interests me. I'm much more interested in doing knees, primarily arthroplasty and arthroscopy, and that's what I do currently. The number 3 thing that you need to have, that at least you should be good in basic trauma and orthopedic skill set. Don't expect to be a brilliant arthroplasty surgeon unless you have a good skill in trauma and doing basic things, because ultimately understanding bones is the key for any orthopedic surgeon. And I think unless you are a good trauma surgeon, you cannot be a good arthroplasty surgeon and definitely not a good revision surgeon. So your skill set as a trauma surgeon is very important, and at least a good hands-on knowledge of basic trauma is expected. So if you have passed your MS and your MS exposure for the trauma was inadequate, it's highly recommended that you do a couple of years in a peripheral setup where you get to do lots of hands-on work on trauma. Now, when you talk about subspecialty, sometimes you may not get that subspecialty exposure during your training days, but it is important that you at least have a good theoretical knowledge. You must have read about it so that the fellowship is of good value to you. Otherwise, your year will pass without getting substantial knowledge. If you want to make most of it, you should have at least a good theoretical knowledge of the field. And also, you should have done some amount of research in that particular field, because that demonstrates interest. Not only that, it also kind of opens your mind to the fact that this particular fellowship will be useful to you, and you will be able to start thinking differently. And I think that's important, because fellowship is not just a training program. It is something beyond. It is something that you learn for life. And one other thing that I would recommend highly is to study career path of the pioneers in that field. There will be people who you look up to. There are people in Scopy, there are people in Plasties who have done it, and they've done it hard way. There is no simple ways for most of people who have reached the top. So it's not a bad idea to kind of see what they have done, read their career paths. If you get an opportunity to talk to them in person at the conference or someplace, try to talk and understand what were their mindset, what made them choose it, and how did they go about doing things that they do currently. Now, the next question, as I said, there are 5 fundamental questions. So when should it be done? Are you ready to enter the program? And I said, always say this to everyone: there's no age for learning. There is, I mean, anyone even at the age of 70, 80, I think learning should be fun and learning should be done. So there are 2 kind of fellowships program typically, and you must understand when and who should do what program. So I call that the first phase is your formative fellowship phase. This is where your knowledge about that subspecialty is quite limited. It should be typically done 5 years after the orthopedic training. So in Indian scenario, it should be 3-year post MS or DNB and 2-year post degree experience, but if preferably in a place where you get to do lots of hands-on. The rigorous work, single-minded focus, and is important. So this fellowship is your formative fellowship. So it will be typically 1 or 2 fellowships that you do in that subspecialty. Sometimes you can do up to 3 fellowships in that subspecialty. You should work very hard, very sincere. You should have single-minded focus to learn the most, work the most in that field. Of course, if you have a good choice of good location, it is icing on the cake. So for me, for example, when I did my MS from KEM, I did my first fellowship in US, which is in the spine, but not very interested in that. But then I later on moved to Australia, where actually I worked very hard. I took calls, although it was not mandatory. Used to go in, observe the other surgeons also when they were not doing it. So I dedicated my entire 2 years that I spent in Australia rigorously to learn as much as I could do about arthroplasty. And of course, as I said, I chose different locations. I went to Adelaide, Melbourne, Perth. So all of that made me rich, not as an arthroplastic surgeon, rich not only in money, but rich also in experience. And that is what the fellowship should be all about. The second phase is Rise and Shine Fellowship. When we have got some mastery in our field and you want to kind of cherry pick things, then it is a good idea to do short-term fellowship. For example, at my career, I have applied for fellowship, if you can believe that. So I want to learn a direct anterior approach for the hip. I feel that it may be something that should be there in my armamentarium. So I would like to go for 4 to 6 weeks at some place and to someone who is pioneer in direct anterior approach. I've done, so my basic hip skills are good. I do a lot of robotic knees and other things, but if there's one arrow in the quiver which is missing, is direct anterior approach. So it's not a bad idea to go to places. And at this stage of our life, it is okay to only go for 4 to 6 weeks, because that's enough for us to pick up the right thing. So depending on what stage of life you are, you do this fellowship. And as I said, always look at the other side of it also. Fellowship program should be fun. So you should also think of it as a second honeymoon, or just going out and chilling out after hectic work here. What can be expected of these fellowship programs? So different programs will give you different experience. Of course, you will always be surgically assisting your surgeon. What amount of hands-on cutting or work that you get, or what level of independence you will get, will depend a lot on your supervisor, his mindset, and a lot also on you, on how much competency you have demonstrated to your supervisor. It will also depend on the kind of setup you are. If it's a completely private setup, no matter whether you are in India, abroad, the learning will always be supervised. Whereas if you're in a public setup, the learning will be independent to a greater extent. Of course, there will be clinical work in terms of OPDs and managing the patient in wards. Academics, again, depends on different setups, but most fellowship program will have at least some degree of journal club and academic talk. And of course, the most amount of learning actually happens on rounds, on one-to-one interaction with mentor of yours. And I think that's the key thing. It's much more of an apprentice-mentor relationship. So don't think of it as a structured program. Many of it is unstructured, and that's where the key spot is. Of course, you should do a little bit of research when you are there. Aim to get, if you're a 6-month fellowship, 2 papers, and if it's a year-long fellowship, at least 3 to 4 papers that is there. Also, it's a good opportunity to network with your peers. Some people, Ashish was my senior, and I still cherish the fact that I was working with him when I was at KM, and we have a lifelong bond. He sent me cases, I sent him cases. If the patient is from that particular area, I ask them to straight away go and meet him. He does the ditto for me here. So I think it is important to cultivate friends and seniors and juniors who you can talk to. I think with all the technology that we have, it's easy to be in touch. At the same time, it is easy to move away from in-person relationships. So I think fellowship, I think it's a very, very important and undervalued part of your fellowship program, where you create bonds for your life. And of course, with your own mentor, I think lifelong mentorship is important. I'll tell you, my first fellowship in spine was 20 years ago. As I said, it was a spine fellowship. But today also, when the topmost person of the city required any help, I kind of call on to him, and he kind of obliges, and you share difficult cases, you take life advices. And many times you get so close to your mentors that you can talk about your personal lives, on where you should settle down, who you should marry. So I think it is, to get a good mentor is, I think, one of the just like a good wife, a good mentor is something that you can cherish for life. This is just a simple thing that normally, because this is about arthroplasty fellowship, so these are simple things that you can start with. Most fellowship program will have this. This is from the ISHQ. They expect you to start from the surgical approach and then do surgeries at the end with complex case scenarios. So during a arthroplasty fellowship, this is a typical thing that you should aim. And with robotics and different surgical techniques, you should be able to kind of manage from very simple to very complex scenarios. They come these fellowship usually have to be 6 months to a year long. And depending on what cases you get, you may get some very complex cases in your initial days and very difficult, very simple cases in your last days. So it's quite luck based, but this is a rough curriculum for an arthroplasty fellowship. Now, where can it be done? That's one of the most important questions, because the targeted approach is the key. So it's different ways to apply it for different, but categorically, there are 5 different zones. You can apply in India, you can apply in UK, you can apply in Australia, US, and the rest of the world. So strategy for these, you have to classify all this into your 5 category. India is, of course, we live in India. We've got some great places to work. There are extremely high volume centers. There are talented surgeons and great teachers. However, we do suffer from poor communication. You write an email, most of them get unresponded. But don't get bogged down by it. India is accessible, so you can travel to him, meet him in person. Some of them are very busy and may not be able to respond to email. But when you go there, persist, I think more often than not, you succeed. Our fellowship program are inconsistent. 2 different fellows in the same program will give you 2 different stories, but that's all right. It's a bit of luck, but it's also how you perform in that particular program. We do have lack of accreditation. Most fellowship in India are not accredited, but that's changing now with DNB, MUHS, and ISHQ giving accreditation to these fellowship programs. Australia, I believe, is the next easiest option. There are no mandatory exam. You do have to give English proficiency test. The key is to write a good email, have research experience, and I think more importantly, to get best out of this, you have to have a surgeon who works both in public and private. So typically, I have done my fellowships in Australia, so I can tell you, in private, you assist the surgeon. Sometimes the surgeon is good enough to actually pay you the assistant fee. And in public, he lets you do things independently. So I think that's a big plus when you do in Australia, and you get lots of hands-on if you have this public and private. surgeon. So I think apart from India, the Australia is the next easy option. UK and US are better structured, but they need some kind of qualifying exam. They're usually not very high paying as compared to Australia, and there's an intense competition from all across the world. However, having said that, if you really want to move out of India and want to permanently settle, I think the US, UK, and US fellowships are the way forward. How to do it, how to get into a good program, there are 7 key points. You have to have good communication skill, fulfill mandatory criteria. The age has to be right. So if I need a fellow for 6 months to a year, I don't want someone who is like 40 years, because I know he'll not work that hard. I would want someone who is in the right age. I would look for someone who has got basic knowledge, publication in the field, so that demonstrate interest. Of course, I also want to see where he has worked in past, whether the references are good. And sometimes I am interested in a person, but I don't have time to kind of respond back. So a good follow-up from the candidate is important to kind of ensure that the right candidate meets the right mentor. Once you get into it, it's not over until it's over. So how to make best use of opportunity. Now, mentorship can be a bit of tormentorship. You may feel that your mentor is tormenting you, but I think it's part of learning. There are challenges where you are just asked to observe. It's called as fellowship versus the over the shouldership. It often happens when you start your thing that you get frustrated that you're not getting to do enough, and you are always doing FRCs, which is forever retracting, cutting, cautery, and suturing, and not doing the actual master work. But have patience. Most of good programs, when they realize that your fellows are good enough, would let the knife be passed on. So, but till then, you have to be patient and you have to demonstrate your skill set. Always look at cherry picking, pick up the good things about that fellowship program. Not every fellowship has got all the thoughts, all the things. So pick up good points from that. Make friends for life. As I said, make friends with your senior, junior, and most importantly, have fun. I think unless you have fun, the fellowship is, I believe, a drag. So don't let a fellowship program be a drag. Try to have fun. I thank you once again, all of you, for a kind attention. I'm available at drbagaria@gmail.com in case any one of you want to get in touch. Thanks, Ashish, Nikhil. It's been a pleasure. And I would also invite all of you for this unique conference on techniques and technologies in joint replacement that we have started conducting every year at Sir H.N. Reliance Foundation Hospital. Next year, it is between 23rd to 25th February 2024. Lot of opportunity to network, meet people, and also probably fellowship programs that we'll have under this. So thank you once again, and I look forward to meeting many of you in person. Thanks, Ashish.
Which is going to be the sort of place where you are going to ask questions, and it is all going to be focused towards what you want from this course. Okay, so I would invite all the panelists, all the speakers to please come on the panel. Right, so I would like to set the ball rolling by asking a few people. I mean, amongst the delegates, how many of you have already done either a fellowship or an observership? So Piyush is one, and there's one gentleman at the back. Sorry, where have you done? Can you just tell us something about that fellowship, observership, or which country you went to? What from Sion Hospital? Sorry, spine fellowship from Sion Hospital, and that was an MUHS fellowship.
Yes, sir. That was an MUHS fellowship.
So you had an entrance exam for that, and then there was an interview.
Yes.
Okay.
Not an interview. Just we have to give a PG marks, and they have a scoring system for that.
And where have you done your PG from?
I've done from Kashibai Navle, Pune.
Okay, so you are basically from MUHS and you have got an MUHS fellowship.
Yes.
So that's not a criteria that you need to be a, or you are higher on the rank if you are from the Maharashtra and this area.
No, that's not.
Okay, good fellowship.
My experience is, I got to see a lot of cases over there and assist a lot of cases.
Okay. Great. Now, how many times is operation theater day and how many times is clinic day in the week?
In a week, we have almost 2 to 3 cases. Yeah.
No, how many days of surgery and how many days of OPD?
1 day of OPD and 2 days of surgeries. Yeah.
It's very good. 1 day of OPD is very good.
Yeah.
Right. Anyone else has been to a fellowship or has been abroad or has been with a mentor observership so far in your career? And how many of you are, let's say, more than 5 years post MS? Any one of you? So I would presume everyone is less than 5 years post MS. How many of you are actually doing your residency right now? I know a couple of you are doing there. 3 of you. Okay, there are 5, 6 of you. Yeah, so it's a good start. So one of the first questions that came up pertains to that. When to start thinking about doing a fellowship after passing MS Ortho? I think this was alluded to you by some of the speakers, but if anyone of you wants to take up, when to start thinking about doing a fellowship after passing MS Ortho? Mandar, I think you mentioned in your talk.
So I think senior residency is one thing which really turns you towards one specialty. Senior residency should be quite all-encompassing. You should be able to see all aspects of pediatric orthopedics. And I think that is the time when you really set your focus on one particular thing, either by elimination of things which you don't like, or you actually like one particular thing. So thankfully, I was in KM, I could get exposed to a different, all sorts of specialties when I was doing my 7th and 8th post. And that is the time when I really focused on pediatric orthopedics, and that is where destiny took me.
For interest, because ultimately you have to have one, you have to enjoy what you're doing. And only once you enjoy what you're doing, you hard to do. If you don't like a particular specialty, you don't like a particular surgery, you're not going to put your heart into it. So obviously the patient is not going to get good outcomes, or you're not going to put your best foot forward. Okay, right. So for the delegates who are attending in person, I would want you to sort of come to the mic and ask the questions, because it's being managed on Zoom. Those people will not be able to hear your questions if you don't speak in the mic. And secondly, we can also make the recording that, but it's very easy for people to see it on Zoom.
Things which you like, person, you eliminate it in your application that you are interested in the other thing. Because many a times I see an email and he has just copy pasted what he has written to the arthroplasty surgeon. I am interested in arthroplasty. I have trained. See to it that you write your email well, that exactly what you want, and you write it based on what you want.
Are we back online? We are online right now. Okay, so we are back online. So any burning questions amongst the delegates here who are present here? Yeah, please speak into the mic.
And academics, sir, really our background or our area of practice will impact the branch or actually the fellowship specialty.
Yeah, so you mean to say that from where you come from and where you're going to practice, that will also affect your interest?
And as per our backgrounds, like family background, economic background, will really impact to the specialty which will be chosen.
Anyone wants to take that?
So thank you for your question. And I think that's a very important aspect. Sometimes during residency training, we get sidetracked into one particular direction of thinking. But what this gentleman has brought up is very important. Eventually, it is not just about your job. It is also about the circumstances in which one is brought up and one stays. So one also has to think about, and I feel that the earlier you think about this is better, where you eventually want to practice. Where do you see yourself 8 or 10 years down the line? And all your efforts during those 8 and 10 years should be directed towards acquiring skills which will help you in that eventual practice. If you're going to practice in a rural area, and perhaps you don't have to have subspecialization in one particular field, but acquiring general skills of all specialties might be what you need for your practice in your area. So I think that is one important aspect of planning as to what eventually you want to do and where you want to settle, and that makes a difference.
I would like to add to that. I had a very interesting conversation with Dr. Arvind Arora. Many of you may know him because he's the writer of our CET books, which we use to get into residency. So I had just cleared the MRCS exam, and there was no book in the market for MRCS apart from the online courses. So I approached Dr. Arora and said that why not we work on this and fill this lacuna with a book on MRCS. So he sat me down and he said that what career plans do you have? Like how Dr. Nikhil said, where do you see yourself in 8 to 10 years? Writing a book is a 1 to 2 year commitment, and does it really play a role towards your endpoint? So he asked me to sit down and visualize, say 10 years down the line, what is your endpoint? Is it India or abroad? If India, is it working in an institutional type of setup or in a private sector? If private sector, do you see yourself running your own setup, or are you a freelancing surgeon? Probably a month or two after that, I gave thought to what he said, and I visualized an endpoint for me where the book was nowhere in the picture. It was not taking me towards an end goal. So yeah, so you can visualize your endpoint and then choose your subspecialty. At that point, probably I knew that it would be India as a freelancing surgeon, and subspecialty would be spine. So that decision was made at least say 5-6 years back.
So at this point, I would like to ask the audience, how many of you see that you are going to be practicing in India? I mean, are you clear in your mind? Sir, everyone thinks they are going to practice in India. Yeah. So I mean, so it's very good because you are at least very clear. But there will be a lot of people who will not be clear. They will say, okay, chal UK jaake dekhte hai. And there are a lot of people you'll understand, you'll know that their batchmate has gone to UK and he has never come back because the opportunity is present over there at way. So yeah, life is a little bit fluid. You go with the flow as well, or sometimes you are like, some of the guys are really focused. Yeah, Dibit, you wanted to say something?
Yeah, so practicing one particular subspecialty in India. Now, this is a concept which started in the West. And as Mohit said, that, sports medicine as a branch started in US because they care about the sports teams. And then from therein comes the sports medicine fellowship. Now in India, sports medicine surgeons as such are not there. These are arthroscopy, as he rightly mentioned. So practicing a very small subspecialty, Mandar does pediatric orthopedics, they are not very common. So you have to see where you're getting into. Now in US, there are people who do only shoulder replacement. If you do that in India, khane ka paisa bhi nahi hoga. So, so you have to see the reality of where you're going to practice. Now, there are some things possible in India and some are not possible, especially where you're going to practice. For example, Bombay, you can do a lot of things here and you can do a lot of subspecialty practice, but it's still difficult wherever you go in India.
Right. So, yeah, you want to take that further?
So just being the devil's advocate on that same topic, even if you feel that your field of work is going to be quite broad and you don't want to restrict yourself to one, you still shouldn't be deterring yourself from pursuing a fellowship just to gain expertise in that particular subspecialty, although you still have the leeway to do everything else. Any fellowship you do gives you a training which is far better or far pinnacled than what you learned at a basic master's level. So fellowship training in that sense would not be something that will be wasteful. That will still add up to your experience, but you will still be able to do everything that you always did.
Excellent. So a lot of questions on this Slido are sort of hovering on the fact that how do you choose a center which has got a very high volume, especially when they are not on the radar anywhere. Let's say they're not a societal sponsored fellowship, but someone who doesn't know what happens in that country and how do you choose a particular hospital. So do you know of any resources apart from social media, LinkedIn or so, that you would refer to?
So what research I did was I looked at the publications, the top publications, I looked at the centers, and that is how I reached the corresponding authors. And that is how I got in touch with the largest publishing centers had turned out to be the ones which had the largest volume and good databases.
The other question which is coming very frequently is hands-on, whether it's a myth or a reality, or with India versus abroad. Which fellowships are giving you more hands-on experience? And I think one of you addressed the fact that hands-on actually depends on the person himself, you know. So you want to elaborate?
No,
on
I was
that?
just saying, if you want to know about a place, you should talk to the earlier fellows or immediately ex-fellow. They will tell you the right picture of what is happening there, how much hands-on is there, how much learning is there, and how are the fellows treated. Those are the best resource.
Yeah, so journals are the best way. As you see, the places where they have high volume, you will automatically see in the case series and try and approach them, email them. And if you clear the exams, that means 80% of your job is done. So that's the most important, I think, to reach there.
Yeah, and I think also it will depend if you're already experienced. Like Dr. Mandar said, 2 years you have spent in India, and then you have gone to a place to do a fellowship. You're definitely at an advantage because the boss over there, or the consultant, knows that, okay, this fellow knows his basics. He knows how to paint and drape. He knows how to position and see in the X-ray. And then, okay, I can ask him to, take the incision or expose the part.
So I think your first mentor in India plays a very key role, because usually so most of the mentors in India, they have now got some international exposure. They know people abroad. They have themselves done their fellowships out. So use that mentor as a starting point in order to find out where the fellowships is. And he himself is in, if you are in his good books, he will be able to guide you to a particular place and then help you further. So I think your mentor in India is one person who will really guide you further.
So the extension to that question is, how long should we do the inland fellowships before going for training outside India? And Mohit, now that you have got the mic on, there is one question targeted at you. Where can you get real hands-on? And he's put in brackets as cutting during the scopy under supervision in arthroscopy.
So I think scopy fellowships are not that much in number, and I think probably the way to go is that obviously you should target Indian fellowships and get as much as hands-on as possible in that. I think as your resume improves, as your experience improves, as you have a lot on the CV to display to a program director, that would probably fetch you a good fellowship. And from there on, I think once your training is really optimal, you will be able to get on a foreign fellowship. I think taking into consideration fellowships in the US, these are accredited fellowships and known for giving autonomy, clinical training or surgical training in a great way. But I have heard people or candidates not getting good hands-on even in a fellowship in the US, because I don't think any surgeon who is extremely responsible for their patients and their functional outcomes or their results or their clinical care would probably hold their patients at stake and give someone independence just for the sake of it. So I think even if you're in a place like US, or I would say any good clinical fellowship, they would probably give you hands-on only if you can demonstrate that you are stable, you're not jittery, you know the basic stuff, the basics. So I think it's a supervised graduated training. And I think it depends on you, what you show to the mentor, how have you exceeded in terms of your surgical training, and then they can gradually put you in and move you forward in that. So I think US, it's always a graduated training in the whole year where you start with them initially, maybe just to know how they drape, how they do things, what are their ways of doing the surgeries. And then once in about 3 or 4 months, once you know how to do it, they're confident about you, they probably give you more independence.
Yeah. So basically, now that we are on the subject of arthroscopy, Deepit, can you tell us how many arthroscopies you actually did or you could do maybe in a month or the end of 6 months in France, in Europe or US? But just to give them a perspective, because I'll come to that. Why I'm asking this thing is that if you speak to any of the arthroscopic surgeons who are opinion leaders nowadays, you can trace their career and see what they did in their careers. I was just talking to Nikhil. I asked him that, before you went to England, did you actually do any arthroscopies? And he said, yes. He spent 1 year in Cooper Hospital with Dr. Ashwin Samant, got his hands dirty, and then went to England. Similarly, I was working with Dr. Nanavekar, and he said, Ashish, you want to learn arthroscopy, you buy your own scope first. So everyone will tell you the same thing. You buy your own scope, get attached to a teaching hospital. I got attached to Terna where there were no patients, but at least there were cadavers. So he said, just get your hands dirty either on a cadavers and then it's worth doing a fellowship, because now you know the basics, you know the triangulation, and then you can sort of, imbibe everything. So
typically, I would say if you go to Europe, especially in France, there are 10 shoulder surgeries each day. Now, in 10 shoulder surgeries, but there are many fellows. So When I was there, there were around 10 fellows. But long-term fellows, there were always 2 long-term fellows, and then there are short-term fellows. Now, when you're coming for short-term fellowship, 3 to 6 months, you don't really expect hands-on, and they don't really give you hands-on also. It works both ways. But when you're a long-term fellow, your relationship, matures over 6 months, and only then your mentor trusts you, and they start giving you hands-on after 6 months only. And by the time you graduate, like your 1 year fellowship is over, you've got most of the procedures done under supervision, sometimes independently, sometimes your mentor is not there, you're doing it on your own. But that is only in a high volume setup. A 1 year fellowship is a must then in that case.
So one of the things with regards to long-term fellowships overseas is that the training institute or the deanery which is giving you the fellowship also has some sense of responsibility towards giving you that training, because it's also their name at stake. So for example, in Nottingham, there are 13 fellowship positions, 6 every 6 months. But by the second year is when you do your half of the spine, because we have the leeway of bilateral parts of the spine. So the consultant does his part and a senior fellow does his part. But that part comes after you spend that 1 year. But the trust also invests in making sure that you do a particular amount of surgeries, so that once you qualify from the institute's name is something that you're going to carry forward. So pick your institutes wisely, because they are going to also invest in you as much as you are investing in them.
So with regards to, I think your question was specific for the learning curve in arthroscopy, which I believe is quite a steep learning curve. As rightly pointed out, and we were having this discussion before, I spent about a year during my bond post in Cooper, and I approached the consultant there, who is one of my mentors. And he told me the same thing: you buy a scope and I'll teach you how to, navigate your way around the knee. It was not a very high volume fellowship. We must have done 20 ACL surgeries in the entire year. But I think that was much more rewarding than going and watching somebody do 150 scopes in a short duration. That is my take on it. The other part, as far as the shoulder is concerned, I have done a structured shoulder fellowship in UK. First month was just positioning the patient and draping the patient. Second month was marking the shoulder landmarks. Third month was spent in putting the scope in. 3 to 6 was doing subacromial decompression. That is all I was doing. And after those 6 months, when my boss was comfortable that I would be able to do a subacromial decompression, was when I started doing rotator cuffs and started repairing labrums. And by the end of the fellowship, for about last 2 months, I was having my independent lists. So it is a graduated process. Everybody progresses at a different rate. I'm sure there would have been fellows before me who perhaps had a faster learning curve. There would be fellows who perhaps did not make much out of the fellowship in those 12 months. So it is a little variable, but it is a gradual curve, and the boss also has responsibility towards the patient. So as long as patient care is not compromised, I think you will get your due as per your capacity.
So since I'm not sure if Abhijit is there on online, but we have Dr. Paraglad who's here. So there's one question which is asked with career. So should saturation of a field alter your decision for a fellowship?
Excuse me.
I think I can rephrase this saying that, should saturation of field alter your decision to choose that particular specialty?
We are going to see your brother.
So I think
Yes,
there are 2 aspects of making a decision. One is, if you really like a particular field, then it shouldn't. And if you don't like any particular field, then I think it absolutely should.
So yeah, so I think for whoever asked that question, I think this question is, if you like that specialty, you enjoy doing that, you should just do it. You don't worry about what your competition is. Which brings us to the next question: a career as a hand surgeon in tier 2 or tier 3 cities, are the as plastic surgeons are the competitors? Again, I would like to say that, don't worry about your competition. Hand surgery is a sort of a basic orthopedic surgery, and you will always have patients in India, right from pediatric hand to, let's say, adult crush injuries or deformities, nerve injuries, iatrogenic injuries. There will be a lot of, you should see the cars that hand surgeons drive, and that is a good enough reason for you to choose specialty. But Right. So any burning questions? I mean, Nitin.
So
Nikhil,
one question was there that we are not exposed to foot and ankle. How do we decide if we want to, if we like or not? So number one, go to conferences. If ASCON is coming up, this SICOT conference, you'll see a lot of people, you'll hear a lot of talks. So see if you get it. Even if you don't get it, see around people around you who are doing foot and ankle surgeries. Go and see that. And if you like it, then go for it. So that's what I'll say.
Dr. Dhaval Desai is online and he's responded. He said that you have to look inward for fellowships and create the environment. And I'm sure, I mean, when we hear his talk on, what he has done with AO India and what he's doing with AO Asia Pacific, he would be able to elaborate more on that particular specialty. So, I mean, I know we didn't cover trauma in this particular session, but someone wanted to know about FNB programs. How good are those? Yeah, you can ask in the mic. Ajay, there's no mic there. Yeah, so FNB programs. Does anyone have an idea about how good the FNB programs are? And there was a question whether it's worth spending a year in arthroplasty in a FNB program or 2 years in a particular subspecialty FNB programs. I mean, FNB, I know FNB spine in Ganga is very good. FNB hand is very good. I think you have done FNB in hand surgery. I mean, anyone wants to take that?
So I'll take it. So FNB is again a very great program, structured 2 years, long term. Again, it depends on the institute as well as to the quality of the program, but it does give you the benefit of being in one place for long enough to develop that mentor-apprentice relationship, to be able to learn as much as you want.
FNB program in Ganga.
So basically, it is the extended qualification which is going to be recognized now. And now we have a MCH in hand and reconstructive surgery from CMC Vellore. Everybody does DORT, FCPS, MS Orth. And if somebody who is FNB, his weightage into as a corporate attachments or to apply into the international fellowship, because your qualification is suddenly get recognized by a national body. Because so far, many of the institutes like Ganga has got a state fellowship also, which is governed by Tamil Nadu program. Then they have a 1-year fellowship. So these fellowships, they give certification of recommendation. I mean, he's a senior registrar for 1 year, or he's a clinical fellow for 1 year. So these certifications may not have a true value in the international forum, because they will count number of posts or number of years you have worked into that particular field. So if you have done FNB, you definitely way far ahead. Like you all are young, and next 5 years, 3 years, 2 years down the line, if you invest and then your field is decided, you know that you are going to be that in future. So if there is a chance and there are other family, social, financial, economical constraints are solved, FNB is the way to go forward. I think you must pursue that. Thank you.
Sir, I had a question.
Yeah.
Yes. First of all, thank you so much for organizing this Bombay Orthopaedic Society. Dr. Ashish Fadnis sir, Dr. Sanjay Dar sir, and all the esteemed panelists. This has been a very helpful session for all of us here. My question is a little coming from the point where we spoke about, think about the end goal in mind. So if you're perhaps thinking about a second or a third tier city to practice in, maybe not in corporate setup, what is the stop point for the fellowships that you should do? And considering that smaller cities have a generalized practice, how would you advise someone to approach their fellowships in that case? Thank you.
We get these questions asked, especially from our residents who are from tier 2 cities outside the state.
Ashish, can I answer that?
Arthroplasty karne wala nahi hai. Should I, be bothered about this?
Ashish.
So from knowing a friend, I don't think anything should stop you. If you are really passionate about it, you should pursue it. I have just seen a colleague of mine go to Hubli, and he's looking at setting up the minimally invasive spine center in Hubli. So there may be very few spine surgeons, but if he's passionate about it, he's looking at setting this up. If he wants to do it, he should do it. And the same applies to you. Wherever you're practicing, if you want to do it, you should do it.
again, even tier 2 and 3 cities, they have a lot of orthopedic surgeons around. So if you have specialized in one field like foot and ankle, you can go and meet the other orthopedic surgeons and they can refer you their patients there. So I think even in tier 2, tier 3, if you specialize in one particular, you don't need to go in super specialization, but at least you should have a general understanding of that part of the body which you want to practice as. Yeah.
See, and the center at which you are practicing, I mean, that itself is a glaring example. You know, a super specialized center in Akola, which is like a tier 2 or tier 3 city, which has got so much volumes in Elizarao, which probably even a tier 1 city will not match. In fact, I think the volumes of tier 2 and tier 3 cities are much more than a tier 1 city, because here the patient has a lot of options. There is a lot of dilution because there is saturation, as someone mentioned. Yes, there will be scope for super specialists. Someone is asking about a hip resurfacing fellowship. So yes, there might be some space for really a niche, this thing like only shoulder replacement surgeon. More generalists may be required in the periphery, but yes, there is always a space for a specialist who can sort of concentrate his practice and work towards that. You see, in arthroplasty, most of the really high volume centers are not in tier 1 cities. You know, the tier 2 cities are doing really good volumes. Dr. Piyush just mentioned Ahmedabad. He's showing the kind of arthroscopy volumes probably will be seen in Pune or Hyderabad or Coimbatore. You know, Ganga is another example. You know, such high volumes concentrated at a tier 2 city.
I think, and somewhere also the fact that it's not that there are no patients of those particular specialties in those cities. It's just that there are no options. So if you were to provide an option, then that can become like a center of reference in that particular area. They won't have to come to, travel all the way to tier 1 cities. As long as you are able to deliver a safe patient care, given the limitations, you may not have access to a vascular surgeon or a plastic surgeon all the time. But given the limitations, as long as you're able to deliver high quality patient care, then I think you can eventually become a local center of reference. And of course, it always helps to keep ties with your mentor, because no matter how far you reach, there'll always be problems which sometimes you are not able to solve. So there's always a link where you can either refer patients or discuss patients. So it's important to keep those ties as well.
Right. So Dr. Dhaval Desai, who's from Surat, would like to take on your question.
So, Ashish, can I speak?
Yes, sir. We can hear you very well.
So, I think it's a very interesting question that the lady asked. I'm sorry I didn't pick up her name, but I would say
Dr.
that
Ishani Chaudhary, sir.
yes. So I think you should first be a good generalist and especially have a good grip of managing most trauma well. Then I think perhaps we'll have less reasons to refer to Milind the cases. I know who Ishani is, but I think what happens with our training programs is that the training in trauma is not adequate. Let's be honest and let's be truthful to ourselves. So I think people should spend time in getting the grip on trauma. Everybody just wants to scoot off into subspecialty without being a good trauma surgeon and generalist. And I think a little time spent after MS training on getting that answerability experience, when you're answerable for your actions, I think that's your best fellowship probably than anything else. So I think that would be a plan for somebody who wants to be in a tier 2. Then you pick up your subspecialty, take your time, and then go on to train. I think that would be my answer to her. Thank you.
Thank you very much, sir.
Just one point I would like to add that our orthopedic programs are 2 or 3 years, which I feel is a very short duration. Do you know how long the orthopedic program of Pakistan is? 6 years. 6 years. So somewhere I think things need to be changed at the
yes. So I mean, can you come to the mic? Yeah.
Sir, coming to the covering email, what are the common mistakes should we avoid, and how to format the email so that we get more interviews?
Yeah. So you have a talk on the email. Okay. So there is a last talk of the day where we are talking about CV building, and Dr. Meshram also has shared his talk. So all the recordings also you will get to refer. Yes. And he'll be coming online.
Good afternoon, sir. So if the basic plan is to probably spend 3 to 4 years in the UK and then return back to India to set up practice, which would be a better idea? Is it going through the training program in UK and going through the FRCS process, or rather spending that same time doing probably 1 or 2 long-term fellowships?
So I think if you get the MRCS done as soon as your PG is over, nothing like it, because you'll get the job where you want, but the specialty you want, and you have only 3 years in hand. You want to come back to India. So that will be the best choice. If not, go with MTI and see what you can get. And you should have a second plan B in mind, that I might have to change my specialty. So yeah, that's all.
See, and as regards your question, is pertinent only to the UK. I think Dr. Nikhil will cover it. But someone just mentioned that it is always a demand and supply. I don't know who mentioned. Yeah, I think so. UK is perennially in demand. Jobs will always be there. I don't know. Yeah, Drumin mentioned. Yeah, jobs will always be there. It's just that where you want to pitch yourself. He said district general hospitals are good, but teaching hospitals will have more trauma. So first job, you don't have a choice. You have to just get your foot in the door. You have to go to that country, and then you have 3.5 years to play with, and ultimately once you have built up your reputation, either you're at one place or jumping around in different places, like what Dr. Nikhil did. Started off at Nottingham, ended up somewhere in Southwest, finished his fellowship in London. So it always, that word gets around. Your referees will keep on talking. They'll say, okay, I'm referring this particular gentleman to you. He's very good. Just look after him. So वैसा करके your reputation as a trainee also goes on increasing. So even if you're planning to spend 4 years, you have to carefully craft towards that last year. So everything ultimately adds on, whatever you have done. And those are very astute guys. There is when they select the process, it's very clear. They will first go on to the last page. They'll see who your referee is. If the referee doesn't interest them, they'll turn back to the publication page. They'll say this fellow is useless. Every CV from India looks the same. Everyone is interested in cricket. Everyone reads and everyone does music. So you have to stand out. The only way you stand out is if you have to publish. So, I mean, I'll tell you, my boss used to say that he gets, I mean, see, you put in yourself in the shoes of, let's say, Dr. Sanjay Dar, if he's applying for a fellowship, he practices till about 10:15 in the night. He goes home, and then he's got this pile of applications to look at. He's got a pile of 50 applications to go through. What is he going to differentiate those 50 people from? Whether you come from UP, South, you come from North, he doesn't know which hospital you worked in. So he'll just say, "Ye publication foot and ankle mere, but I'm looking for a spine surgeon." Out. He doesn't have any publication. Out. He's too junior. So he will come with a inclusion criteria, and what will differentiate is how strong your CV is going to be.
Can I just add one more point? And I mean, we all talk about having good publications to get into fellowships, but has anyone thought why? Why is our publications given so much importance? One thing, yes, it does, prove that you're interested in that topic, that you have a certain understanding of that topic. But see, when you are applying to a fellowship, when you're doing a fellowship, you want to get something out of that fellowship, right? Similarly, the fellowship program also wants to get something out of you. So if you have a proven record of being published, it means that their work, which needs publishing, is more likely to get published if they appoint you as a fellow. Are you trying to understand what I'm saying? Yeah. So what they are going to get out of you is perhaps 2 or 3 publications, and that also, tilts the decision in your favor of getting a good fellowship. So having good publications during your training, immediately after your training, does impact your chances of getting a good fellowship later.
And if not for publication, something that trumps the publication is a reference.
Yeah,
and you need to have a good reference. If you don't have any publications.
So small add-on. So the more publication, the more hands-on you'll get. There's an indirect way, because the day you do publication and sit in the evening with your boss over a coffee or a beer, automatically you are developing that personal relationship with him, and your hands-on will increase.
So, I mean, unfortunately, like everything in life, it is a little bit of give and take. So that's something you have to understand.
So there's a question online on the Zoom chat. Is the best high volume centers to get hands-on training in trauma in Mumbai as a fellowship? So I think for trauma in Mumbai, it's not a challenge. You can take a SR job at any of those trauma centers. There are 5 medical colleges, and there are associate hospitals to that. So I think that you should get a good trauma experience over there.
So good afternoon, sir. Sir, just now I have given the exam. So if I pass, so probably 1 year I will have to do the bond in Assam.
You will pass here.
Probably. So, sir.
Exam ki tarah tha.
Assam. Yes. So, sir, For 1 year, there are some medical colleges where actually I'm interested in arthroscopy, sir. So there are some medical colleges where there is arthroscopy is not being performed. So if I am being posted in those medical colleges for 1 year, so and there is no reference even, so a recommendation is not there, and I won't be able to publish paper even for arthroscopy related topics. So next year, if I want to get into fellowship, what should be done?
Right. So if I understand correctly, you will get posted in a place where no one is doing arthroscopy. So in all likelihood, you will invest in an arthroscope, you will purchase a scope, and you will start doing basic diagnostic scopies for a little extent indication. But you don't know how to publish the data.
No, sir. For doing arthroscopy, I need to know how to do it. So it's I am not being exposed that much during my residency.
Right. So in a few talks, they mentioned that, first thing is start applying for courses. Courses like Bombay Orthopaedic Society, arthroscopy, we have a basic arthroscopy course, advanced arthroscopy course. There are too many courses right now which are happening. These courses are one of the best places to start because here the ratio is very good. I mean, BOS arthroscopy course, I think, has only 20 delegates and has got 30 faculties. So you can imagine there are more number of people who are coming to teach you how to do an arthroscopy. You are getting one-on-one interaction with them. You can stay in touch with them even after you finish the course. You can go and visit them. So basically, first thing is knowledge that you gain from that particular course. Next is you visit those mentors. They say that, this weekend I'm coming. I plan to stay in Mumbai for a week. Can I come and observe you, do your surgeries or so? So this is how I think during our time, people used to go. I'm sure you have been to Dr. Johari. You must have been to Dr. Anand Joshi, or, to see all these high volume surgeons or opinion leaders operate, do surgeries, maybe hang around in their OPD, do a basic courses, go back to your place, do your stuff, and then aim for a basic fellowship. So as Dr. I like that slide where Dr. Mandar showed that, first build up your base with doing an Indian fellowship and then go on narrowing your niche till the time when, as Dr. Bagari said, one is a finishing fellowship that, you've done your basic fellowship and that will help you get a finishing fellowship.
So can I just add on to that? I think one aspect of his question was that he does not have opportunities to publish. Isn't that correct?
Yeah.
Is it? So see, you don't always need cases to publish. If you look at literature, there are meta-analysis, there are review articles. So you can write a systematic review of things which have already been published. See, it is your ability to process data and churn out papers. That is something you have to establish in your CV for the fellowship application or the fellowship referees to shortlist you. So that can be done without patience. You can look at the existing data and write a meta-analysis or a systematic review of whatever is happening. You can choose a topic and write about it, but publish something.
On the same aspect, there's a question Dr. Rachit Shah asked that if publications are so important and he has finished his MS orthopedic without publishing anything, has he missed the boat or, he's been not guided well or so? But I would say that, there are national conferences. There is IOA Con, there is MOA Con, your state conferences. Every conference will accept at least a poster. I think a poster is the beginning. Once you get the taste of it, that your poster is being accepted, then you sort of start aiming towards a podium presentation. That presentation, maybe your dissertation, that presentation will become a publication. So that's how you start.
So I think one important thing about getting a fellowship is try to do an observership at that place. So that's so even at Wadia, even at my place, when I have a personal fellow, I ask them to come to that place for a week. So that is like a two-way exam. The fellow also takes an exam, whether he will be able to survive there for 6 months or 1 year or so, whether he likes that work or not. And also vice versa, the mentor also will know whether this person is worth taking for after 6 months or so. So always, and they will never say no for an observership. Go there for a week, see how it is. The person also will like you or dislike you, and then that will be the end of the road. So the observership is, I think, a good thing to do.
Observation is an excellent thing to do. I mean, even if you are going to England to give your MRCS lab or so, just write to a few consultants. Choose, you can profile them. They profile us, you profile them. Dekho kon Gujarati hai, kon Marathi hai, kon GS ka hai. I did that. So we had KEM alumni. We had the benefit of KEM alumni. So we just write to them. I'm sir so and so. I'm PBU sir student. I'm this and this batch. I'm coming to London. Oh, by the way, can I just visit Bridgend? And it's like Bridgend is like very far. But they say, okay, okay, come. And that is your first thing. So straight away by doing an observership, you're ahead like at least 100 places. If there are 100 applications and one observer, would you judge that observer more favorably? Yeah, because you have shown the intent that you have taken the effort to go there, come, and then you're ready to work.
So it's not like NEET which is like a MCQ exam and you score and the topmost candidate gets selected. A lot of other life skills and soft skills is also count towards getting a fellowship.
Yeah. My question is that in my residency, I was exposed to, let's say, plasty, spine, and scopy. And you keep hearing about these upcoming fields like foot and ankle, the endoscopy in spine, and other things which are not exposed to at all. Should I spend time exploring those, or should I just choose from the previous three which I was exposed to?
How curious you are. I don't know.
Do you already like something from what you've seen?
Somewhat, like, yeah. So should I somewhat, not like deeply. So
it's a very
and then the saturation factor comes in, like
So you want to-
plasty is saturated, this is saturated. So should you explore those upcoming fields which are not, or should you choose amongst the previous ones?
I think that's a very personal thing. Yeah, if you like something, you do it. If you want to spend some time looking at everything before you choose what you like, do it. But I think you should give yourself 5 to 6 years before eventually stepping out and becoming independent. So you've got time. If you've just finished your MS, you've got time to figure it out.
See, I would say that, see, if you are at the age of 40 or 45, if you're going to repent that, you had the opportunity to see someone and test this new technology, maybe you would have liked it. If you're going to repent at the age of 40, you might as well do it now. So that regret will be permanent. You can always train yourself, but if you feel that, the opportunity was there, I was in this place, I could have just jumped the unit and seen that. So that's why, more than one speaker has said that whenever you're on a fellowship, make sure you have enough, you go to other people's operation theater and see what's going on, because this time will never come back again. You got a chance to go to Kleinert Institute, you got a chance to go to Stanmore, you're never going to go back to Stanmore again. But that is the only time when your OT is finished early, but the other OT is going on, they're inducing a new case, just walk across. No one says no, they will welcome you and say, okay, wash up.
So I think your fellowship training should be like your arranged marriage. You look at all the options, but once you choose it, then you stick to it. And then don't regret कि अरे अभी hand करना चाहिए था रे. एक choose करो बस को जाए.
Is there a question, Nandan?
And just on that,
Yeah.
there sometimes ends up being some peer pressure as to I need to immediately select my specialty as soon as I finish my MS, which is absolutely not necessary. You can spend as much time as you need to decide on something that you're going to do for the rest of your life, right? So don't be in a worry that it's been 6 months since I have finished MS and I have not picked a specialty. It's completely fine. You can still spend 6 months and that's where the smaller weapon of observerships is absolutely invaluable. You can do observerships in different specialties and then figure out for yourself where your niche lies or where your interest lies.
So there's, I think there's one more question, right? Yeah.
So we'll take one question and then we break for lunch.
No, you take the
Okay.
question and you have something more.
So there's a very interesting question that's coming in. Getting into fellowships is what we have discussed. So there's a question at the end of fellowship, how do you realize whether you're fully cooked? Do you do one more fellowship? And how to transition into practice? So anybody has a take on that?
So transitioning, I'll just answer the question on transitioning because it's an important question. If you're doing a fellowship, it's a long-term fellowship. You should apply for a job if there is no job already cornered and you don't have a government job waiting for you. But if you are on a long-term fellowship already, you apply for a job. This is what most of the Western in US and Europe they do, and this should be done. If you are reaching the end of your fellowship and you've had a good experience, you feel satisfied, first of all, then you ask your fellowship mentor or your master to speak to the guy responsible in India, whichever hospital you want to apply. It makes a difference. If your mentor is famous, you are already in a fellowship, he speaks about you, he calls up somebody, he emails somebody, then you have a better, higher chance of cornering a position. It is an important thing. You should not waste time. If your fellowship is over, you don't have a job, transitioning can be a painful process. So that is a good thing to go about, how to apply for a job.
Yeah, so you need the job after finishing. So you better take all efforts. I mean, I can give you examples here. Parag is there. I mean, we just got a phone call from his mentor that, guys, just take this fellow. He's very good. So we just, so it works very well, especially in our Indian sector and corporate sector attachments, all the things.
So you should also be smart enough to get that particular attachment where you will be able to use those skills which you learned during fellowship.
Yeah.
So because if you learn some niche field and then for the next 2 years you have not done that field, then that is something which is not worth doing that fellowship. So you should be smart enough to get those cases which you have learned from your international fellowship.
There's a question on how to increase my publications in reputed journals. So you're speaking to the right guys. Dr. Nandan Marathe, some 99 PubMed Index journals. Dr. Prashant Meshram is the editor of CRR. Dipit Sahu, editor of JSES. So catch hold of these guys during the lunch break or during the program, write to them. They will give you a guidance apart from the talk, and we are addressing those, increasing your publications in your CV later on. Right. So I think we are okay with time, and I would like to invite Dr. Sanjay Dhar, who has got a couple of words to tell you. Apart from us asking you to be members of the BOS. How many of you are already members of BOS? There are a fair number of people.
Yeah, today is the right time. You have forms outside. So please be life members. And I'm sure it will be, if not life changing, but it will definitely guide you in your academic endeavors. So I won't be taking much time. No more advice from me. I will be just So I won't be holding you much for lunch. I'm just seizing this opportunity to invite you all to YROC 23. We classified it as the classic, and it will be in December 28th, 29th, and 30th December. So the theme is brevis longus, and I think it should inspire you all, because it is from the routine to cutting edge to the state of the art. And you will get to see the good, bad, and ugly of orthopedics there in itself. You have nothing else like YROC, because YROC, where we all sit together, whether it is hand surgeons, it is foot surgeons, it is shoulder surgeons, it is orthoplasty surgeons, everybody is on the same platform, and you have everything to look at. And in 3 days, probably it will guide you how you go ahead in your career. So this year I have particularly tried that it is more student friendly, young surgeon friendly, and probably everybody has some place in that conference. So experience the continuum of orthopedic care and be with the best. So workshops will be skill development, day-to-day plaster application, acute trauma, empathy workshop includes how to reduce cost for patients, financial security, ethical orthopedics. Everything will be tried to get on the same platform. Besides the usual cadaveric workshops, company-sponsored breakout sessions, and product orientation workshops. So program will be holistic, delegate responsive. I will ensure that there will be time for discussion, and there will be nothing will end without a discussion at the end of the session. So there will be avoidance of overlapping scientific sessions. Free papers I'm sure this will be a unique opportunity for you to present free papers in presence of your peers. So time to impress your peers who will be sitting in the hall at that time, because the free papers will be right after the session for that particular subspecialty. So it won't be a separate session. We'll try to get the best 5 papers at least in the same session as the peers are sitting. So those are the right time to impress your seniors. So it'll be ICL type sessions, enjoyable debates, subspecialty versus general orthopod confrontations will be tried to enforce. There will be town hall sessions. You can get your own X-ray, give it to the scientific committee. They will try to put it up and try to discuss it. If there's any complication, anything you want to discuss in open forum, there will be no faculty. Everybody will be there as a faculty, and it will be a no holds bar. Even galis will be allowed there. So, but it would be with a take-home message. So there will be lightning talks. Lightning talks means if you have any academic or non-academic thing which you want to present to your your colleagues, you can come and give it to us, and we'll give you the opportunity to present it. Lifetime orthopedic or non-orthopedic experiences, mindfulness sessions, wellness for orthopods, extra curricular skills from members, everything will be provided a platform. We will have invited presentations. I'm trying to get the best people who will motivate you, who will meet the legends and up close with the famous. So the effort is on. I'm sure all the faculty here can help me in that. So there will be a new session. We call it 5 minutes star speakers. So if you have the ability to speak in 5 minutes and present your presentation with all the messages you want to convey, and it is time limit strict, and there will be prize money for that. This is particularly for young speakers who are there on the endeavor, as I told you, to impress the peers. This is the opportunity. So, but the time limit will be 5 minutes. So there'll be something like Virox Cinema. If you have a very good, excellent 4K or high definition video, you will present it, we'll allow you the opportunity. So it will be like, and it will be discussed in presence of the peers. So everything will be done together, and there will be question answers. Beer and other thing will be served at the end. So then there is a new program. This is probably not for you who have already passed. So it is Student of the Year. We are trying to institute a clinical examination plus first stage will be clinical examination. Second stage, from that we'll choose around in from every institution in Mumbai and Greater Mumbai at the ratio of 1:5. For every 5 students, there'll be 1 student who will be promoted to the second stage, sort of a semi-final, where they will undergo a written test, either a multiple choice question or an OSCE type of question answers. And then we'll choose the best 2 who will be in the VIROC, and they will debate at different topics where they will in presence of judges, and there will be audience poll who will choose the Student of the Year. Who will get a big prize money. It will be a surprise for everyone. Then there is something for you. If you are less than 5 years post-MS, within the last 5 years, and you have some skill to present, and you have done some research on any topic, something which you want to show to your peers, again, there will be judges sitting. It will be an online activity where you will present you will give 15 minutes to present this. Then again, we'll choose the finalists from this who will debate in the final VIROC, from which we'll choose the BOS Rising Star, actually to be legends for the future. So somebody like Mandara Gashe of future. So come there, join it. And the only way you have to come is to register for VIROC and try to be a BOS member. So then there will be exhibitor arrangement, not for you, but there will be spaces where you can get product updates, and you can get product orientation. Your peer might be taking you around the stalls and show you some instrument, and which probably you want to learn from. So they will have the orientation sessions. So entertainment, BOS is known for it. Like always, it will be a blast, and I am sure you will love it. And then it will be unbiased academics curated by the best academicians. The program will be totally unbiased, and there will be no interference of the organizing committee in the program. And I'm sure this will be a window to the best. So I welcome you all. The forms are available or online. Please come and join VIROC, and I'm sure it'll be a good 3 days academically. Take a break. It'll be academics lakeside. You can get your families. We have enough rooms in the hotel. It is in Renaissance Powai, and I'm sure you'll enjoy the stay there. There'll be lakeside academics, and there'll be, like any Mumbaiya, there'll be no much. It'll be pure academics, and enjoy. Thank you very much. See you on 28th, 29th, and 30th December. For students, we have special rates, or people who are still as SRs or this, we can have special rates. If you have any problem in that, please write to me. My address and phone numbers are easily available, so you can call me and we can help in that. Thank you very much. Have a good lunch.
Yeah, so the food is served at 2 outlets. There's one here and one on the adjacent room. If there is lack of space, people can go inside the 3rd room, which is the hall called Ojas. So just space out. Darshan just guide everyone just to space out, and we'll start sharp at 1:45.
अरे वो स्कैनर है पहले ये जाके
to stay forever, forever. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay forever. Jump into the fire. I'd like to see your wild side. We should run away. But the sun never goes down. Time has slowed down. Would it be too crazy? Decided to stay forever. Decided to stay forever, forever. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay, stay. Stay forever. Stay forever.
You gotta put your past behind you. Look, kid. Bad things happen and you can't do anything about it, right? Wrong. When the world turns its back on you, you turn your back on them. That's not right. And maybe you need to listen. Repeat after me. Hakuna Matata. Hakuna Matata. It means no worries. Repeat after me. Hakuna Matata. Hakuna Matata. Give me no worries.
Good afternoon, everyone, and we welcome you back for the post-lunch session. We have tried to keep the talks interesting, and I hope everyone stays awake for the post-lunch session. So the underlying message from all the talks that we had in the morning was of an Indian fellowship program before embarking on these fellowship program. So I guess now after orientation with the Indian fellowship programs, the afternoon session is going to be all about fellowship opportunities outside India. Our first speaker is Dr. Dipit Sahu, sir. He's an eminent shoulder surgeon attached with Jupiter and HN Reliance hospitals. He'll be talking about fellowship opportunities in Europe. And I'll hand over the mic to sir.
Thank you. Thank you, Nandan. So my brief here will be speaking about European fellowships, and I've done my fellowship in Europe as well as US and mainly in France, and these are the fellowships that I'm talking about probably are best done when you already finished your long-term fellowship somewhere outside, when you're fellowship trained already, because I believe the long-term fellowships in Europe are not or extremely difficult right now. There is no set pathway, but there are short-term fellowships available. I was trained with Laurent Lafosse for over a year, and that time, this is back, there were long-term fellowships available. Now it's only for Europeans. Non-Europeans are not preferred because of many issues, visa issues, license issues, and too many issues there. But short-term fellowships are available, I think 3 months, less than 3 months. These are the 4 centers in Europe. These people have really changed the way shoulder is practiced. They influence a lot of thought process about how shoulder surgery should move ahead or should progress. And their word is given a lot of importance. Whatever they write over the world is it changes the course of events. Whenever they publish something, it's discussed. So probably you can apply to them, but I think it's done a fellowship somewhere, and then you should apply to these people. So of shoulder surgery everywhere in Europe. And Christian Gerber is one of the geniuses of shoulder surgery who has written about each and everything in shoulder surgery. Nice is a place where Pascal Boileau practices. He's a legendary surgeon, and so is Laurent Lafosse. He's in Annecy. They are in shoulder surgery, and they do a lot of courses, arthroscopy courses, short-term courses, 1 or 2 days courses, as well as short-term observerships. Many people have been there, and I think it's worthwhile going there after a year or 2 is already spent in training somewhere in India or abroad. And extremely nice people, extremely busy and very well published. The email is available where you can go to, and you'll find all the emails there. There is a website. But if you write to them, they usually give you a chance to come over there for a few weeks, 4 weeks, 6 weeks, 8 weeks, and less than 3 months, definitely, because your visa will only allow you less than 3 months. It will not allow you more than 3, because those are short-term traveling visas. So these 4 are the big places, the opinion leaders, where you should definitely go once. Now, these are very high volume places as well. So each 3 to 4 rotator cuff arthroscopies, 3 to 4 shoulder instabilities, and 2 to 3 shoulder replacements. And there are many shoulder revision replacements now, and revision of revision, 3 times revision, 4 times revision. It is there to that level, because Europe started shoulder replacement, reverse shoulder replacement way back in 1990s. Came to US in 2004, came to India in 2011. So they've been doing replacement since a long time. So now they are getting so many revision shoulder replacements. These courses are very sought after courses. These are where you can go and meet them, a lot of people. So this is a Annecy live surgery course. They do 35 live surgeries. Then there's a niche course, there's a Paris course, and all done by very prominent surgeons. So what I think is 3 months visa is easier. You can go ahead with this long term. I probably think, and I'm not very updated currently, but what I heard was it's really difficult to get a long-term fellowship in Europe unless you are a European. And you need to get registered in medical council for that. So they only do it for you. They did it for me. And if you're going for a long-term fellowship, they will do it for you. I had to pass a French exam. So, but there is always an exam which you. So European fellowships, other than these ones that I already spoke about. So Alex Ladderman is a very well published guy, very popular guy. Innovated some of the procedures recently, like DAS. I was speaking to Nikhil. He's the one who innovated that procedure. Marcus Scheibel is in Germany. And if you go to this website, I think it has all the places with their mentors, emails. And this website is by Alex Ladderman. So myfellowship.com, if you go there, you'll get a brief about all the fellowship. They do match you. They do everything for you. And I think it's not very difficult to go via these websites and then go to a fellowship, but those are short-term fellowship, but those are also nice after you've done your fellowships. Thank you. Any questions? Any questions? Okay.
Thank you, sir. Next, I request Dr. Mohit to talk us through the current state of fellowships in the US. He has done 3 fully US MLE accredited clinical fellowships in the US. And he's going to throw some light on the way to go forward in America.
Thank you so much, Dr. Nikhil, once again for accommodating my talk a little earlier than expected. So this time I'm not going to talk about sports medicine, but talk about fellowships in the US in general. So I think who's interested in doing a fellowship in the US and wants to be there, no matter what specialty it is, can focus and, I can answer questions in the last. So doing fellowships in the US, when you do fellowships in the US, these are clinical fellowships. And of course, most clinical fellowships are 1 year or 12-month fellowships, especially if it's a clinical fellowship. There can be short-term fellowships, observerships, or research positions, which can be shorter. But if it's a clinical fellowship, it's bound to be about 12 months. Takes how to get there. Some pros, I think cons, although I would say none, but I would use the word almost. Also some research opportunities and clinical opportunities. So research definitely is relatively easy, doesn't require US medical licensing exams, works as a gateway. But I think it's not enough in isolation because it's not going to improve your clinical acumen, not more than a shadowing position that you would probably do anywhere else. A clinical position is tough to get. So just a little bit about orthopedic surgery in the US. It's one of the most advanced and highly competitive medical specialties as a career in the United States. A typical residency program in the USA is about 5 years. And I would tell you that even after completing 5 years, there are many American grads who actually continue doing a 1 to 2 year subspecialty fellowship in the US. Most orthopedic fellowships, like I mentioned, is about 1 year programs that focus on exactly that same specialty. So it's not like rotation in some other specialties, but a 1 year single specialty. So you name it and you have it. So these guys have almost each and every subspecialty fellowship that you would ask for, and all last for about 1 year. Of course, if you have the opportunity to do one, you'll probably end up doing 2 or 3, because you might then think that you want to end up settling in the US. when you'll have a Bank of America account and you'll probably invest some money in Robinhood. But I think so if you try to do a combination, it's going to be a combination of a hand, shoulder, elbow, sports shoulder, elbow. I think this is much more for an American grad, but I think for us, beggars can't be choosers. So if you get something that would probably give you continuity in your training and helps you not to come back and gives you an extension of your J1 visa or H1B, you're good. So experience to work in a clinical setting. So why do a fellowship in the US? So it is one of the most advanced places in the world in terms of the clinical care that it gives, the international standards that they maintain, working and treating patients in these settings in an FDA approved manner, and achieving best clinical care or learning what they do is something that is definitely to be in a position to be privileged. Technology is at its best. So I think technology is innovated probably in the US and it then ends up in the rest of the place. So I think you're seeing something that would come up to India after 3 or 4 years. So the implants that I was trained in, especially the reverse shoulder anatomic shoulder implants, are something that are still not available in India. Probably going to be launched by Stryker this year end. So this is something that I saw about almost 4 years ago. So you probably know the difference. Most programs are 12-month programs with graduated year-round clinical training in terms of the surgical skills and independence. Many programs are ACGME accredited. So American board accredited, which helps you get a full-fledged, full licensed job in the US later on. It's a one-on-one mentorship model. So it's not that the residents are scrubbing with you for the cases that you're helping your mentor with, but it's going to be just the mentor. So it's a good clinical and a surgical overall experience, both in the OR and the clinic setting. You're paid very well. So it's like a job. Although I think back home, you'll mention to your family or to your ship, but it's like a job. You're almost paid a PGY6 salary, which is around 80,000 to about $100,000 a year. Save money. You can have your own house, drive your own car. So life is going to be comfortable. And at the same time, you'll probably have the privilege of an advanced environment. Least possible racism. I think this is subjective, but I don't know if everyone agrees with me, but I think it's the least possible racism you'll ever have in any Western country. It's a gateway to a job in the US. So you can end up coming back, but you can end up taking a full-time job where the salary starts from about 450K a year, or $500,000, close to $500,000 a year. On a J1 visa, you end up getting a waiver job in an underserved area. So you can choose the fifth pathway, which helps you get a full-time job. And then you can decide on continuing with the job. Of course, the job will help you get a green card, as they know that you're surgically and clinically good, and you can commit them for a longer time. So mentors are truly mentors. I think they will imbibe and they will try to advance your skills in the best possible way. Not only because they want it, but also because every program is evaluated and very strictly ACGME approved. So their future accreditation depends upon how the fellow evaluates their training. Prestigious academic achievements, of course, even if you return back home, it is something that is definitely valued. Gives you improved job or an attachment prospect in a corporate setup. So what it takes, I think it takes a lot of patience. It takes a lot of perseverance and grit. I think a good waiting period for most. I think some are lucky and end up getting their first clinical fellowship even without a research position. But most have to do research here and being there and being interviewed by various programs. I think it definitely needs a dose of luck. So you are competing with the American grads. They are PGY fives who are passing their residency and probably competing for the same position. So I think the luck factor has to be credited. A stable family support. So I would tell you that there were a couple of friends of mine who actually gave a couple of steps, step 1 and step 2 CS or CK, and then they ended up their desire to go to the US because of some unfortunate or unforeseen thing happening in their personal life. So I think your family needs to be settled. They need to support you, or at least they need to be in a situation who can take care of themselves while you are out. Clearing US medical licensing exams is something that is a must for all clinical fellowships. You can't touch a patient whatsoever if you're not licensed in that state. So everyone who goes for a shorter fellowship is basically shadowing the mentor, but not clinically doing anything or even scrubbing. So it's a very strict environment. You also have to complete your step 3 before you end up actually applying for the SF match. So your step 3 score has to be available, and only then you can apply for the SF match. A research stint in a university setting is definitely something that helps a lot to get good US based letter of recommendations, which can help you match in the San Francisco match. So so how do you basically go about it? Depends on whether you want to do research or clinical. I think research in isolation won't be of much benefit, but there it doesn't need any US medical licensing exams. While you are there, you can probably prepare for your steps, interview, so it won't take the expenditure for you coming and going from India every time you're interviewing. You can email all major universities and the big guys out there to get a research position in the specialty of your choice, and just wait for your lucky day. Varies in the duration. I think it can be a 6-month or a 1-year fellowship. You would shadow your mentors, and then of course, like I said, it can bridge your way towards a clinical fellowship while you get the recommendations and you apply for the match. The publication, and it can be a paid versus an unpaid position. For the clinical fellowship, like I mentioned, you should be completing your step 3 before you apply for the match. Doing a research year definitely helps. Doing smaller international fellowships elsewhere adds up for sure to your CV. They would probably see some subspecialty interest in your previous publications or fellowships that would add up. Applying on the San Francisco match, which is the CAS, to get you an interview, and then wait for the match day. So there is a match day, which is blind interview for 5 programs. You'll be matched in one of the programs on that day, and it'll be just that you're committed to go to that program. So the SF match happens about 1.5 years before you actually start your fellowship. So again, I think planning ahead of time and giving yourself much time to do this is something that is needed. I think it's very important to anticipate while you're doing your residency, especially if it's in a hospital where the work is light or the program is not that great. You can maybe utilize your time and give the steps in the meantime if you actually intend to go to the US. That would save some time. Getting connected to friends, mentors, or just scanning the websites would help you get in touch with some people there. And I think then you just have to wait for your day. I think once you are into a clinical fellowship, then it's relatively easy to get another following fellowship. And then you can do 3 or 4 fellowships to ultimately get a job and get settled there. So the pros, I think, are many. 1-year programs, quality training, mentor-mentee model, most advanced existent surgical training that you would end up doing in world-class or Ivy League universities. It's like a job, and then it takes you to a real job in the US, and of course, back to India. That's also an option. And a chance to move to the US for good. Working at the same level as American grads. So I think no discrimination or difference in terms of the salaries or the exposure. Enters with anonymous surveys is something that, I think definitely maintains the quality. Easier start to practice if you settle there, and minimal learning curve because the exposure has been intense enough. I would still say that, my mentor used to tell me that the first 40 cases that you would probably do independently when you something that will teach you more than even like 5 fellowships if you do in a streak. So I think the independence, when no one is in the operating room, no one is supervising you, is something altogether. But I think these fellowships are tailored in such a way that they train in the best possible way that a fellowship would. And of course, I think the memories that you make are something special and something that you take, it's priceless. The cons, I think almost none, but there are cons. I think a waiting period, a lot of unpredictability about what's going to happen, a high level of uncertainty. So you don't know where you're heading, but you just have it in mind that you have to do a fellowship in the US no matter what. Some investment for sure. So When you go for the steps, especially step 2 CK, step 3, you'd have to travel to the US and also for the interview. So if you're applying for the match from India, you would travel to the US, come back, and then, wait for the match day. So I think taking a research year, staying there, maybe if the research pays you, that's the best case scenario, would definitely help you ease out these things. Family support is something that is a must, and family responsibilities have to be allayed a bit. I won't say wasteful years, but definitely these empty, inconclusive years where you're trying to, establish your practice, but I somehow have to get to the US. And when you come back, you can't breed on that fellowship or your practice. So I think these are probably inconclusive years, which you'll have to, just spend waiting for the time you get one. And that's a gamble. After a lull, which I experienced as you feel a little bit out of place because you're not in that setting for about 4 years and you're uncertain about your first job. But I think once you get in the system, it's an easy way out because on paper, actually, you're on par or better than your peers. Higher expectation on return to India. I think that's natural because you have been trained so much, you have spent so much time, you have given so many years to your training. But that's also a con because you expect, a lot when you come back. So, I mean, that's all destiny, but the expectations definitely increase a lot. In the terms of research opportunities in the US, I would probably ask all of you to scan this website called OrthoGate, which is a very updated website advertising for clinical and research positions, both for graduates and having an email address where you can email your CV. Of course, you should be mindful about what you're emailing, your updated CV, what's the content or the covering letter that you are attaching to it. But a research fellowship can be, you can always try it. And if they need one, they like your resume, they can pick you up directly from India. And then, of course, for the research positions, you can apply to individual universities, which are all major programs of fellowship directors, to see if they have a subspecialty research position. It may not be paid, but it will LORs which can help you apply for the match. Then short-term observer fellowships are very good. I think they're good for people who are in practice but want to get updated about the current scenarios. What are the advancements? It takes about 4 weeks, and you'll be updated about what you need to add to your practice. And this also can be searched on individual university websites. Again, the true clinical fellowships, the one-year ones, can be applied only on SF Match. It's a centralized process. And then you also have these post-match vacancies that come on the SF Match. So these are very lucrative and can fetch you a direct clinical position if they need one and they're starting a program, say in the next 1 or 2 months, because they don't have a fellow and they need to fill in the position. So always keep a lookout on that, especially after you've done your steps. And of course, OrthoGate also advertises for clinical positions. Thank you for your kind attention.
Thank you. Thank you, Dr. Mohit, for nicely summarizing pathways to the US. We'll take all questions for the speakers at the end of the session. So our next speaker is Dr. Supreet Bajwa. He's a rising star in the field of arthroplasty. He's passionate about direct anterior approaches to the hip. He's fellowship trained in Australia, and he'll be talking about opportunities and avenues for fellowships in Australia.
Nothing to do with spine. I don't do anything to do with spine, okay? And how many of you are sick of giving exams now? Okay, that's a decent 70-80%, which rules out places like the US and UK for you guys. Which was my reason for choosing Australia, right? We're all he's setting it up. I'll wait. Yeah, so my name is Supreet. You guys don't have to take your cell phones out or take any pictures in this, because at the end of the presentation, I have a QR code. Take a picture of it. You'll have my whole presentation. You will also have documents that you need to apply for the fellowship. help you guys a little bit, right? So I'm one of you all. I'm recently passed. I will give you a brief introduction about myself, and these are my mentors. I worked with Sol, David, and Yasser in 2019, 20, and 21. Finished my fellowships and then came back to India. A brief about me: I finished my D.Orth in 17, DNB in 19. Immediately got onto the fellowship program. So I basically I'm a little bit of a black sheep in all the conversations that have happened here until now. Did my first fellowship in Sydney, and my idea was very clear when I went for a fellowship. I wanted to do only hip and knee. I wanted to do only niches in hip and knee. So whatever I could learn, which was different, bring back to India, I wanted to do it, right? So my first year was in Sydney, and I did a super path. That's a surgical approach to hip replacement. I thought it was pretty good. But when I read about it, in India, you don't have the equipment to do super path. So that was a big sort of a bummer for me. My second year and my third year of fellowship and consultancy was at the Orthopaedic group, where I learned direct anterior approaches to hip replacement and kinematic knee aligned knee replacement surgeries. So first simple question is, why would you apply for a fellowship to Australia? One, it's an English speaking country. It's an easy transition. It's a good place to be. The diaspora, yes, there are talks that there are racisms, but if you're not a troublemaker, trouble won't change. The orthopedic practice, the skill set is pretty good in that country, right? From sports, spine, arthroplasty, any subspecialty, they're doing top-notch work there. So it's a good experience. And you know, the fact that you could live in a country being a part of that system. So I really wanted to do all of these, and these were my reasons to go for a fellowship abroad. Now, when I landed in Australia, right after my residency, all of us, you know, most of us here are just after our residency. And if you were to land there, you will have a certain lacunae in your practice. That could be your surgical acumen, your clinical acumen, your research acumen. You know, you could be missing out on any of these factors. And I struggled with them as well. It was a new country. It was a new place to begin. And it was a very different. Nobody called me Dr. Bajwa after 5 p.m. Everybody called me Supreet or a whale. So it was a nice experience for me to drop that tag and live my life comfortably. So when I started in 2019, it was more of a challenge to really go on and get more information on how really the fellowship program would be approached in Australia. The good thing is there is no rule book and there is no norm. There are no exams. Okay, so that was always a nice thing for you know, to start off with. I didn't have any, you know, apply for positions in Australia, and there was no blueprint that was given out to me. So what I did was I ended up in the slides later on, I'll explain how I ended up applying, but I ended up sending emails to specific fellowship, sort of directory locations. And they would come back to me saying I wasn't eligible. And I remember it was close to 50 emails and 50 rejections, right? So the reason for rejections to me at that point of understanding was the fact that I didn't have the research acumen that was required to be a part of their system. Everybody wants credibility, and your credibility is proven by proven results. Really, people here spoke about recommendation letters, but unless your recommendees know these people in person or personally or have worked with them, it really doesn't add value. You know, so you have to have your research acumen. For example, when I first applied for my Australian fellowship, I had 2 research papers and I was rejected by all of them. My second attempt, I had 12 research papers as a resident, and I had 4 acceptance out of 4 applications, right? So it's quite a stark difference. Another important point that's the last line is the fact that you have to prove your intent to be there. I think one of the biggest things that you can do very comfortably is invest in giving IELTS or TOEFL. Just give the exam, get your scores out, write it on your application letter that you're really keen to be there. This would prove to them that you have your credentials sorted and you're ready to go there, right? So these are a few pointers that you can use. The application portals are just 3. The AOA fellowship directly is one of them. Now, this has got a list of all the places that you could apply to. There's about 50, 60 of them. You can individually send them an email. Again, all of this is going to be present at the end of the slide. You will have the QR code, so don't worry about taking pictures. Then there's an AIMS fellowship directory, which is again very helpful. Similar or different people and different programs which are you. Generally, I believe that when you're going for a fellowship abroad, it should be a long-term fellowship, anywhere between 6 months. It's the time that we at our level of skill will take to develop that acumen to implement it when we're back here. Now, I would suggest you start applying at the end of your residency. So if you're at the end of your residency or if you've just passed out, apply. This application process is long. It takes about 6 to 8 months to execute, but also you get fellowships after 3, 4, 5 years. You can utilize that time, do your SRships, build your interest into your programs and the specialty that you want to practice. So for me, it was just a simple episode. So I applied for my fellowship directly to Suleiman Qurashi. I sent him an email and he had a 5-member team waiting for me at 4 a.m. And we had an interview. It was a very informal interview. Hi, hello, what do you do? What is your experience like? Nobody expects you to be a trained orthopedic surgeon. They expect you to have your will to learn. That's what they want to see. Nobody's going to ask you what surgeries you can do. They're going to teach you that, right? So be very clear on that. You don't need to be an established orthopedic surgeon to get these fellowships. And that's what I recognize very early. The documents are basically just these 4, and AOA will provide you a fellowship coordinator. That person will basically give you everything that you need for all your documentations. Excuse me, for Australia. So all of that will. Indian documentation is your solo effort. So you're going to be running from one place to the other. If you don't have friends in Delhi, make them, because you will need them for your MCI and your DNB NAT board paperwork. And that's all, which is very, very important. Time. Now, did I get what I wanted out of my fellowship? So this is where I find the right reasons to go for that fellowship. I heard somebody say, Tier 1 city, financial backing, Tier 2 city, Tier 3 city, competition. All these are factors that you before you apply for a subspecialty, right? So for me, cutting was not. But if you go into a private program and if you expect cutting, that's a wrong expectation to have, whether it's a fellowship in Australia, US, or in India, right? So if you want to get a fellowship like that, where you get your hands dirty, apply for a public position, right? So these are simple pointers. What I also learned is that my boss was not just teaching me how to do the surgery, but also the art of building a practice. It's been 12 months since I've come back to India, and I've been able to do it, reasonably well. One of the things that I think a lot of people overlook is the importance of protocols. After you've sort of come back to India, you start working in different hospitals. You know how to do the surgery, but you don't know what you want for the surgery. So fellowship is a time where you can really garner your protocols, make them and improve on whatever you need for your peri-surgical sort of working environment. My responsibilities during my fellowship was not just swooning for songs. It was also 5-day weeks, OT, OPD, ward rounds. I also did a little bit of on-call work, but I didn't really enjoy it, so I chose not to do it. All my additional lists were paid, which was always great fun. And I had an academic meeting once a week. This is me on the weekend, by the way, so. I managed doing, a couple of publications, and that's what's really expected of you as well. You have to show that you're there to work and that you're happy really being a part of the expect out of you. Now, what are the cons? What are the things that really, people get bothered by? Your own current clinical and surgical acumen to the amount of hands-on you're going to get. And that is the point. With your surgical acumen, you're not going to get those opportunities then, especially when you're in a private setup. So be patient with that idea, self-reflect, and maybe that's not what you should be going for the fellowship. Homesickness is real. I felt it in the second half of my fellowship program, where it was 2.5 years, and I had to come back because of COVID. So that's something that you have to be aware of, that you have responsibilities and priorities in India. One of the bigger questions that all of us, when we stay for 2-3 years in any Western country, is, can we stay there? Unfortunately, that's not a reasonable possibility. It wasn't for me, it could be for you. It was for a colleague of mine, who intended to do it. And but the problem is that you'll have to get into that training program again. And that is an investment of time that I wasn't ready for. But maybe at your stage, immediately after finishing your MS, that's a commitment you could give. So in Australia, all fellowships are anywhere for 6 months and above, some for even 18 months, but generally it's a 6 to 12 month period program. Now, most of the fellowships are really well paid. So you don't have to worry about the money, but you have to be concerned about the initial investment that you put in. So it's in the tunes of 5 lakhs. And this includes all the documentation that you'll be paying for, your IELTS, your tickets, your travels, your stay, everything that you need to transition from one country to another. So you have to be mindful of it, right? Long-term prospects, like I was mentioning, yes, they are always enticing. And everybody wants to move to a better place and live in a better working environment. But the orthopedic system in Australia is very, very well curated to the local surgeons. So they're not going to let you be a part of that system very easily, right? So the basic algorithm for them is you spend a couple of years of fellowship, you apply to to be a part of their system, they would reject you. Then you sit to give your AMC exams, then you'll work as a registrar, then you'll work as a fellow again, then you'll get into the program, spend 5 years in the program, and then exit that program. I think it's a commitment of about 10 years, and I wasn't ready for it. I mean, if you guys are, go for it. So choosing fellowships, I think that was one of the pointers that was brought about. I don't know what subspecialty I should be going in for, arthroplasty, arthroscopy. It doesn't matter. You're 2-3 years into your practice now. It doesn't matter. Spend a year doing arthroscopy, ditch it if you don't like it. Go to spine if you like it. A lot of people don't like spine, but go to arthroplasty if you want to, do all of those things. It's okay. These jumps from different subspecialties, because at the end of it all that experience is going to count. You're going to get rejected, get used to it. It's fine. All of us have been rejected, but it's a learning curve. Okay. So keep applying. Your CV, the most important part of your CV is the cover letter and the research section in it, so make sure that you have enough research in there. And I think all of us have been harping about research. So make sure that you get enough research in your belt to make sure to make your application. This is the QR code needed. And basically this will address 2 or 3 documents that you would need for your applications to Australia. Thank you guys, and all the best. In case you need to reach out to any one of us, feel free to come and say hello. We're not going to bite.
That was nicely done. From the southern hemisphere and arthroscopy plasty, we'll go back to Asia and the northern hemisphere. We have Dr. Ashwin Sathe. He'll be talking about his experiences in Korea and fellowship opportunities in Korea.
Hello. Thank you, Nandan, for the introduction and having me here. Now, let me first reassure all of you that most of you, if not all, are going to get a fellowship in South Korea if you properly applied for it. See, I believe firmly that the first international destination to accept an Indian surgeon is South Korea, because for the simple reason that Koreans do really is mainly because the reputation of the previous people who have already been there for the fellowships is so nice that I have been in touch with many Korean doctors, and all of them hold India in very high regards. All of them think that Indian doctors are brilliant, hardworking, and diligent. Now, why Korea? The Korea will give you best of both worlds. So you will have all the Western technology and you will have Asian hospitality. Many seniors of mine had previously gone to Korea, and they had a really great feedback that Korea is really something which you should do. And the other most important thing in Korea is the society itself focuses on cosmetic and being minimally invasive with least amount of scars, blood loss, etc. So whether you are applying for plasty or spine or arthroscopy, obviously, they will be trying to find out invasive way. So for me, I wanted to learn endoscopic spine surgery. So I decided to go for this hospital. So now how did I choose Woodidul Spine Hospital? I checked the literature for endoscopic spine and I could find that entire literature of endoscopy, 10% of the article that comes from a single institute, that is this Woodidul Spine Hospital. On their website and then just other factor which helped me was it was COVID time and only Korea was relatively isolated from COVID and they were still accepting fellows. So most of the fellowships were cancelled due to the COVID, but this hospital was accepting fellows. So that was a great thing. And what were the most important things? What were the new things which I learned, which I could not learn in India? Firstly, endoscopic spine surgery, as I mentioned earlier. The other thing was anterior and lateral lumbar interbody fusions. The other third important thing which nobody does in India is spinal ligament reconstruction, that the posterior ligamentous complex is reconstructed. And to our surprise, in Korea, microscopic surgeries are called open surgeries. But in those surgeries, their emphasis is on non-fusion surgeries. So there are some technical things in terms of the philosophies of the Korean surgeons that were really interesting and that I should visit this country. Now, how was my surgical experience and how is the hands-on actually? So in terms of endoscopy, no, they did not allow me to do any independent endoscopic spine surgery. However, they allowed me to handle their scopes on dummy models and cadavers. So I had this opportunity to cadavers and dummy models, and I could observe in 6 months period, I could observe 267 cases. So this particular center is such a high volume center that every day they operate 36 spine cases. So they have 8 spinal OTs, 2 only for endoscopy, 6 only for open surgeries. And the last case is induced at 9:30 p.m. As you can see from this chart, I could actually assist in 83 cases out of the 145 cases. As freshly graduated students can apply for Korean fellowships. So broadly, we can divide it into 3 main categories. You can directly apply to the university, or you can apply directly to private hospitals, or the easiest and the most common way is to apply to the individual surgeons. Now, when we think of you applying directly to the university, Seoul National University is the biggest and the most prestigious university in Seoul. It is the Harvard of South Korea. So every Korean graduate wants to get his training from Seoul National University. This is the Seoul National University website. This looks like this. So you have 2 types of programs offered by Seoul National University. One is sponsored and the other is non-sponsored. Obviously, the sponsored program has a tough competition from over the world. Non-sponsored are the programs where they are not going to pay you anything. So your chances of landing a fellowship in a non-sponsored program is higher than getting into a sponsored program. Now, the other option is to apply to private hospitals. For example, the hospital which I applied to, the Woodidul Spine Hospital. The process is really simple. You can directly go to their webpage. These days they have my photo here, but there is a simple form that you can fill. And you can fill the form, give 2 letter of recommendation and give your letter of intent, attach the CV, and that is the whole process. So you select the hospital, go to website, and to LORs and CV, and then give the interview if you get shortlisted, and then wait for the good news. Now, the good part about Korean fellowships is you have to give only 2 CVs, letter of recommendation. For most of the Western fellowships, you need 3 letter of recommendation. Sometimes it is really difficult to get the third one, which was in my case. So I did have 2, so I could apply to Korea directly. And that is the reason why I believe that getting into Korean fellowship is really easier to get into other Western countries. So how do you manage finances in Korea? So I get asked this question many times, that how do you ठीक है Korean fellowship तो मिल गया, but how do I manage my finances? All are the fundings really good? So if you compare to the fundings in Europe, UK, or Canada, Australia, the funding is really meager. For me, Wuridul Spine Hospital, they used to give me 3 times food in Korean style and 60,000 Korean wons, 600,000. So that is approximately $600 a month. So, it is just enough to, live comfortably. Now, if you see Seoul National University, they pay 1.8 million Korean won, that is $1,800. And there is another hospital called Nonnuri Hospital, which gives accommodation plus 3 times food plus some stipend. So ultimately, the choice comes on to which hospital you want to go to based on the professors who are working there. If your previous fellows have gone there, and if they are ready to give you recommendations, or you feel that this hospital is good. The good part about Wuridul Spine Hospital was, in the website it was mentioned that assisting in the operation theater is allowed, while the other Seoul National University and Nanduri explicitly mentions that it is more of an observer kind of thing. So I decided that I would apply only to Wuridul Spine Hospital. Now, what happens for non-funded fellowships? Here you are on your own. So approximate cost of living in Seoul is approximately 1.5 lakh per month if you plan to have food, have good accommodation. So these are the things which you need to keep in mind if you are really going to plan to go to South Korea. The other best, and this non-funded fellowship is mostly in cases where you apply directly to the bosses. So how you can do is, most of the Korean doctors are active in social media. So you can just check out Facebook, and you can see some people who are doing their work, publishing it on Facebook. You can find out their emails, or you can directly message them on Facebook, and most of them will respond. Some of them will give you email addresses and would tell you to send your CV, recommendation letters, etc. So now, what other is there in Korea other than academics? So there are so many nice places to visit. It's a really underrated country because we really don't know much about Korea. But once you go there, you fall in love with that place. And it's really, the time which I spent in Korea is really memorable. And most importantly, Korean people. As I mentioned earlier, the Koreans really like Indian people. And because of the reputation that we have in Korea, that Indians are hardworking, diligent doctors, they are ready to accept you, they're ready to mix with you, and they will love to party with you. So I think that's it about Korean fellowships. If you have any questions, we can take in the end.
Thank you, Dr. Ashwin, and he has traveled all the way from Solapur to participate in today's session. So that was a very comprehensive and honest presentation about life in Korean university. So we now move on to the most sought after destination probably for Indian orthopedic residents, and that's UK. We have our convener, Dr. Nikhil Gokhale, who will be summarizing pathways to get into UK.
So good afternoon, everyone. I hope you are having a good time in terms of finding this program useful. I have named my talk subspecialty training in UK and not fellowship training in UK, and you'll find out why. So first of all, why UK? And the main reason for applying and working in UK is because of the NHS. Now, you must have heard a lot of speakers talk about getting a good hands-on experience in a public sector, and NHS is a completely government funded public sector. So 90 to 95% of work in UK happens in the NHS. They have a very small public sector, and in public sector, the chances of getting hands-on work is very high. And this happens with the best research evidence available. The approach is patient-centric, so no clinical harm is ever done to any patients. And you get to adopt a certain level of technology, which I must admit is perhaps not as cutting edge as perhaps some of the Southeast Asian countries or US, but you do get exposed to a certain level of technology which helps you later. Now, why does one need any training after 3 years of residency? Because technically you're fully qualified, right? You're licensed to do any orthopedic procedure. But if we look back in 1980, the orthopedic residency program was 3 years. All they did was perhaps some non-interlocking nails, splints, tractions, some very rudimentary plates. And today in 2023, where we have robotics coming in, sports medicine, subspecialization of almost 8 or 9 streams, still the orthopedic training program is only 3 years. Now, this is very unfortunate because in most of the Western countries, the duration is much longer. In US, it's about 5 years. In Australia, it's about 5 years. In Bangladesh, it is 5 years. As I mentioned, Pakistan is a 6-year orthopedic program. So I think this is something which is highly inadequate in terms of even basic orthopedic training. And hence, I feel that there is a necessity to increase this training, not through the NCI, of course, but in your own personal development. Now, while talking about the duration of training, let me just take you through the UK orthopedic training program. So after finishing med school or MBBS, a UK trainee typically does 2 years of what is known as foundation year training. That is like our internship. So they rotate to various specialties and they spend 2 years of their lives doing internship. This is followed by 2 years of core surgical training. This is more focused on surgical specialties, but still the work profile is that of a house officer or a houseman. And the job is essentially ward-based with little opportunity to go to theaters. Now, this is followed by 6 years of specialist training, where you are a registrar, a specialist registrar posted in orthopedics. And this is where your actual orthopedic training happens. And it is after these 10 years, 2 + 2 + 6, 10 years, that is when they apply for fellowships. So most of the UK local fellows will be in their early or mid 30s by the time they apply for clinical fellowships. So it is very difficult to compete with them with our level of training and the stage, of career in which we expect to get fellowships. And just to give an idea of their training program, this is from their deanery website. In 6 years as a registrar, they're expected to do a minimum 1,800 surgeries, which is about 300 procedures per year. So an average UK trainee has already done 30 carpal tunnel decompressions, 40 arthroscopies, 40 total knees, 40 total hips. And the list is comprehensive, but you can imagine what you're competing against when you're applying for a structured fellowship in UK. So if you're applying for a knee fellowship, it is expected that you already know how to do a primary knee replacement. It is expected that you already know how to do an ACL reconstruction. So you have to increase your level of expertise to a certain degree before applying to structured fellowships in the UK. Now, there are two main obstacles for us, for Indian medical graduates. One is work permit. So when you do a structured fellowship in UK, you're technically doing a job which is fully paid and you are there on a work visa. So you need a work visa, which you get after you get the job offer from the particular hospital you've applied in. And the second obstacle is getting. Now, broadly, there are two ways of getting into UK. One is something called as a medical training initiative. Now, this is a program run by the Royal Colleges in conjunction with a lot of hospitals in the UK to fill in the vacancies which they have in their training system. And what essentially they do is they give you a work permit and they give you GMC registration. So you don't have to give any extra exams apart from an English test, of course. And then you can start your training in the UK. The other way is to get your GMC registration on your own, which happens after either giving the PLAB, which is a professional linguistic ability test, or the MRCS. And once you get a GMC registration, apply for jobs, secure a job, get a work permit, go there. Now, the MTI, as I said, it's a program run by the Royal Colleges in conjunction with the hospitals, and is essentially to benefit their system. So the vacancies which are not filled in through their training programs are the ones which are given out through the MTI route. And essentially what they do is you get a special type of visa, which is restricted to 2 years. Your first year generally is that of a house officer. In the second year, you work as a registrar. But the good thing is that you don't have to give any extra exams apart from the English test, and your work visa as well as your GMC registration both get sponsored by the Royal College. Now, these are some of the places where this MTI route is applicable. I'm sure most of you would have heard about the MCH program, which is run by Wrightington. They come here once a year. They hold interviews somewhere in the south. So essentially what they've done is they've combined the medical training initiative scheme along with an MCH, which is like a theory-based program run by the Edge Hill University. So you apply for that program, get yourself enrolled. The fees are quite high. It's 35,000 pounds, which is almost 35 lakh rupees. It's supposed to be paid in stages, but still. And in return, whilst you're there, you get a job. First year is that of a house officer. Second and third year are those of a registrars. Then there are these other fellowships which are also use the MTI route. Now, the second route, and which a lot of people like myself have used, is to get the GMC registration on your own. Now, there are two ways of doing this. Either take the PLAB exam, which is like a general medical exam based on MBBS knowledge, or the MRCS. I would always recommend taking the MRCS because after your post-graduation, this would be a more relatable exam. Plus, it gives you the eligibility of applying for registrar jobs in the UK. Because for the transition from a house officer to a registrar, even the local UK trainees need to have cleared the MRCS exam. It has two parts. The first is an MCQ-based exam. The second is OSCE-based exam. Both of them are held in India. So traveling expenses are that way not too much. And once you are done with your exams, with your English tests and EPIC verification, that is basically ECFMG verification of your primary degrees, you can apply for GMC registration. Now, once you are on the GMC's registrar, then you start applying for jobs. Now, these are two websites, nhsjobs.com and trackjobs.com. Every job in the UK gets, in the NHS gets advertised on nhsjobs.com at some point. So it's very easy. There's no specific time frame, as Mohit mentioned, that the 31st of July is a closing date for USMLE applications. These jobs keep coming up as vacancies keep on happening. So you just have to be alert all throughout the year and wait for the right opportunity. Now, when you start your work in UK, it is quite possible that your first job is going to be a house officer's job. And I don't think that's necessarily a bad thing. You end up learning a lot of skills of perioperative patient management, which we perhaps lack. But then your aim should be to transition into a registrar job in 6 to 12 months. Now, finding the appropriate posts. So once you start applying, you'll realize there are a lot of jobs which are advertised online, but how to know whether one particular job is something you would want to pursue? So, for example, for arthroplasty, in UK, they have a national joint registry wherein every joint replacement done by every surgeon in every hospital is recorded. So you can just go to the National Joint Registry website, click on the hospital you want. This was where I did my registrar job. Click on the consultant under which you'll be working, and then you know how much is going to be his workload in a year. And because NHS is a public system, about half the amount of work of your consultant you would be doing if you are on good terms with your boss. So what does it entail while working as a registrar? Generally work closely with one consultant. Your typical week has 2 days when you operate, 2 days when you have clinic, and there is generally an on-call commitment once per week, and maybe once in a month you have to do a weekend on-call. You get some time for research and administrative work, and roughly 50% of the operating load, you'll be doing it yourself as a first surgeon with the consultant supervising you in person or standing in the OT. The salary is not bad. You get paid around 50 to 60,000 pounds per year. You get 4 weeks of paid leave, 10 days of study leave, and there is research allowance as well. Now, you've done your house officer jobs. You've been a resident for, you've been a registrar for some time. You've developed your basic skills. You feel that now I'm at par at, UK trainees or applying for fellowship. The next thing to do is to start applying for fellowships. Now, CCT is essentially Certificate of Completion of Training. That is something the UK trainees get at the end of their 6 years of registrar training. And FRCS is a part of that training. It is just an exam. Just by giving the exam, you don't qualify in the UK. There's certain other things which also need to be done. But still, even if you've just given the exam, which can be done even if you're not in a training pathway, then your chances of landing a fellowship improve. Also, it is not always mandatory to have taken the FRCS exam. There are people who, based on their CV and recommendations, have gotten good fellowships even without doing the FRCS trauma and orth exam. A good CV always helps. Almost all the speakers have been harping about this throughout the day. You need to have good publications. Presentations is where you catch the eye of a particular boss. You interact during academic events. Your teaching and leadership skills should be reflected in your CV. You need to have contact with previous fellows. Now, finding the fellowship in UK is not very difficult. Once you decide a particular subspecialty, there are societies like the BSSH or the British Society for Surgery of the Hand or the British Orthopaedic Foot and Ankle Society, and they have the websites. And once you go on them, you'll find an exhaustive list of accredited fellowships which are added there. So finding a fellowship is not easy, but is not that difficult, but getting one is. You try to meet the academic supervisors and academic events and conferences. Keep talking about what you want to do. I have personally realized that that helps a lot. Keep expressing intent. This is what I want to do. This is what I want to do. This is what my plan is. And somewhere the word will get around and, things will start working out for you. Physically visiting the center also expresses a lot of intent. You need 3 referees, which I don't think is that much of a obstacle, as Ashwin mentioned. And good recommendations, and ideally a phone call. So at least in the UK, people don't recommend you unless you're good. And if somebody personally picks up the phone and recommends you, then that is considered to be better than 100 publications. So if you impress somebody enough that they are happy to put in a word for you personally through communication, then nothing like it. And sometimes luck. You have got to be at the right place at the right time. And this is something which I have personally experienced. So my journey in UK began after my bond year here. I was an SHO for 6 months. Then I was a registrar for 2 years. I took my FRCS exams and I was applying for fellowships. And there was a point where, nothing seemed to be working. And I was working with a knee consultant at that time. And he knew what my eventual plan was. And he met a colleague of his, Mr. Jonathan Phillips, surgeons are called Mr. in UK, who was a fellowship supervisor at the Exeter Knee Reconstruction Unit. And they had a last minute vacancy because somebody had pulled out and got a consultant job, and they got talking and my boss introduced me to him. And that is how I got my first fellowship. And once I got my first fellowship and it was on my CV, getting subsequent fellowships was relatively easier. I got shortlisted more, I got called for interviews more, and I got 2 more fellowships after. Now, what does a work profile of a fellow entail? So you work closely with 1 or more consultants. Generally, it is a team in a central university hospitals. You'll have 2 to 3 days of operating lists. You generally start off by operating under supervision, but once your consultant develops enough faith in your abilities, then you start independent operating. We will have 2 OPD or clinic days. There is something called as MDT meetings, which happen every week or every 15 days. There will be journal clubs, 1 day for research and admin work. The salary and leaves are similar to that of a registrar. You're expected to do 1 to 2 research projects. Again, research is not always mandatory, but it definitely helps. And there is no exit exam. Now, once you are done with the fellowship, what do you do next? There's always an option of coming back to India. You can continue to work in UK. Now, the immigration system of UK allows you to become a permanent resident, like that's the equivalent of a green card, essentially, if you are continuously on a work visa for 5 years. And then after 1 more year, you become a UK resident. So there is always an option of settling in the UK, becoming a consultant and continuing work there. And a lot of opportunities in other countries also open up. So once you've trained for a significant amount of time in UK, once you've done fellowships, once you've taken the FRCS Ortho exam, then getting a job directly into countries in the Middle East, Australia, Canada becomes, and I'm talking about consultant jobs, it becomes slightly easier. So in conclusion, if you plan to subspecialize and work in the UK, it is a slow but sure way of training. You generally have to start at the bottom and then gradually work your way at the top. Prepare to invest 4 to 5 years. There is excellent hands-on experience, as NHS is entirely public sector. You get paid quite well during your registrar jobs and fellow jobs. There's a good work-life balance. You work 5 days a week, 2 days, the weekends are off unless you are on call. It is a good option to consider, especially if your spouse is also a medico, because even she has or he has an opportunity to work in the NHS. And there's always an option of settling in the UK and continuing there, and the added advantage of getting direct jobs in Middle East, Australia, and Canada because of your training in UK. So we'll take questions after Nandan's talk. Thank you all for a patient hearing. So let me introduce Nandan. He was our registrar in KM. He's done his orthopedic residency in KM. Then he worked at the Indian Spinal Injury Center, and he went to Canada for his long-term fellowship. He's recently come back and started his practice, and he's going to tell us about the Canadian scenario. So I hand over the dais to Nandan.
Thank you. Thank you, Dr. Nikhil. So I'm Dr. Nandan Marathe, and I'll be discussing about opportunities for fellowship options in Canada. So most of my talk today is structured based on my own experiences as a clinical fellow in the Department of Spine Surgery with the University of Toronto, which was for a duration of 15 months in 2020 and 21. In terms of why Canada, it was fairly easy. You get the North American experience without having to go through any additional entrance exams. So that was one of the major deciding factors, just like Australia, as Supreet mentioned. While deciding about Canadian fellowships, the good thing is there is a single point of contact. That is the Canadian Orthopaedic Association website. So when you go to the website, under the heading of Education and Practice, various fellowship positions are listed. So you click on the Education and Practice, you'll get various Canadian fellowships by program listed by university. So in my case, if you click on University of Toronto, that shows various fellowship positions that are available with the University of Toronto. The application process to Canada is fairly straightforward. Once you put in the subspecialty that you like, an email address pops up. That is the email of your fellowship coordinator, along with the requirements that are listed. So you send in those documents, wait for an interview. The interview option is also, you can either give an interview in person, or a Zoom interview is also available. So my interview was conducted on Zoom. Coincidentally, I was in Korea, so it was middle of the night, exact at the opposite end of the world. So the talk is basically structured as FAQs, frequently asked questions about Canada. If you look at the list of fellowship options that are there, there are multiple fellowship options that are present, and how do we choose which is a good one? So the first point is you talk to your past fellows and senior colleagues. So in Mumbai, there is no dearth of people who have done their training in Canada. We had Dr. Arvind Kulkarni from Bombay Hospital, who is an alumni of the same program, Dr. Arjun Dawle, Dr. Gautam Zaveri, all of these senior doctors have trained at Toronto. So I had a discussion with them as well as some mentors at KM like Dr. Tushar Rathod, who have visited these hospitals on a short-term program. Some of the previous speakers like Dr. Agash have mentioned that you can actually visit the place as an observer. So that is what I did. In 2019, the Global Spine Congress was held in Toronto. So I submitted my paper there. I presented my work, and on the sidelines of the conference, I also attended the same fellowship program as an observer. So they were quite open to having observers around. It's like it's as easy as putting in an email and they'll take you in because they don't have to pay you for an observer position. So an observer post for 2 to 3 weeks will give you a ground reality as to what the situation is, what is the hands-on experience. You can interact with residents and fellows and then move forward. In terms of requirements, I've structured these requirements as must-have and nice-to-have requirements. In terms of must-have requirements, your training, basically you should have completed your training, either DNB or MS Ortho, both are recognized. There is a website called FAMER, FAIMER, and that website lists out Indian degrees that are recognized in Canada. Along with your degree, you need a letter of intent, a current CV, and 3 letters of recommendation. At the end of today's session, we are going to have a very interesting talk by Dr. Prashant, and he is going to discuss how to structure these exactly. The most important point which helped me making a decision was there is no licensing exam that is required. So in terms of other must-have requirements, once you have your degree in place, it has to go through the ECFMG route or the EPIC route for verification. So you get your degree and you get it registered with the CPSO, that is the College of Physicians and Surgeons, and that degree should be verified by the University of Toronto. You will be a paid fellow with the university. They'll be giving you a salary, hence you require a work visa. This work visa is processed by the university and the wait time is at least 6 months. So consider getting your paperwork in order. You will require approximately 1 year to get all the paperwork in order. You have to provide evidence that your medical training was completed in English. So if your fellowship supervisors after your interview feel that you are well versed in English, you may not require an additional exam, or else you will have to give an English language exam with a minimum overall score of 93 and a minimum score of 24 in the speaking section. In terms of nice to have requirements, having a good amount of research and publications on your list really matters. I applied in 2018, fresh out of residency, with 0 papers on my list and was immediately rejected. Had to apply 2 more times with a good number of papers on CV, and that really helped me. Canadian Fellowship Program directors are looking at previous spine experience, because this fellowship is not only about learning yourself, but you will also have a teaching role wherein you are expected to actively contribute to the teaching of their orthopedic residents. So if you do have previous Indian fellowship experience, that will hold you in good stead. Recommendation letters from past fellows from the same university will help you. So in my case, Dr. Tushar Rathod had been there just 1 year back, and he's one of our bosses at KM. So his recommendation letter definitely helped, because there are previous Indian fellows who have gone there, have done good work. And like Dr. Ashwin mentioned, just like in Korea, even Canadian guys have a soft spot for Indian fellows. So if you see the current Toronto fellows, we have Dr. Raj from Sion, who's currently doing his fellowship at Sick Kids. There's Dr. Aditya Raj, my immediate junior from KM, currently a fellow with the University of Toronto. And the next guy in line is Dr. Prarthan Amin. So there are just 4 fellowship positions with the University of Toronto. 2 of them go to Canadian nationals, 2 of them go to foreign guys. And by default, every 3rd or 4th year, they'll have an Indian fellow on roll. So there's a good chance of getting into the program. In terms of duration, most of these fellowships last for 1 year. So usually the American fellowships begin in August. So the fellowship will commence on 1st of August, ends in July of the following year. There are options of 6-month fellowships, but I don't really recommend them because you really develop a rapport with your fellowship mentor at the end of the 6-month period. So you don't want to go home at that point. There is a possibility of a 2-year fellowship. So a clinical and a fundamental research year. In your research year, you're not exactly away from clinical work because you still have on-call duties. So every 4th day, you will be on call and still exposed to clinical work. You can add an extra rotation for subspecialty development. So in my case, in a 12-month duration program, 6 months were spent with orthopedic bosses, 6 months were spent with neurosurgical bosses. At the end of that, I thought that I needed to spend more time on deformity. So I did an additional rotation of 3 months with Dr. Steve Lewis, who does spine deformity. So there were options like MIS, deformity, C-spine, oncology, intradural work, and you can add an additional rotation and stay on for some more time. In terms of remuneration, Canadian fellowships pay well. Approximately your annual pay is $75,000 per annum, and it's increasing by almost $5,000 every year. So by the time you get in, it may well be $85,000 to $90,000. Dr. Supreet had a very interesting observation that all the paperwork that you do to get in has an initial investment which can go up to 5 lakh. Fortunately, in Canada, if you keep your records, most of the registration charges are reimbursed. Along with that, your entire stay is insured with the university. So in case of any medical emergencies or emergency expenses, the university takes care of it. There are some perks. For Indian fellows, you cannot do extra calls or locum duties like UK, but you do get some incentive for teaching the residents. During my time, $35 per lecture. So if you conduct, say, 20 lectures during your entire fellowship year, that's like some additional pocket money. If you want to present your work at conferences, you will be paid for it. In terms of holidays, like most Western countries, there is a very healthy work-life balance. Your average week is like a 5-day working week. Saturday, Sundays are off unless you're on call. You get 4 weeks of vacation every year, and it's a paid vacation, and 1 week of professional leave to attend a conference of your choice. So the orthopedic division will pay for your registration, travel, and other expenses. The caveat being the work that you present has to be conducted at the university. In terms of clinical duties, it's like any other clinical fellowship. You're expected to be present in the ORs, the outpatient clinics, as well as the IPD and ward rounds. In the OPD as well as on the ward, you are usually as a backup to the residents. So most of the groundwork will be done by the residents. You are in a more of a supervisor kind of role. You will have on-call duties. Every 4th day, you will be on call, depending on how many fellows are in the rotation. Like in my rotation, there were 4 fellows. So every 4th day, you will have on-call duties. Again, the on-calls are not heavy like your residency calls, because the orthopedic resident is first on call and you're expected to be a backup to him. Along with clinical work, there is a healthy dose of academic duties as well. Every week, there is a city-wide spine round. So every week you have to present your work. For example, in the city of Toronto, there are approximately 5 teaching hospitals with 30 fellows on roll. So once a week, all 30 of them meet and you present what you did in the previous week. So that's compulsory, weekly rounds. Teaching medical students and residents is a part of your job. You are expected to complete 1 research project, which you will present during your graduation. In terms of exit exam, there is no official exit exam as such, but your performance is being evaluated continuously. Before getting into fellowship, there is a PEAP, which is called a pre-entry evaluation and assessment program. This lasts for a duration of 3 months. So after you get into the program, the first 3 months, you're not allowed any independent work and you will be under observation with the supervisors. Only when they deem that you're fit enough to get into the program, you can go in, otherwise you are sent back. We had a Japanese fellow with us who could not clear his exams and had poor knowledge of spoken English and had to go back at the end of the PEAP program. After you get into the program, there is continuous in-training evaluation by the supervisor. So a local evaluation happens every month and a university-wise evaluation happens every 6 months. Interestingly, you also get to evaluate your teacher anonymously. Every month, you submit an evaluation of your teacher, and that determines whether they are allotted a fellow next year or no. You also have to mandatorily complete one research project. Once you complete your evaluation and your research project, you will get a hospital-wide and a university fellowship completion certificate. In terms of the post-fellowship connect, there is a healthy post-fellowship connect with the alumni. Ongoing research that you have been conducting, you can liaise with their current fellow and continue with it. You will still have access to limited data. There's a good potential to discuss your problem cases on WhatsApp groups, the alumni group, as well as a few websites. In terms of transitioning into practice, the bosses there will also help you with your instrumentation, getting into some organizations like the AO, leadership and teaching positions. So transition to practice is also assisted. Overall, if you ask me about my fellowship experience at Canada, it was a wonderful all-round clinical as well as academic experience. In terms of cons, the uncertainty and the waiting period is a major con because there are limited number of fellowship positions and you are competing with the local Canadian graduates also. So that is a major con, but if you plan it out and you're ready to wait for a year or two, you can get in. Other than that, the only con I can think of is the harsh Canadian winter, wherein for 4 to 5 months I was confined indoors. Thank you everyone for a patient listening, and I'm open to questions if any.
Quite a comprehensive overview of what every sort of continent and every place has to offer our Indian trainees. Yeah. So I'm sure there will be a few questions, and a lot of questions have appeared on the Slido chat, but in online. So we can combine these questions at the end of the both the sessions, if that is okay with all of you guys. Okay. So while we load, so while we load the next presentation, I would like to welcome our next speaker, Dr. Rajiv Raman. So Dr. Rajiv Raman joins us from Kolkata. He's an associate professor working in the medical college at Kolkata. He is currently attached to the AMRI hospital at Salt Lake and the Joint and Bone Care Hospital. He is the honorary secretary of the West Bengal Orthopaedic Association, the secretary of the West Bengal Association of Sports Medicine. He was an ex-editor of the Indian Arthroscopy Society, ex-editor Journal of West Bengal Orthopaedic Association. He's a convener for DNB exam, and he's a state representative of West Bengal for the Indian Orthopaedic Association. He's a national quiz master of the IOA PG quiz of the Indian Orthopaedic Association. And he's a convener of the Indian Arthroscopy Society, the SARC committee. Today, Dr. Rajiv Raman also joins us as a part, as he's also the coordinator for awarding the IOA fellowships, and he will give us a more sort of a better insight and an insider's look into what these IOA fellowships are, how we can go about applying for them, how many fellowships are there, and what does the thought process behind allocation of these IOA fellowships.
Good afternoon, everyone. Greetings from Kolkata, West Bengal. First of all, I would like to congratulate Bombay Orthopaedic Society for this wonderful initiative. So, as an inland fellowship,
Here's my setting. Mute version.
good afternoon, everyone. Greetings from Kolkata, West Bengal. First of all, I would like to congratulate Bombay Orthopedic Society for this wonderful initiative on instruction course fellowship program, and which is a hybrid program. So, as an inland fellowship of IUA, I will be sharing my experience and my what are the fellowship programs which are available with the IUA. So, the most important part is that I think this slide is visible. Yes, the most important part is that this inland IUA inland fellowship is available for all life member of IUA. So any of the life member of IUA can avail this fellowship program. We have different criteria. I will be coming through those criteria. I am currently working as a chairman of IUA Inland Fellowships, and with my co-member Dr. Rajesh Gandhi and Biswajit Sahu. We have a very good guiding force there. You can see here our president, Dr. Atul Srivastava, Dr. Ram Chadda, Dr. Anup Agrawal, Dr. Navid Thakkar, Dr. Sandeep Kumar, and our executive officer Ramesh Pandeyji guiding us for this functioning of the inland fellowship. So normally we start our inland fellowship application in the month of July and June or July, and that link you will get in IO website. So all IO life member can apply for the fellowship. The first link is for the eligibility. Once you click on this link, you will get what are the fellowship options available and who are eligible for this fellowship program. And then we have a Google form there so that you can apply to this Google form. You can upload your certificate, which are very important for marking criteria, because we have to select fellows from numerous applications. And normally the last date is usually 31st July. This year it is 31st July 2023. If you see the fellowships options, we have Dr. S.S. Babulkar Fellowship for Trauma, Dr. G.S. Kulkarni Fellowship for Deformity, IUA JMRF Fellowship for Pediatrics, Traveling Fellowship. We have 4 seats, which starts after IUCAN and they travel in different part of India. We have a very good senior fellowship program. It's a very modular program for senior members of IUA more than 40 years of the age. We have 30 seats for them. And very popular and the most popular, I think, fellowship program is the IUA Yuva Mentorship Fellowship Program. And in this fellowship program, normally the surgeon whose age is under 40 years of age, they can avail fellowship in any center in the India. The modality is that you can choose your center, you can choose your mentor, and you can plan your 2 or 3 weeks fellowship with a particular subspecialty. And then once you complete your fellowship, you will get a fellowship completion certificate from Indian Orthopaedic Association and a remuneration of approximately rupees 40,000. So most of this fellowship, what are the remuneration and what are the criteria and guidelines, you will get that in the link, and that is there in the IOA website. We have Dr. Ashok Sen Gupta visiting professorship program for senior professors who gets invited from a state association, and they can showcase their work there. And again, IUA pay 15,000 rupees remuneration for the Ashok Sen Gupta visiting professorship. For last year, we have started the fellowship with the different subspecialty. The IUA AOPAS Fellowship, IUA Indian Arthroscopy Society Fellowship, IUA Indian Arthroplasty Association Fellowship, IUA Indian Foot and Ankle Society Fellowship, IUA Asami Fellowship, IUA SICOT Fellowship, and IUA Spine Fellowship with Association of Spine Surgeon of India. And this year we have started IUA Trauma Fellowship with the IUA Trauma Society of India. The MU has already been signed. So once you apply for this fellowship, what happens? Normally, we have a committee that screens the whole of the application. Then we normally 15 to 20 days, after 15 to 20 days of timeline, we publish a result depending upon the criteria of the marking in IUA websites. It's a very transparent process, and I think all of you should avail this. And those who are not member and attending this webinar, please become IUA member so that you can avail this fellowship program next year. There are some new guidelines. There is a cooling period of 5 years, and 50% of the fellowship seats are for candidates from the tier 2 and tier 3 cities not working in teaching institute. And this was introduced by Professor Ramesh Sensar, and he told that why those guys who are working in tier 2 and tier 3 cities and non-teaching institute should not get the availability of inlet fellowship. And then it was passed in EC and later ratified in GBM also. So we will keep 50% of seats for the non-teaching institute so that every IU member can get chance to get trained at the center of any center of excellence. And now from this year, we have made it mandatory for mentee and mentor to fill evaluation form at the end of the fellowship so that we can have an evaluation of the center also. How these centers are providing the training opportunity, what are the number of cases at that particular center, and how the fellows are getting benefit for this fellowship. Normally, IUA Traveling Fellowship, which is a very prestigious fellowship, we had 4 seats, and here also we have divided 2 seats for the teaching institute and 2 seats for the non-teaching center, so that the non-teaching center also should not get deprived in getting the inland fellowship of IUA. So this inland fellowship for IUA, normally if you want to apply, go to the IUA website, click the link. There you have a section of the inland fellowship and apply the form. Once you apply the form, the whole of the Google form comes in our inland fellowship IUA Gmail Google form database, and from there we screen so who are eligible for which fellowship program. And if you need any guidance, please don't hesitate to call any of the committee member, including me, so that we can guide you how to avail this inland fellowship program. Thank you so much. Long live IOA, long live BOS, and thank you Bombay Orthopaedic Society for giving me opportunity to present the inland fellowship training. What are the training opportunities for the inland fellowship? I am available there for any question and answer session online. Thank you so much.
Yeah, right.
Hello, am I audible? Hello.
We are audible.
If there is any question, I can take those questions.
Rajiv, you can't run away. The question is the end.
All right. Sir. But Jamal sir is telling question is and I will be there till end.
Can I share it myself because I made some changes? Hello?
Admin, please allow Jamal sir to share screen.
Can I, Ashish, can I share it? Hello?
Admin, please allow Jamal sir to share screen.
Okay.
Can you stop sharing?
Co-host now.
Who's disabled sharing? Can I or no?
Yes, sir, you can also share.
No, but it says host has disabled sharing. Okay, now I can. Thank you. So I hope the screen is visible.
Yes, sir.
Can I start?
Yes, please, sir.
Yes, sir.
Okay. First and foremost, I must thank the Executive Committee of the Bombay Orthopaedic Society, Dr. Ashish in particular, for asking me to speak on the Asia Pacific Orthopedic Association Fellowship opportunities. Now, as all of you are aware is, what role does any academic association basically have? Well, as far as we are concerned, we are there just to act as the academic machine which oils the interaction between the academics and the young surgeons on a national and international platform. Every association has certain objectives. The APOA actually defines that one of the objectives as promoting, encouraging, and assisting education and training through fellowships and exchanges in the region, particularly in the member countries. That is how importantly we value our fellowships. So how do we go about achieving our objectives? Well, like any other association, we run annual and biennial congresses. Previously, they were biannual. Now they're going into an annual mode from Dubai next year. We have specialty sections, which maybe not be the norm with all associations. So currently the APOA has 12 specialty sections. Why am I telling you these? Because these specialty sections often have individual memberships and they also run individual fellowships, which I will come to. So now coming to the point that I've been asked to cover today, the fellowships and the ambassadorships. Now, the APOA currently runs 15 spine fellowships, 6 trauma fellowships, 6 pediatric fellowships, 6 arthroplasty fellowships, 3 exchange programs with the CCOT and the EFORT, and 10 ambassadorships. First, to define what's an ambassadorship. For every Congress, the APOA Congress, we get 10 young surgeons coming in from 10 different countries to represent their country at the Congress. They come in for about 3 to 5 days before the Congress, do some hospital visitations, and then represent their country in a special ambassador session, whereby they're supposed to talk about how orthopedic training is in their country, how it is different from the rest, and how they can contribute to the APOA region as such. So basically, they're not representing themselves, but their country. Now, fellowships, APOA, they are at world-class centers. There is an opportunity to train with world-class renowned faculty. The APO Secretariat shall arrange the airfares, arrange all the local hospitality, stay, and all meals during the entire duration of the stay with the help of the host center. They will give the young surgeon an opportunity to attend either the APO Congress or the sectional congresses. But most importantly, they're an opportunity for the young surgeons to develop lifelong friendships across the vast Asia Pacific region. Now, so we advertise these fellowships on the APO website. Also, we send it to the national delegates and the national associations to advertise them on our behalf to the members of their countries. The basic requirements are the young surgeon should be below the age of 45 years and he should be an APOA member. What's an APOA membership? Let me just tell you in the subsequent slides. You need to attach relevant documents and attach a letter of recommendation. Now, who can give you this letter of recommendation? Either your National Association president or secretary can give it to you, or your national APOA delegates. If you go onto the website of the APOA, the national delegates of all countries are listed. You can see them. In case you have difficulty in approaching them, please don't be hesitant, write to them. They will contact one of your superiors, and on the basis of the feedback they get from your superiors or your immediate bosses, they will write a letter for you. So what's an APOA membership? You can either join the association on your individual self as an annual member by paying a $50 annual fees. You can become a life member, or you can be a federation member. Now here, the membership is in lieu of your national association joining the APOA. Like the Indian Orthopaedic Association has joined the APOA, which makes it then all members of life members of the IUA are automatically beneficiaries of the membership of the APOA. In addition to these, sections also have memberships. These do not come complimentary with your IUA membership, but they are very nominal. It's only a $50 one-time payment. Now, the APOA fellowships are basically three types. They're short-term fellowships of 1 week, which are in conjunction with the Congress of the APOA or the section. Then there are midterm fellowships, which are 3 to 4 weeks, which may be at one concentrated center, or it may be at 3 to 4 centers whereby you shift on a weekly basis. You travel on Saturday and Sundays, and from Monday to Friday, you are in one center. So this gives you an opportunity to travel 4 centers. And then there are long-term fellowships, which are for 3 months duration. In this, in addition to arranging for all your local needs and airfare, a short, small amount of stipend will also be given. Now, how are APOA fellowships, in our opinion, superior to the ones that you get in North America and Europe? Well, for starters, you don't need to have any temporary registration in most of the APOA countries. The emphasis is on hands-on training, so you're allowed to scrub in and assist in surgeries, unlike most of North America and Europe. And you also get to participate in hospital rounds and clinical teachings. Now, what is the APOA Education Committee really looking for when they select the candidates? And this is most important for the young surgeons in India. Number one, they're looking for is focused and targeted specialty application. What happens is a young surgeon applies for a trauma fellowship, and 2 months later, he applies for a pediatric fellowship, and 3 months later, he applies for a spine fellowship. Now, first of all data is maintained by the name, right? So the Education Committee feels that you're not really targeted at what you're trying to learn. You just want any fellowship that you can get. That is basically a negative as far as they're concerned. Number two is your experience. You have no experience in arthroplasty, and you're basically applying for a fellowship that is for revision arthroplasty. Secondly, academic credentials. You might have 30 papers, but you're applying for a spine fellowship, and none of your papers are actually on spine. As far as they're concerned, that doesn't help you. You've done your paper publications in your college, your registrarship on giant cell tumors and tuberculosis of the knee joint. It doesn't help you for a spine fellowship. Most importantly is the involvement in APO academic activities. Have you participated in congresses? Have you participated in case discussion on the sectional websites? Have you written anything on the newsletters? And importantly, dear friends, the letter of recommendation. Often the letter of recommendations we get out of India are very generic. Very nice person, very hardworking, this. They don't talk about your clinical acumen and desire for that specialty. So please get a proper letter of recommendation. The centers range from the University of Malaya, University of Tokyo, the Prince Wales Hospital in Hong Kong, to the University of Melbourne, to Ganga Hospital, all across the Asia Pacific region. We, as I said earlier, have exchanges with the EFORD and CCOT. Just to give you an example, a young fellow, Hitesh Gopalan, goes to the Austria for the EFORD Congress. We have these Ganga Trauma Fellowships, which are for short durations, and then the Southeast Asia Arthroplasty Fellowships, which are 4 centers, 1 week each. Remember, accommodation in all 4 centers, transport between the centers, everything is arranged for. Finally, the other things that we look at is we have a journal, website. Now here I say, sectional websites have case discussions. Participate on them. You can only do that if you're a member of the section. Then you have a history with the section and the education committee, more likely to get selected. Finally, if I could, I think stop. Okay. And finally, the Emerging Surgeons Forum. A few words about that, if Ashish would permit me. We have an Emerging Surgeons Forum where there are representatives from every country. India has an APO Young Surgeons Forum. If you don't know about it, get hold of the people who do, become a member. It's an opportunity. I will give you 2 examples. I joined an APO fellowship, became an APO Young Surgeon in 2007 in Seoul, gradually progressed from the young surgeons into the main leadership role of the APOA. And to give you one of my favorite slides, this is a course in 2001. It was held in the University of Malaya. You can see certain people sitting in the front row. You can see certain younger surgeon is standing in the back row. This is Dr. Keith Look. He goes on 15 years later to become the president of CCOT. This is Dr. Rajeshekaran, our own Dr. Rajeshekaran. This is Dr. Ashok Jor, Dr. David Chun, Dr. Ashok Jori, all members of the APO Young Brigade 23 years back, went on to major leadership roles within the APOA and other international associations like CCOT. So friends, the APO fellowships are not only to train you, to get you to be better surgeons. We really can't do that in short duration of time, but they're really there to open your eyes to the countries beyond your shores. We want to develop stronger bonds within the APO region countries, bonds that unite us and deepen over time. We believe the future is created by what you do today, not tomorrow. I know getting fellowships is hard. It's a tortuous road, but where there is a will, you do it properly, do your applications properly, sooner or later, you shall succeed. Thank you for your patient hearing. And if ever you need any help or any assistance on them, please feel free to contact me. And finally, I take this opportunity to invite you all to the IOCON 2023 in Lucknow in December. Thank you very much. And thank you, Ashish, once again.
Thank you very much, sir. Thank you. It was a pleasure having you. And we would take the questions as the questions start coming towards the end of the session. And thank you very much, sir, for being here. So next, moving on.
Dhaval boss, I think you're muted.
Introduce him. Dr. Dhaval Desai is the ex-president of the Gujarat Orthopaedic Association. He's a very active member of AO Trauma. He's a chair of the research committee of Asia Pacific region for AO. He was the country council chair for India in 2021 to 2023, and now has moved on to the Asia Pacific role, which is a very big leap and a very great thing for India. That Dr. Dhaval Desai will be leading research chair for the Asia Pacific region. I would welcome Dr. Dhaval Desai for his presentation.
Thank you, BOS, for this opportunity, especially President Dr. Thar and Ashish for getting in to interact with young surgeons who are on the anvil for future growth and development. I think fellowship is probably is a lifelong journey, if I would call it, and you learn throughout your process of training. But I think with the current times, and I would try and focus mainly on what does the AO offer for trauma, because there are, I mean, everybody has so many options for arthroplasty and spine and all, but I think there are very fewer opportunities for training in trauma. And AO is one that gives you the chance for dedicated trauma experience that is beyond what you've learned. And I think that remains with you for your life. So I was listening to the current president of AO Foundation just last week, and he echoed that he really remembered his fellowship experience in his younger days. So similar things I've heard from Ram Chadda also regarding his fellowship experience. So let me share some thoughts on what AO trauma offers you. Why can't I not change the slides?
With him. Yeah, he's changing it.
Yeah, okay. So I think let me sort of say this disclaimer that I have never been on AO trauma. I mean, not been fortunate to be on an AO trauma fellowship. But if I look back at my journey, then I think the initial process of training in KM with all my blessed teachers, including Mangal and everybody, I think the guidance and the bonding that's developed from that has stayed for life. And this is what would happen when everybody would go on a particular fellowship. Somebody asked about what is post this thing training for trauma. And I think a lot of you must not jump into straight away into fellowship, but doing things independently. And I think especially in trauma, unless and until you take a call on what you do and you are answerable, I think you don't evolve. So spend some time after you finish, because I think those 3 years are not enough to be responsible and answerable for your actions before you really venture out into any fellowship. That would be my strong recommendation. I think those 3 years post MS working independently really evolved out. I've been lucky to have been in the UK for 4 years in what was a difficult time for progress. But I can say that experience of 4 years working with probably 16 or 18 consultants itself is a big, huge learning process, because you work with a different mind for every term you are working. So learn and absorb from everybody and anybody that you can get to learn. And this is what would develop or stay with you for a life. Let me tell you this story that I would have been a spine surgeon, but for the US Embassy people in London. I almost had a fellowship lined out, but the embassy lady didn't like my face, so she didn't give me the visa. Anyway, that's a different story. Having been for 3 weeks in France before I came back, you learn a lot of things about, how do you go and prepare for fellowship, or what do you think? So in France, the important thing was the language is a barrier. So the French hate speaking to you in English for various known reasons to them. But seeing a different place, a different center, a different work culture, managing the similar problems. So some of the things about knee preservation surgery was well much ingrained in those systems over there, and that was really a worthwhile experience. We are back to knee preservation now, that in a big way that I saw that in 1999. My AO journey, I think it's really, I owe to a lot of my mentors, especially my educator in AO, with whom I have a long bonding even now, so much so that I can pick up a phone and offer somebody a course in AO by that simple communication. Remember, I'm a small surgeon from a small city called Surat. If I can make it to where I am in AO, I think everybody in this audience who wishes and aspires and dream can reach out on their destination and goal. So what's it about this AO trauma fellowship? It's usually a 6 to 12 week duration short fellowship out of your country. The AO offers you a stipend. The stipend is variable depending on which country you want. So Your stipend in Indonesia could be different from that in US or in Germany. Centers that are offered are in Asia, Europe, and US. Don't underestimate the center in Asia. We have this fancy for everything, white skin, but some of the work in trauma, especially that's done in the Asian countries, is seen to be believed. So if you've been fortunate to see centers in China or Korea, the volume is just mind-blowing around there. Interact with people that even if you don't know, interact with people who know about these places and then choose your centers well. So I think you must research what you want, first of all, what kind of fellowship you're looking at, and then, look out for the options. So the AO Trauma website also has a list of host centers that you can look up. You can then, decide which is your best place for you. I think the fellowship really offers you a window for self-evaluation and self-change. If I look back at my 4 years in UK, I would not be what I am till that 4 years training I had. So it was something different from simple things like communications to patients. I think that's something you will learn which you may not have it in your training. Also, we are now in the process of offering self-funded or semi-funded fellowships in AO trauma centers in India. Don't forget India, don't underestimate the amount of work and the quality or the capacity of work that places in India like the, AIMS or Ganga or some of the private practitioners like Dr. John in Patna or Dr. Jain in Muzaffarnagar. There are just few names I'm rattling that do a lot of work that you guys might think, oh, this is India and we don't want to go, but it will stand good for a lot of you. I think it will be a much more experience than you ever think or saw around. So just look for options that are available and grab them. What do you want and what do you want to train? And finally, for very much experienced surgeons, AO also offers what is called as the Visit the Expert Fellowship. Okay, so what's the selection criteria for AO Trauma Fellowship? I think it's little age-based, so you have to be 45 years or younger. AO Trauma membership is a must. I think important part of the AO Trauma membership is you just can't become an AO Trauma member, do the fellowship and forget about AO. We also going to be in a process where we want continuity, because why should we invest into you if you're not going to invest back into us? Having done an AO advanced and basic course is also essential. If you had the opportunity to teach for AO in the form of various roles, the stable faculties, that could be helpful. Teaching experience or teaching positions is also an additional criteria. You usually submit a CV. The deadline now is, I think, probably September 1. Your applications are central, through the website. Then the applications come back to us for a central reviewing committee where different marking systems are done so that we can select the right candidate depending on, and the fellowships are about 14 at the moment, but they can vary. In the past, we had up to 19 fellowships, but at the current juncture, we have that number happening. We may get 1 plus minus depending on the region and needs, but that's the rough number. And those fellowships are divided into the zones all across the country also. So we have that sort of a system to equally distribute the fellowship. They finally go to a regional fellowship coordinator who reviews all the applications before matching you to the host center. So there is also the issue of matching your needs to your centers. That is also done by the fellowship coordinator. One of the things that people sometimes do, and things that is once you avail the fellowship, please certainly don't apply it again after 2 years. A lot of people try and slip in, but it's obviously noticed. It's important also what you can give back. I think I can narrate an incident where we had some great challenges with one fellow in Hong Kong, and we spent a lot of time and money getting him out of trouble from that situation he was in. But sadly, we don't see him back. He's not even heard, not even seen, heard. So I think be grateful to AO and the organization when you are availed a fellowship, because I think that's essential. It's a give and take. And finally, now we will also enforce upon that the fellows present their reports to us in probably in a conference in a written format. What's important is you must also think about what can you give back to AO, okay? And that can be in the form of being a faculty, and the faculty journey is a long, lifelong journey. But you can also have now the opportunities to teach in your local hospital. So there are available programs, what is called as AO in hospitals, and you can teach your residents, surgeons, nurses. And these are certified programs that you could run for yourself or whichever places you are working. You can make avail to teach your local community. You can assume leadership roles. So I think once you connect with AO through fellowships, one would expect that you would continue this journey lifelong or for long duration. I think some of you can also get, so I have availed fellows from our neighboring countries, 20 of them for 1 month each, managing and, educating and going through the process. It's a learning process of how they come, travel, stay. So these are different things that can happen to depending on what you can do. So the opportunities to give back are multiple and tremendous. Okay. Finally, some feedback from two of my recent fellows. They've been grateful to share their experiences. I think what they felt or what they were helpful, they all smiling with their experiences. I think they learned about new techniques, new procedures, new changes, new management skills, learn how being, meticulous helps, how planning helps. So I think these things will stay with you for life. A lot of the senior faculties, even in the country who have been on their fellowship, will vouch that has definitely been a game changer in their life. So I think it's a lifetime memory and real-time bonding that you develop with being associated with AO. You develop friends for life. You develop friends all across the globe. You can, pick up a phone to wherever you connect, and you will usually find good thing with AO. So I think it's a great opportunity for trauma. Trauma training post MS is a challenge, but I think the AO trauma fellowship could be your very beginning to then, think about what you could do more to evolve into trauma training, because trauma, as I would emphasize, is our biggest social obligation and our biggest challenge. I think everybody who passes MS after 3 years wants to become a specialist. I think that's not possible. You must invest into your time, and I think a lot of you could be doing great justice by becoming good trauma surgeons. So I think that process will start with your journey with AO fellowship. Finally, I think and plan well when do you want to invest into AO fellowship. Remember, it's a lifelong commitment. I think it's on a lifelong journey they will embark on once you avail an AO fellowship. Finally, listen to everybody what you heard, but think and do only what your mind and heart says, and do that only for your people. I think finally all these things comes down to doing your best for your own people. I think that's what none of us should forget, that all the education and training is for doing our best for our people. Thank you, everybody.
Thank you very much, sir. Thank you very much for that overview. And we'll take the next one. So what we'll do is, recording, yeah. So I think we'll finish 1 or 2 talks by Dr. Bagaria and Dr. Ashok Sharma and Dr. Prashant Mishram. And at 4:30, we'll have a panel discussion with Haiti. So the delegates can sort of, key in the questions. In the meanwhile, I think there are a few questions on the chat and the app, which I'll just send it across to you as well. Yeah, Secret Fellowship Program.
And this
share screen share देना. इधर का mic बंद करना. Mute.
talk is about CCOT fellowship. It will be a very short. Good afternoon once again, friends. And this talk is about CCOT fellowship. It will be a very short talk. Thanks once again, Ashish and Nikhil, for inviting me here. I am Vaibhav, and for this particular thing, I speak as the national delegate and the president of CCOT India. Now, most of you may be knowing about CCOT. It is one of the oldest international not-for-profit association. Started in Belgium with some very elite group of orthopedic surgeons like Putty Platt. And at present, the president is Dr. Philip Hernigo, the guy who pioneered the bone marrow aspiration. Now, as far as the fellowships are concerned, there are a lot of fellowships under the CCOT. And applying for CCOT fellowship is really simple. There's an application form that must be filled in. There needs to be a recommendation letter from the country's CCOT national representative. For India, it's me. Then if there is a local orthopedic body who can give you a supporting letter, or your MS degree also helps. And with that, you apply with a resume and letter of recommendation to the fellowships at the ccot.org. Now, what are the fellowships available? A large number of them are available, and you'll see that this is a whole spectrum from all across the world. And that's the beauty with CCOT. The CCOT represents the international orthopedic body. So there are fellowships from all across the world, whether it be it Peru, Bolivia, to places like Lagos, Nigeria, Pakistan, India. So it's truly a global platform to do these fellowships. Now, what can you expect from these fellowships? So people ask me, are they really worth it? Should you do it? What can we expect? So I always tell them it's like cherry picking. In my previous talk, I also said that not all the fellowships will be hands-on. Not all the fellowship will give you what you want. So you have to cherry pick what you want in life. I always say that if nothing else, there'll be a nice holiday. It's a good opportunity to network with people from all across the globe. I have personally made friends for life, and I'll show you a couple of pictures on how much fun I had when I was doing these CCOT fellowships. You have an opportunity to get engaged in enriching conversations, and you get a lot of new ideas, a lot of new thought processes when you travel to different countries and see how the people out there work. So just some examples. So this is where I did in Germany, and you'll see that they're all dressed in white and I'm in black. So it was really fun to meet people all across different spectrums and understand what they do. Similarly, you'll see that when I was visiting, there was a World Cup of football going on. So you can get to hang out with guys and have so much fun that you would never do it when you are in a very unexpected way. So clearly, having fun is an important part. This is the Professor Frost, and again, one of the pioneers in different arthroplasties for dysplasia. So you meet and greet and learn from the people who are the pioneers in the field. And not only that, you visit places which are legendary. So you'll see this is the place where the X-rays were discovered. So I had an opportunity. And the other thing on the left-hand side is a place which is considered the birth where Homan and Hoffman worked. So all the retractors that you have, and this is the oldest orthopedic hospital known in the world. So these are the hidden gems that you will only know when you visit unknown places. Many of them are there. Unfortunately, today, most of the orthopedic literature is driven either by US, UK, a little bit now from India and China. But there are so many things which are there and which are unknown to us, and that you can only uncover and explore when you actually visit the place. As I said, it's good to have fun with your friends, and there are some of people in this frame who I am still in regular touch with after 20 or maybe 15 to 18 years of my fellowship in Germany. These are the CCOT fellowship. We exchange cases, we talk about our kids, we talk about the struggles we face. So it's really interesting when you do these CCOT fellowships. People ask me, do they have any value? It depends on your outlook. And as I said, value is in the eye of beholder. One thing is for sure, if you choose carefully, yes, it does have value. It gives you a title addition for sure. You make friends, mostly yes. Hands-on, usually no, you do not get much hands-on in these fellowships. And mentorship, if you are lucky, there are few people that I still am in touch with there. And these do give us some kind of interesting insights. And of course, you can contact them when you need them. So it does have value. It's how you extract the value out of these fellowships. Now, coming to the best pick, I think one of the best pick is CCOT meets CCOT fellowship. A lot of them are open. A lot of them are where you can directly interact with the program in those places, and it does give you a good opportunity to travel, and you can apply to multiple of them. Since they are 4 to 6 weeks typically, or up to 3 months, you can at least do 3 or 4 of CCOT meets CCOT fellowship. My choice are, of course, Ganga Fellowship. There is a clinic of hand surgery for those who are interested in hand surgery at Germany. And then St. George Hospital in Hungary is very good. University of Zurich Department of Trauma is an extremely well program in Switzerland. And I would recommend those interested in trauma to apply. And those in pediatric orthopedics who wish to travel, I think Texas Children is another great pick. So all of this, as I said, a lot of them are there and all of them are having value in their own way, but these are the top picks that I have for you. Fortunately, all the information is given extensively in the website www.ccot.org. And as I said, the key fellowship, I think one of the earliest fellowship that you should do is the CCOT Meet CCOT Fellowship. It is funded by both CCOT and local hosts. It's relatively easy to get in. You get a travel expense of up to 1,000 euros and also around 2,000 euros to kind of manage your accommodation and fooding there. It does require a little bit of paperwork, but I think it is worth it. So this is one program that I would recommend to everyone. Of course, all the information is on there on the website, and I would strongly recommend everyone who is interested in CCOT fellowship to go there and read about that. So with that short presentation, I thank you all for your time and invite you to this Orthopedic World Congress that is held every year. This year it is in the country of Pyramid, Cairo. And again, this is a great opportunity to network, meet potential fellowship directors, network with friends. So yeah, once again, thank you very much, Ashish and Nikhil, for having me here. And do reach me out on drbagaria@gmail.com in case anyone needs any further information on CCOT fellowships. Thank you. Thanks. नहीं आता तो लाइव है बोलूंगा I would like to invite Dr. Ashok. To inspire and come up with really good out of, and he was the organizing secretary of the VIROC Global, one of the largest VIROCs and congregation or sort of, assimilation of orthopedic societies across specialties worldwide. So around 72 orthopedic societies had participated in that VIROC the year before last, and that was a humongous exercise. So bringing that experience and his networking and the access that he has to a lot of trainees at the same time, the people who are offering fellowships, Dr. Ashok will sort of give us his idea about how we can learn in this era of let's say online fellowships, when knowledge is online, the era of YouTube, internet, virtual reality, and there are more sort of learning opportunities and avenues to learn, not just observing in a physical format or a physical fellowship. So Ashok, over to you.
So good evening, everyone, and thanks BOS, Nikhil, Ashish, and Nandan for inviting me. So I'll be speaking on this concept of online fellowships. And before I move ahead, I have a huge disclaimer to make. As a developer of the idea, I am heavily biased towards it. So make your mind. So the concept was evolved during the COVID period, where, as you all know, we did a lot of online work in OrthoTV. Nearly around 2,000 webinars and events were conducted. And through that learning and the feedback that we got from all the people who were viewing us on the events, and also from a personal experience, most of us who had kids in the family or their own, they saw them learning online and doing quite well. So why can't this idea be applied to orthopedics? So there was a lot of acceptance of online education that developed during COVID and post-COVID. And we saw that a lot of people were thirsty to learn a lot of things from various experts, same topics from different experts. So if we can create something of this sort and provide them a rational decision-making paradigm and help them reduce complication, we could come up with a very good bundle, which is progression of the webinars, the symposiums, or the courses that are there. So what we thought is, if we combine three ideas together, we'll get a unique concept. So mentorship, like you have heard a lot of speakers since morning, they stress a lot on mentorship. Fellowship is not for that particular duration only. You are bonded to that mentor for your life. So anytime you face any issue, you can go back to your mentor. So that is what one of the major aspect of mentorship is. Second point was critical thinking. So you learn from how your mentors are thinking. And third is practical knowledge in terms of a lot of frugal innovations that your mentors do in their surgical techniques or in their decision making. You learn all that and imbibe it. So these are three major aspects. Once we combine these three together, and we found that we can easily do it through an online fellowship. So a virtual online fellowship, which will combine all these three ideas and give a lot of value back to people who are doing these fellowships. So that is how we conceptualize the idea of virtual orthopedic surgery fellowship. And it was not developed overnight. It was developed over a period of year. And we spoke to a lot of people about the idea and then came up with the format. So another proud thing is that virtual medical fellowship is started first in India. So our country is the leading one, and we are offering a lot of virtual fellowship, not only in orthopedics, but also in other faculty. So that's what something good about us. Thanks. So format is you have a continuous access to the mentor. So through WhatsApp group, you can continuously chat with your mentor, ask them queries, and share your cases. Okay. So second is you can present your cases. The mentor will also present cases. So there are 8 weeks schedule. Every week has a theme. So if you're doing an arthroplasty, so first week is alignment and second week is surgical technique. So based on those, you have the proper chat that is going on in the WhatsApp group. And all the fellows can ask questions and the mentors answer whatever queries you have. Then we have a weekly Zoom format. So we have a weekly Zoom meeting on that particular topic, which lasts to around 2 hours, starts around 8 p.m. and goes on till 10 p.m. So 8 weeks or three month sessions are there in these online meetings. We got some of the best mentors in the country currently. So we have Dr. Agashe doing infection fellowship, Dr. Tanna running a trauma fellowship, Dr. Rajiv Shah as foot and ankle fellowship, and Dr. Guruva Reddy as knee arthroplasty fellowships. The IFIX team is running the pediatric orthopedic trauma fellowship. These are the upcoming ones. So we have a deformity correction fellowship, we have a hand trauma fellowship, hip arthroplasty, and we have ortho radiology courses by Aditya Daftari. Then we have advanced knee arthroplasty fellowship and spine fellowship. So these are all running through around 8 weeks to 3 months period, and they are all coming up in next 3 to 6 months. Who can apply? So most of them have a individualized inclusion criteria. So but most of them require 2 years post MS. Specific fellowships like arthroplasty or Ilozero require an experience in that area. So you need to have a basic experience in arthroplasty or in Ilozero surgery. Only then you can apply for these fellowships. The advantages are it is a purely experience-based learning. So it is one-to-one with the mentor. So you get a lot of experience-based learning. It is most of the lectures are not theoretical at all. They are all case-based and based on their actual learning. They show you the best cases that they have learned throughout their lives. And they share that experience. I mean, it is priceless to see those presentations. Mentorship continues over even after the fellowship. So we started 2 years back. Still, people go and meet Dr. Tanna in every conference that I was the online fellow. So the fellowship continues. The WhatsApp group also continues. And you can continue to ask him questions. So fellows, one of the most important point, which a lot of fellows said is the most important, is that they can attend this fellowship from anywhere. They don't have to leave their practice. They can continue working in their hospitals and still do this. So we get a lot of fellows who are between 45 to 55 years, and they are running their own private practice, their own hospital, but they still could connect to the mentor, learn from their experience, share what difficulties they face, not only in clinical practice, but even in hospital management. A lot of fellows even connect to mentors that I'm facing these issues and how we can resolve that. So the mentorship goes beyond the fellowship pattern. That's what I'm aiming at. What are the disadvantages? There is no surgical hands-on. It completely depends on fellows. Like Vaibhav said, even in physical fellowship, it is dependent on the fellow to absorb as much value, as much knowledge as possible. So it is dependent completely on you, more in the online one. And it is not useful for promotions and otherwise marketing. So you get pure knowledge, and that improves your patient outcome, but not in other sense. So these are certain add-ons which we have. So there are physical events like a one-day conference at the end of the fellowship, or an observership for 2 weeks, 3 weeks. Cadaveric course we did with foot and ankle fellowship. So we had a full 2-day cadaveric course in foot and ankle. Add-on conference registration like we did for arthroplasty. The East conference was given at a subsidized rate. Then there are virtual reality modules which we are developing. And of course, research is also a part of it. So we let you work on mentors' data or cases to write papers if the fellows are interested. So that's another part of these online. We had more than 1,000 fellows in last 2 years from India, Middle East, Africa, and Asia Pacific. And we get a feedback form at the end of all the fellowship. And most of them said that this is one life-changing experience for them. Like I said, what the mentors are sharing is a distill of their knowledge. And to be with them for 8 weeks, like you are being live with Dr. Tanna for 8 weeks or Dr. Agashe for 3 months. It is a different experience altogether. So major impact area that we noted was on network between mentors and fellows. They develop a very strong bond for a long time, reduce complication and improve patient outcomes. For example, this is a 3 months old, 72-year-old male. He was treated with plaster and came to one of the fellows. And this is how he came. So he showed it to Dr. Tanna, and the solution he got was stud grafting, I mean open reduction, of course, stud grafting and plate fixation. And he did this with a very good result and outcome. So this is like a direct impact on your practice. You can share your cases, difficult one, get a proper opinion. But unless you do that fellowship, you will not be having access to Dr. Tanna. So I think it is a great influence on medical education. It will fill a gap in surgical training, enhance the quality of education and care. Of course, it is an evolving concept and we'll learn over a period of time. We'll add more things into it, like I said, the add-ons. But we have made a very good beginning, and I think 1,000 fellows over 2 years are impacting many more patients now. So that's a great thing. This is one of our websites called Ortho Fellowships. a lot of fellowships are listed on this website. So almost India, global, CCOT, APO, every fellowship that we know of, as well as local jobs in India also are listed on this. So you can visit and have a look at that. You can scan the code, know about more online fellowships, or you can visit OrthoTV and get more knowledge. So thanks.
Thank you, Ashok sir. That was a nice talk and a wonderful, unique initiative. Glad to know that India is leading on this front. So the last talk for today pertains to a very important part of your fellowship, that is how to write your CV, how to draft your application. We have a recorded presentation by Dr. Prashant Meshram. He is a shoulder and knee surgeon currently working in Dubai. So we'll be playing the recorded talk and he'll be available later. He'll be joining in live virtually to take your questions. Can we have the talk?
Hey, Nandan, can you hear me? Nandan, can you hear me? Instructional course. I don't have any financial disclosures for this talk. I'm on the editorial board of Clinical Orthopaedics and also a member of American Shoulder and Elbow Society, which is not relevant to this particular talk. This talk is mainly focused on my experience as a fellow and also a fellowship coordinator during my fellowships in Johns Hopkins, United States, and also in South Korea, and also previous research work in terms of the columns which I've written on this particular topic of fellowships, especially for Indian doctors and orthopedic surgeons. So fellowship application and CV give the mentors who are going to recruit you as a fellow a critical first impression. So in order for them to kind of shortlist you as the potential candidate, it is very important to make a very good first impression. So I'll be talking on this particular theme in 3 topics. First is fellowship application writing. Second is CV format and building it up. And final is the letter of recommendation format. Let's begin with the critical steps of writing a fellowship application. So there are 3 parts of a fellowship application email, in my humble opinion. The first one is really who you are. The subject should really clarify that what is the purpose of this email, which fellowship are you applying, what timeline of fellowship are you looking for, and to be very clear on which particular professor or who you expect your mentor to be. Then the first paragraph should really be about introducing yourself, what you are currently doing, what your qualifications are, and also highlighting the first paragraph on who recommended you. This first paragraph is really important for the potential mentors to know if they should go on and read rest of the emails, because time is always less and they have too many applications. So make sure you do a good job, a concise first paragraph. The second part of fellowship email really is about why you choose this fellowship, what it enhances in your career. So why is it suitable for you? Whether it is to learn some particular world-class skill in your particular subspecialty which you did not know of before, some technical advances which are particularly done in that institute. Being very specific is always nice, because then they know that you are sincere and you know what you're looking for. Second thing is you also you can also say that you want this fellowship because of the to publish papers and to advance yourself in the academic growth. And it could be about being very honest with them that you want to settle in that particular country, and this fellowship could be a very good opportunity for you to do that. The third part of the email is really why they should choose you. What do you bring to the table? And this is extremely important for paid fellowships when they are going to pay you through the fellowship. So your real research experience really counts, because most of the universities outside are looking for people who can be very productive in terms of their research experience. So in this third paragraph, you should really highlight what your research experiences or what your surgical experience in that particular subspecialty, so that you can be a very good active member contributing to the surgeries. And in the last paragraph, you should also promise commitment, adaptability, and teamwork. The attachments for your application email should include your updated CV. We will see shortly on what that should have. Then letter of recommendations from the referees, especially of your own subspecialty. If you have a photograph you have taken with this particular mentor you're applying to in previous conferences, meetings, you met them somewhere, then please attach that with this particular email. That really makes a difference because then they have a pictorial memory of who you are. And finally would be 1 or 2 PDFs of your articles which you want to highlight. Not too many, just 1 or 2 would be okay. Moving on to a second topic of the format of the CV and how to build it up, because this is not a common knowledge, at least when we were applying for our fellowships. So the key elements of any CV are basically your introduction, what education or what your clinical training you had so far, your past employments, membership of various subspecialty organizations, then your academic activities, which will highlight your research, and finally your referees who have given you a letter of recommendation. Coming on to the introduction, it's really important to submit an updated CV at least within a month's time, which includes all your recent achievements. Then your name should actually appear as per your passport, just for the documentation, and also include your latest professional degrees. I would really advise to have a professional photo being taken and that to be added, because that's a very good, all your information gets attached to an image instead of just being boring words. Next would really be to highlight the most important achievements of your career, because as I said before, that they get, your mentors will get many of applications, and they really need to sort it out. To sort it out, they need to pick out guys, at least 3 to 4 CVs which are on the top, and you need to really highlight yourself in the top that, okay, you are one of the serious candidates they need to consider. So your key achievement should be right on the top. Then there will be links to your contact information, which should be easy for them to access. And what I recently started doing is attaching my social media profiles or professional accounts, which on click directly opens in a new folder or in a new window for that particular social media account of mine. So that becomes very easy for them to know more about you in case they're interested. And finally, you should also tell them what you're currently doing as a job. The next section is really about proving your core competency in terms of your medical education, your MBBS or medical school, then your clinical training of your previous fellowships. If it's really good if you have experience in the same subspecialty, you really need to highlight here. Also make sure that you mention what are the time periods of these particular courses which you have taken before. Then memberships of various subspecialty societies should be highlighted next in the CV, because it really tells the mentors that, okay, you are committed to this particular subspecialty since some period and you have been working locally to get the knowledge, attending meetings, and that's really important. And when you're going for your memberships of various academic associations, I recommend to be as selective as possible and not to have too many memberships, but be a member of less number of societies, but kind of dedicate your time and sincere efforts towards them in learning and also contributing to them. Next important thing to highlight in your CV is if you received any awards through your career, proof of excellence, especially in your subspecialty or at least in orthopedics per se, would be counted. If you're awarded a best resident, best paper distinction in the universities, or your scholarships, or top reviewer with the subspecialty journal, those are the kind of things you will need to highlight in this particular section. Coming on to the most important part is of the list of your publications and your book chapters. They should be sequenced as per the date of publication. You should use the citation as per PubMed NLM format because it's the most commonly used format and easy for the mentors to read. Then you should highlight your name in the author list so that it's easier for them to catch what position you are in the author list. And also I typically use a DOI link which on clicking directly opens automatically your particular article in another new window. Then the next would be your research presentations, which would be a list of podium and poster presentations which you have done. Full author list should be there, and the title should also be there. You should also specify which particular meeting and what date of the meeting was. And the reason I'm stressing on this is because we come across a lot of CVs in which it just mentions that you have presented something without any relevant information, which is not really, it does not give a good impression. So please be very specific about the details. The next section for your CV would be non-research presentation talks or symposiums. But in early part of a career, we don't get invited as faculties, of course. But what you can ask is your local mentors or your professors in your in the university you are at right now. If they are getting invited as faculties, you can, and usually they ask us for some kind of help to check for the papers or to check the literature review. You can ask them if you can be one of the co-authors. If you can see, this is early part of my career, and I have been second or third co-author in these particular talks. So it's really, if you get a mentor like this who is kind enough to put your name in their presentations, that could be a very good feature in your CV. And the referees, and this perhaps according to me is the most important section of a CV, is whom your referees are. So the list of the referees should be really organized. First one should be the mentor of your particular subspecialty. If I'm applying for a shoulders fellowship, then my first referee should be a shoulder surgeon who is also a known international faculty, is even better. If the mentor you're applying to is a friend of your referee, then it is excellent. You should mention him first. And you should also mention their email and phone numbers. I also recommend to inform your mentors or your referees that you're applying for this particular fellowship, and they might get a call to confirm your details or to verify your sincerity. And so you should talk to your referees beforehand. Moving on to the letter of recommendation format. So the first part should really be introduction of the referee who is giving you the letter of recommendation. It should be on a letterhead of the institute they are working at, the title of the particular referee, and also the contact information should be at the very top so that the potential mentors can contact them if needed. The purpose of the letter should be stated in the first paragraph that your referee is recommending you for this particular fellowship. As specific as possible is even better. The second part of the recommendation letter is really about your professional competency. It should mention how long the referee has really known you and in which particular role he was your guide, or he was your colleague, or he was your mentor during your residency. They should be clarified, and then they should also mention how you were different as compared to the other residents or your other fellows. And as honest a letter is, it is received really well because it gives credibility to the word. So instead of going gaga about yourself, I think the letter of recommendation should really be honest on what your true qualities are. Third part of your letter of recommendation is really about the referee highlighting your personal virtues in terms of your diligence apart from your surgical skills, your character, your teamwork, and your personality. And that really it gives like a personal touch to the letter of recommendation and improves your chances of being selected. And it doesn't matter which document you're writing, there's some basics. First of all, it should be legible, it should be concise, it should not be too lengthy and boring, and try not to use any fancy fonts or the styles. It really does not give any edge. It's really important to keep it simple. Stick to the regular fonts, as we know. Then please check grammar and spelling. Those mistakes are something which says that you're not very sincere about your application, and it does not really help you in getting selected. Also, when you want to highlight, I've seen some CVs in which they use bright red color and to use in the wordings. That's not really nice. Just highlight with the bold and leave it there, and avoid sharing too much of personal details. I've seen some of the CVs mentioning what their spouse is particularly doing or what their family members are and everything. Those are the details you need to avoid, and they don't really contribute to your CV. So if anyone needs more, this exact formats which I've shared with you are also available on my Instagram page in this particular highlight called as fellowships. So you can always access them. More information on building the CV is available on Bombay Orthopaedic Society. There's a column which I wrote for the newsletter of BOS. I think it was in July 2021. You can always access that article online. And also there's so many talks which we have given in the past on YouTube about building your CV, about how to do research, how to be productive, how to get the fellowships, how to excel in the fellowships. So all that is available on YouTube. You just need a quick Google search and you will find it on your fingertips. So my take-home message for this critical talk is to apply for fellowship as soon as possible, even in residency, because most of the fellowships have a waiting period of 2 to 3 years, at least the good paid ones. Then first impressions really do matter to science to stand out when you're writing your CV or you're writing your fellowship application. So follow a systematic order as I just gave you an example, or follow any format of the mentors which you like, but follow a systematic format. Try to be concise, legible, organized, and honest in your applications, and follow up on the NERD guidelines to build up your CV. I leave you with this message, which I've learned through my travels and fellowships, that unless you spread your wings, you will have no idea how far you can fly. Thank you so much, Bombay Orthopaedic Society and organizers, for inviting me. I really appreciate it. Thank you.
And we'll get all the panelists from all the speakers from the last session. Can you bring them up online? Dr. Jamal Ashraf, Dr. Rajiv Raman, Dr. Dhaval Desai, Prashant. Dr. Ashok Sham is here in person, and we also have Dr. Chasna Rathod, who was supposed to be with us, and then there was some commitment, so she dropped out, and again she's back. Right. Nikhil Nandan, can you just yeah. So set the ball rolling. Let me just say, so a brief, to start. Are there any questions from the floor to any of the speakers in the previous sessions? Any burning questions? See, I mean, you will get an opportunity to ask questions on a personal chat, email also, but this is the best place to get a lot of things cleared. So there's one question to the panelist. What is the certainty of getting a desired fellowship in the UK? I think this is also, we are also covering the previous the session. There's one question about which countries can you do a fellowship without having to repeat an orthopedic post-graduation. Yeah, so anyone wants to take that? Nikhil, how certain is someone to get a desired fellowship in the UK?
So to get a desired fellowship, it is, I must admit, difficult. And sometimes, as I mentioned, luck plays a part. But unless you try, you'll never find out. So, but the good thing about UK is even when you're training as a registrar, you are operating, you're working, you're following evidence-based guidelines. There's a structure even to the registrar learning. So I don't think it's a bad idea to start in that system and keep applying. And I'm sure with enough, on your CV and good recommendations, you will get what you desire eventually.
So about the post thing, most of the fellowships in Asia Pacific, you won't require to do any post again. And even other fellowships or observerships, if you call that, just go through the requirements. So most of them will mention. But by and large in Asia Pacific, you don't need to do a post again, especially in Korea and places. Much easier. Korea is much easier to get.
There was a question on how to focus oneself as a sub-specialist after doing a specialty fellowship.
What Prashant said, that we should apply in residency. So I don't think that's a good time to apply for fellowship, because ideally it's important you build a foundation for your career in a national fellowship program. Because even the foreign mentor is looking out like, where were you training in India? Have you done a local fellowship? That matters a lot. And like I've done pediatric ortho. So I finished 3 years of fellowship in India before I applied for a subspecialty. So in PEDORT, I did additional neuromuscular thing in Korea for a year. So that's how subspecialty matters. Just doing a fellowship will not change anything. You need to do something additional which will add to your niche so that when you come back, you get a good position here. Just getting a fellowship for the tag is not a good idea, which I feel.
Can I come online? Can someone hear
I
me?
would like to add that I completely agree with ma'am that if you go for a spine fellowship in Korea, you will not have any edge over others. But when you go for a specialty, like you go to learn endoscopic spine surgery and you start doing endoscopic spine surgery, then you have something subspecialty in spine itself. So again, you have that niche with you where you can distinguish yourself from the others.
I think Prashant wants to say something.
Yeah. Can you hear me?
Unmute yourself, Prashant.
Unmuted myself. Unmuted. Yeah. So a great great session, and congratulations everyone on bringing this together. I think it's going to be a very different scenario right now in India with this kind of knowledge, which we did not have when we were applying for fellowships. To kind of contribute to what Chaznal said, and I think I agree with her that it's not nice to apply for foreign fellowships right after the residency. But at the same time, my point was actually, even if you want to apply for an Indian fellowship or you want to work, not just a fellowship, but it could be an SR-ship. It could be an experience which you want to have in India. You still need to start churning in your residency, because I get a lot of, I get at least 2 to 3 messages every day. I still keep getting from people that, sir, I'm an SR. I did 2 years here, 2 years there. Now I want to go for hips. I was like, what are we doing until now? We have given so many talks and you should have already started. I mean, it's never too late to start, but with all the knowledge we know and with the experience we have, I think it's good to pick up your specialty as soon as possible. Some people may take some time, it's okay. But once you realize that, okay, that is your primary aim, you start finding your local mentors. I've mentioned in my previous talks as well. Even if within India, find your local mentors and then find the mentors abroad. But the process has to start somewhere in residency, or at least as soon as you decide that this is your subspecialty.
Right. So, I mean, there was a comment here whether FRCS trauma orth is possible after you do a training, and is there any advantage? So, Nikhil, I think Dr. Dhaval Desai has responded that FRCS trauma and orthopedics was possible after you finish your specialist training, which was the case when I think we were training. But has it changed now?
Yes. So now you can also write the exam out of training. You need 3 referees to recommend you to the JCSFE, that is the Joint Commission for Surgical Examinations. And once you have 3 referees and you submit your logbook, there is a scrutiny process. And if they find you eligible, then they allow you to write the exam. And yes, in UK, the chances of getting a fellowship after FRCS certainly are more, because one, it is quite a difficult exam to clear. And once you have it on your CV, it means that you have a certain level of knowledge, at least. It may not be research work, may not be clinical work, but it sort of certifies a certain degree of knowledge, which is looked at with some regard by the fellowship referees.
Dr. Nikhil, just one question.
Yes, sir, we can hear you, sir.
So by taking that exam, does it ensure that one can become a consultant? Probably no.
No.
So if one wants to become a consultant in the UK, the easiest and the most straightforward, not easiest, but the straightforward way is to enter the training system.
Exactly. So I think just taking their exam is just like paying money and wasting time to earn a feather in the cap, isn't it? Honestly.
No, I wouldn't say that. Once you enter the training system, exam is one of the requirements which is counted as completion of training. There is an alternative way of showing equivalence of training to CCT. CCT is a certificate of completion of training, and that is called a CESR pathway, certificate of equivalence of specialty training pathway. And one of the requirements there is doing an FRCS exam. So even if somebody is not in training and they do an FRCS exam and they show equivalent experience and knowledge as a UK trainee who has finished their CCT, then they are recognized as to have completed an equivalence of the UK training, and they can become a consultant in the UK.
So are there any examples of anybody's become like that?
Multiple.
So for the benefit of the delegates here, I mean, who seem lost with all these terms, CCT and this thing. So the education pathway in England is quite convoluted. I mean, there are two ways to be a consultant, as Dr. Nikhil said, but let me just clarify what FRCS Orth. FRCS, initially it was FRCS General Surgery, so which has now become the MRCS, which you are appearing for when you are in India. So you are a general surgeon and then you are training to be a specialist. And the first step is the FRCS Orth, which is you are a general orthopedic specialist. But FRCS Orth, initially you could give the FRCS Orth only after you had completed their training program or someone vouched for it. But now they have dissociated that. So FRCS Orth entitled you to become get a certificate of completion of surgical training, CCST they used to say. Now the name has changed,
CCT, yeah.
which permitted you to become a consultant there and settle down. But now they have dissociated the two. So FRCS Trauma and Orthopedics, as Dr. Dhaval Desai pointed out, is probably a cosmetic degree where you are actually giving fees 1,500 pounds, 500 pounds every time you appear, you have classes and things like that. But you get a degree that doesn't necessarily assure you of a consultant job. So for that, there are more things that you would need to.
But without an FRCS, you cannot become a consultant.
Yes.
In UK.
So
it is one of the requirements to become a consultant. Just writing the exam doesn't suffice, but it is one of the essential requirements.
Yes, Dhrumin, you wanted to say something in the mic.
From last year, they've changed the rules. You cannot give FRCS if you don't have MRCS. So you cannot give FRCS, you cannot apply for it. So you have to clear MRCS to give FRCS. FRCS is one of the tick marks to become a consultant. There are a number of tick marks. You have to complete the number of operations. You have to show the competency. You have to do fellowships. You have to do FRCS exams. So it's one of the tick mark to become a consultant in UK. And giving FRCS is very, very useful. According to me, it gives you a general overview. The basic biomechanics, which you learn, you don't learn in MS Orthopaedics, which I think I learned in FRCS. So I think it's a very useful exam and it will enlighten you a lot.
But it's a good exam, but then we'll talk about countries where there are no exams required. Because so there is a question regarding that. So Nandan, there's a direct question to you that what is the additional benefit of doing a fellowship in Canada? And is it possible that one can settle down in Canada after having done the fellowship? So I'll just read out the question. After completing two, three fellowships from Canada, is there any option to settle down there as a consultant or a teaching faculty? If yes, then are there any examples of surgeons from India who have done that? Yeah, that's a top question.
Yeah. So I'll answer this question in two parts. The first one is you don't need 2-3 fellowships if you really plan to settle. To settle down in Canada, there are two routes. The straight route is repeating the residency program, and then you get into the system. There is a straight route, which is a difficult and a longer route. The second route is you can apply for a teaching license, which is valid for 7 years. So after you complete your fellowship, you can be affiliated with one of the teaching hospitals under a mentor, and you can continue further as a consultant in Canada. I do know of one surgeon from India who was a senior from Indian Spinal Injuries. His name is Dr. Vishwajit Singh. After completing his fellowship in Calgary, he has stayed back as a consultant on a teaching license, which is valid for 7 years. So after that period is over, if he wants to continue, it goes for renewal. He has to, somebody from Canada has to ratify that he has done good work in that 7-year period, and then you can continue. So there will be like continuous renewal every 7 years, and there is no scope for private practice. It has to be affiliated with a teaching hospital.
So a lot of these applications must also be depending on his CV, statement of purpose, and those kind of things. I think Dr. Chasnal wanted to say certain things about writing your statement of purpose, especially when Dr. Prashant showed the brilliant slide about how to formulate an email, starting with the language and the font that we use. Everything is being looked at, and you have to be very specific, country specific. I mean, I think Supreet and everyone will agree that, the application, the language used in Australia cannot be applicable to England. They are very, very picky about that. They call it biodata, someone else calls it curriculum vitae. It's as basic as that. So the English don't like any fancy font, so it has to be Arial or maybe Times New Roman. These are the only two fonts in your computer that have to go. But you wanted to say something about the SOP.
Yeah, so it was a very nice talk by Dr. Prashant. And I think a few important points. So some countries ask a SOP, that is called Statement of Purpose. And it is exactly what Dr. Mishra mentioned about how your email should be. And it should be divided into 3 paragraphs, so which he already spoke about. And if they don't ask for an SOP, still you should have this as a covering letter along with your CV. And this entire should be in a PDF format. So one PDF, don't send a Word format. It should be a PDF with a header and a footer about you, like your name and some degrees. So, and rest everything he has covered wonderfully. So just don't be hassled by the word SOP. It's exactly what he mentioned about the covering letter or the covering email. And many countries will ask you for this. So just get used to the term.
So you can maybe share a sample
Yeah.
format or so. I mean, even Dr. Prashant's Mishram's talk will be there in the recordings that we give you. There's a question of upcoming online fellowships. Can we register now? Where is Dr. Ashok? Yeah.
Yeah, of course you can register. You can check on OrthoTV website. We have the OrthoTV Global Academy, and whatever new fellowships are coming up will be posted there. And of course in our fellowship WhatsApp groups also. So if you're not part of Ortho fellowship groups, let me know and I'll add you. So it's available.
Right. So there was a question pertaining to the USA, that whether the USMLE scores are required are as high to do a fellowship as much as you require to get into a residency program. I know Mohit has left, but does anyone know about it? Do you require as high USMLE scores to get into the US to do a fellowship?
I could take it.
Yeah, Prashant, yeah.
So I did a research fellowship just to clarify my conflict of interest, but I was a part of the selection committee, at least under the table, who were looking at the clinical fellows being selected. So as long as you have a very good recommendation by someone who really know that program director, I think USMLE scores are not that important. It would not, unless it's like they don't really have a very strong recommendation and they have to select it from a bunch of 50, then they will select people with very high scores. But I think that's secondary. I still think that you should go for maximum number of marks if you don't have really strong recommendations. So it's secondary. The most important thing still remains your letter of recommendation and how strongly, if your mentor calls up the program director directly, they know them personally that this is my guy and he has been with me, blah blah blah. I think that's the best push for your selection for the fellowship. The second one would be if they don't have such kind of preference, then it would be based on your marks. And more than the marks, I would say that it's really about how much publication you have. Because I remember at Johns Hopkins when we were selecting the shoulder clinical fellow, we had about 52 applications. Out of them, 10 were selected, and they were blindly selected based on number of research publications, number one. And number two, based on the quality of publication. If I remember one guy had only 5 publications, most of them were in really good tier journal, and that particular person was also first or second author. So significant contribution. Those are the quality always counts more than the quantity. Then your letter of recommendation. Those two things count more than how high you score in your exam, USMLE. That has been my opinion or my experience.
Excellent. Yep. I think right on scope or no, or mic on the चालू है.
So the question regarding MLE scores also applies to MRCS. I don't think the MRCS score matters. It's just that whether you have a pass grade or no, the exact score doesn't really play a role.
Any questions from the floor? Yeah.
I wanted to ask regarding Class T, like if you want to specialize in Class T, so going to UK, doing the MRCS, giving 5 to 6 years, is it better, or like doing a 2-year Indian fellowship and a year and a half of fellowship abroad? That would be a better pathway. Like, how do you decide?
So to be honest, I have no idea about the Indian fellowship because I've not done one. Eventually, I think it is about doing a significant number of cases hands-on, and at the same time being exposed to a breadth of difficult, complex arthroplasty. You may not do all the complex cases by yourself, but you should at least work in a center which gives you that exposure. So as long as those two requirements are fulfilled, and I feel either one is, good enough. I really don't know about the quality of hands-on work you get in Indian fellowships. At least when I was applying for fellowships, I could not find any fellowships where there were offering significant hands-on work in India. Things might have changed. You should speak to the current fellows who have recently done those 2-year fellowships, and I think they will be in a better position to give you a good idea.
See, can I just take that question? So where are you working right now? Where did you pass out from? This KM and Cooper, right? So you have a basic understanding and you have seen enough number of knee replacements being done in KM, unless you have not worked in an arthroplasty unit, isn't it? So you have got a basic understanding. So the best way, and you want to be a good arthroplasty surgeon. So it doesn't matter, where you do the fellowship. So we go back to that slide which Dr. Mandara Agashe showed, that you need to have a current base of an Indian fellowship. If you feel that the volumes you have seen in KM are good enough for you to just build on that little, nuances of knee replacements or hip replacement you want to do, then you visit a center internationally. Then you said, okay, I'm going to Canada. I'm just going to see this revision hip with Duncan and Mastery. I'm just going to apply to them and going to tailor my CV to them. But rejections are quite a lot. No matter what, all these guys, everyone who has spoken to you today, they must have sent hundreds of applications, out of which, initially you just get a few applications even acknowledged, leave alone rejection letters. They don't even acknowledge you. So the best thing in your thing will be stay as a SR, try to do some cases, visit some Indian facilities. If you can do an Indian fellowship, well and good. But at the same time, as everyone said, while you're doing the Indian fellowship, have one eye towards an international fellowship if you are keen to do that. Because what international fellowship gives you, it adds a facet to your personality, which was the message we did not come across, very strongly. But everyone mentioned that, they had a good relationship with their mentor. You make new friends, you learn a new way of life, you broaden your horizons, you're a better person, you start thinking differently. So that is what you want to have in your practice whenever you become a consultant. You can go for a short-term fellowship and be a lecturer here in KM or, any of the private colleges, maybe MGM, DY, Prerna, where you can come back and start doing the replacement. So that will be the ideal one. But we don't have so many lecturer jobs. We don't have so many SR jobs. So therefore, a lot of us have to rely on seeing a huge volume, fair number of complications, how the senior surgeon comes out of that complications and comes out. One of the best things that you can take is from Dr. Sate's talk. He showed you a screenshot of his logbook. I have not seen a lot of people maintain a logbook like the way he is maintained. The Royal College of Surgeons of England, even on their website today, if you just go to surgical logbook, there's a template. It's free for anyone. You just have to put your email and download, and you can keep on doing it online.
E-logbook. It's called e-logbook.
E-logbook.
Still there. Yeah, we had
all you need to do just, now though it's very easy because everyone has a smartphone. So I'm talking about the era when we had laptops and things like that. So just download this logbook, just put in today I did this case. This was a take home, this saying that, the surgeon got stuck while attaching this fragment to the distal fragment, or maybe passing the screw or passing the lag screw. Anything that that would remind you of a particular struggle or a take home point in that surgery, you should do that. So, every small these things, they will really help. And I think most of us here would have seen Dr. Lahiri's spine surgery or spine OT book, or people who work in spine and work with Dr. Bojraj. So since the last 30 years, they have just maintained a logbook of all their surgeries, all of their surgeries. The fellow's job is to enter the OT notes twice, once in the patient's notes and once in the logbook. And just going through that logbook itself is like a textbook. Am I right? I mean, you must have seen that here. It's called a black book. Dr. Lahiri, in KM, you must have seen. Abhi hai ki nahi, I don't know. But during our time, at least it was there. So every person is different, every career will be different. So therefore, you have to tailor what you want and where you feel less confident. Then you go. I've seen Mohan Desai, I've seen Mohanty, I've seen Atul do so many cases. I don't need basics. I just need I need to go for shoulders. Then you tailor your application, this thing accordingly. Anything else?
What you can do is, like he said, you learn for a while here, practice for a while, and then IOA has particular programs for more than 40 years age. And each of the associations like POSI and even other, they give this traveling award or traveling scholar programs where you visit them as a consultant. It's not like a fellowship, but they treat you nicely as a consultant from here. And that adds to your career. It gives you a break to travel while you have completed 5 to 6 years of your practice, and then you can discuss more practical questions based on how you have practiced here back in the country. We have different problems, and the other world, they have different problems. Our deformities are much more severe. So it's nice to have our own experience when we go out at a little older age and discuss in this other fellowship programs which you saw, which Dr. Raman also mentioned. So I think that's a good idea again.
So while we are talking, Dr. Neeraj has already put on the link to the e-logbook in your WhatsApp groups. Anyway, we can take the next question. Yeah. So, sorry. Also the fellowship group. So that is another good resource of, targeting some fellowships which will interest you. Yeah.
Sir, if I dedicate around 5 years to UK and suppose I clear my FRCS during that time, but I work as a registrar, but I'm not able to get a fellowship during that time. And if I plan to come back after 5 years and start my practice in India, how will my prospects of working here without a fellowship, just doing a registrar post for maybe 5 years, how will it affect?
So that's a good question. And I think that's a very pragmatic question, it's a very real life question, because no matter how much you try, there might be a scenario where you don't get a fellowship. But once you go there, as I mentioned, you're definitely going to be working as a registrar. Even as a registrar, you do a significant amount of operating. To be completely honest, I did more first-hand operating as a registrar than I did during my fellowship, because fellowships are in central institutes where there's a lot of complex work happening. There are second revisions, third revisions happening. So even as a fellow, you're not going to be independent in those cases. You'll do the primary ones, but these are going to be done by the bosses because they have been referred by other arthroplasty surgeons because there has been a complication. So in terms of operating, even as a registrar, you'll be doing a lot of operating. You saw the numbers in 6 years, you're expected to do around 1800 cases before you become a consultant there. So about 250 to 300 cases a year is what you roughly end up doing, which is a significant number. So if you spend that much time and you clear the exam, I don't have any doubt that surgically you will have achieved a certain level of competence, which will take you through your professional life. So yes, I think spending those amount of years will definitely, help you, even if you do not do a structured fellowship.
And see, you don't put a timeline on that. Okay, I've spent 4 years and 4 years and 1 month, I should get a fellowship. Things can get very frustrating. You see the career paths of people who have settled over there and who are consultants. You go to specialistinfo.com. Which college are you from?
Sir, I've passed my MS from KM.
You also passed from KM. You look at the KM alumni, or KM alumni, there will be so many people who have spent so many years in the UK and then at the end they have got a fellowship. So it doesn't mean that if you're not in a fellowship, you don't learn anything. Isn't it? I mean, every registrar, you learn and you accumulate that experience. Here, no one is going to ask you what you did in the UK because you can easily, isn't it? I mean, a lot of people say, Singapore, I did a fellowship, which was so brilliant. I operated so many cases and all, but there's no way to check that, cross-check, verify that. So if you just want a cosmetic fellowship degree, then that's a different issue.
And we know many colleagues who have come back doing not fellowship, just SRship and doing very well in India.
Yeah.
No issues at all.
It's how you
we have a lot of
imbibe
examples.
what you want.
And also, if you're there for 5 years, you're in the 3rd year, you are still have experience of 3 years of UK, which is going to count in your next registrar post, which the registrar, with the trust, head of service does take into account when allocating what work you can or cannot do. Your 3 years of UK work, although it's not a formal fellowship, but you will still end up doing, as you said, much more than probably a fellowship would give you.
So there are like fellowship equivalent jobs. So as in KM, post MS registrar will do the same job that a bonded guy would do, but you are just following 2 different parallels. So whatever name you decide to give that job, they will probably be doing the similar thing.
Sir, and also regarding the application on track jobs, the posts which are available, it is very confusing to know which jobs to apply for and which jobs to not. So is there any specific
Yes, so it is important to understand the structure of the UK healthcare delivery system in terms of doctors. There are 3 levels of doctors. Junior doctors, and it will have multiple names: junior clinical fellows, house officers, SHOs, ST1, ST2, foundation year trainees. All that means basically it's a ward-based job. It's a house officer job. Then there is something called as the middle grade. So those are the registrar jobs. So that they may be called specialist doctors, senior clinical fellows, registrars, specialty registrars, specialist registrars, multiple names, but it essentially means the middle grade, which is basically a theater and outpatient clinic based job. And the third tier is the consultant. So if you look at a job, you read the job description, try to fit it in one of these three. So at your level of application, it will either be a house officer job, or if you're lucky, a registrar job. So looking at the job description, see where it fits. There might be different names, but eventually it's either a house officer job or a registrar job.
Clinical fellow, wherever there is post CCT in brackets, don't apply for that.
Those are the ones which are post FRCS, post CCT. So
anything else you would like to add, the panelists? I think online also the questions are drying up.
So I think there is a simple formula that comes up through the entire day, that if you are oriented towards going to fellowship, start early. Like Prashant said, start building your CV, writing your research papers, start with small, collecting your data, maintain your logbook, very, very important. So this homework you have to do while in your residence. Third year of residency, start applying. Indian fellowships, foreign fellowships, and see how they interact with you. It's a learning process. Application also is a great learning process. You come to know the mindsets of various people. They'll call you on online interviews, attend those. So it's a learning process over a period of time. Then after you're finished, I think you should work at least a year or two in India, take a local fellowship, and through the mentor, try and get a foreign fellowship. That's another way of getting a foreign fellowship. A lot of people work with an Indian mentor, and the mentor himself can send them to a foreign fellowship. That's a very, very good plan to follow. So plan it ahead. There are small steps to be taken right from residence.
See, and the times are different. There was a time when we didn't have as many training opportunities in the country. Now the times are different because a lot of these people who went abroad, they have come back and they're implementing the same sort of practices, protocols. The standard of care probably is better in some of the hospitals than what is given abroad. And therefore, you can expect the same kind of, thought process in those consultants as well. So absolutely, it's not that, when you do an Indian fellowship, you are ranked lesser or you're ranked higher or you learn lesser. It's absolutely untrue. I think when you compare to fellowships, we are given Ganga, Shalby, and, with Dr. Guruva Reddy, the products coming out of there are absolutely, they're very, very good. We have, peers, consultants amongst us, people from VR Spine, from Hinduja. So the times have changed. There are a good number of opportunities here as well as there. And you have to just, pick and choose what you are comfortable with.
Another thing I wanted to add, sometimes what happens is during residency, you have not published anything. And now you are being told that you have to apply from the residency, but you don't have anything in your CV. So this was the first thing which I faced. When I came out of residency, I had only one publication. And then I was not in a position to, say that my CV was strong. But then what I did was in the next 1.5 years in KEM, I published 15 papers. So at the end of SRship, my CV was strong. So even if the residency period is gone in cutting, you still have that SR period wherein you can, focus mainly on publishing and improving your CV.
And see, the simplest way towards a publication, as I mentioned, is starting with presentation in your local meeting or local this thing, So every column has to be filled with something. It doesn't matter what it's filled with. So there is a poster. That poster can eventually become an oral presentation. That itself can become, it can be an offshoot from your dissertation. So you don't need to, be after a lot of things. And secondly, speak to your friends, talk to your friends, batchmates. A lot of people, batchmates, they have put each other's names in each other's, dissertation or papers. This is the only way you can increase your thing. Yes, everyone does that. I don't know if it's the right thing or no, but I think, see, if there's a contribution, you can do that. You have to contribute in either patients or your expertise or something in a statistic to do that.
So I would like to add to that, just like Ashwin said, at the end of residency, we had 0 papers, 0. So the first application sent out to Canada in 2018, no response, and it hurts. Like, you're from KM, you feel that you'll walk into any fellowship program, but that is not the case. So I started off with a case report in Ashok Sir's journal, JOCR. That was the first of, and like Sir said, we decided to hunt in packs. So it's like a group of 5-6 people who are working together. If it's a plastic paper, somebody who's looking for a plasty fellowship is the first author or a corresponding author. If it's a spine paper, you are the first author. And like if you are with a bunch of 5 to 6 guys, you can easily sort it out. We even had somebody just doing all the illustrations. There was one person was doing only the statistics. So if there is somebody good in mathematics on your team, just as a stats person, so as a team, you can really publish a good volume of work.
And I think one thing you all can take away from here is that, and if you look at the speakers, they have spent a good 5 to 6 years after their formal training and really invested that time in getting a skill set which they are eventually going to use. So learning takes time. It's not that you're gonna, do a 1 year dedicated fellowship and you're gonna know everything. So don't get disheartened by rejections. At the same time, don't get too desperate to, get a fellowship immediately. As long as you're learning and, inching closer to your goal, I think you're going in the right direction.
Absolutely. So rejections will be there. It will be a long process. There was a time when we used to finish our MS probably at around 26, 27, and we used to have a ballpark that at 34, 35, you would be a consultant. But now, because of the government service, bonds, MO-ship, everything has been pushed by 1 or 2 years. So don't bother with that. Because nowadays in the fellowship year also, you're going to be paid decently well. Not very poorly, not very well either, but at least you will get a decent amount of money. Unless you have to shell out from your pocket.
And to be honest, worst case scenario, don't do any fellowship. Still, remember you're an orthopedic surgeon. And has any one of you met a poor orthopedic surgeon?
So I see a specific question pertaining to Canada. Any advantage of giving FRCS international and benefits in getting fellowships in Canada? So in terms of requirements, none of the fellowship programs in Canada have listed FRCS International as a must-have requirement. So I'm not sure whether it benefits. I just guess it's a good value addition to your CV, but not a must-have for Canada.
Excellent. Yeah. Can you just ask in the mic, because there are people online? I think I don't know how many people are still logged on online, but there are a fair number of people.
60.
60, yeah. So I think better ask in the mic. Yeah.
Yep. Thank you for this course for everyone. Firstly, and basically, are there any extra things that you require? For example, ATLS or AO Basic Advanced. What all are value additions in your CV, which you can add?
So yeah, most of it adds as a value in your CV. So I did the pediatric advanced life support course before going for all my foreign fellowships, which was a certificate valid for 2 years. So I think everyone should do a BLS at least. And we have ample programs which run throughout the year for ATLS, BLS. You should certainly go. That's a good point.
So ATLS is a must if you want to become a registrar in the UK, because you will have on-call commitment. And for that, it is an absolute requirement to be ATLS trained, not just doing it once. It has to be within the 4 years validity. You have to keep on doing it.
So this year we'll be having the ATLS course in Viro. Last year we tried to ask the college ACS, but this year it is there. So ATLS will be there. There are some other courses which are run by British organizations which are there in Sion Hospital. I don't know if it's active, but Delhi Apollo is definitely there. So one of those courses are ratified by the college. Or if you don't have, I can tell you a backdoor, you can just say applied for. But that doesn't, they can see through that. They saw that, okay, you know that this is your lacunae and you're working towards it. That's all it tells them. Nothing else.
I think even NMC has ATLS requirement now, because we are having for our student at Sanchiti today.
Achha.
Yeah. NMC.
But are there ATLS, are those NTMC courses or the ATLS courses?
So the one which LTMC holds, it's valid everywhere. It's accredited by the ACS, American College of Surgeons.
Yeah. So the NTMC is National Trauma Management Certification course or something like that. That is done in India. So that will be done in Bombay. I don't know the details who is doing right now, but I knew for a fact that Dr. Satish Dhara from Sion used to do it for a long number of years.
So I have something to add to the value addition. We had a very interesting case example given by Deepit Sahu sir, where he said that his fellow was working on something different, like a position statement, and that was looked upon by the people who were giving out fellowships. In my case also, I happened to be in a good place at a lucky time, the Association of Spine Surgeons of India was developing an app called the ASSI Connect. And my mentor, Dr. Srivastava, was in charge of that project. So while this app was on, I was working behind the scenes, helping put together the app and some of the things associated with it. And the ASSI gave me a certificate for the same. So when the Zoom interview for Canada was being conducted, coincidentally, Canada was also building an app-based platform for discussion of complex cases across Ontario. And they wanted our inputs as to what are the privacy related issues or some other things that go into app building. So if you get a chance to participate in something that's different or unique, that will make your CV stand out from your peers. So don't look at these projects or as a waste of time. It may be a lucky break for you.
Even your computer skills are very well looked up to. And if you demonstrate that you have a good knowledge of database management or Microsoft Access nowadays, I mean, you don't access, but if you've done a certification course in Excel or you've done something good in Excel, they are more than happy to, have those skills. Okay. So one thing which was left, I think it was briefly mentioned in the beginning, was audits. So fellowship in the first session, it was mentioned that fellowship is basically like an audit. When you're auditing your own practice, you're auditing your own patients and your outcomes. Yeah. So if you are planning to go to the UK, they love audits. They absolutely love audit. You might not have a single publication or presentation, but if you show an audit, so what for them, an audit is basically you're auditing your own practice to become better. And you're comparing it to a known standard. You're not laying down a new standard. You're not reached there yet, but at least you're comparing your practice to whatever is the standard of care or whatever is recommended. So if you show that, that is what the surgeon and the consultant is interested in, that if I employ this fellow for next 6 months, at least he will do a couple of audits and he will tell me if I'm doing correct, if I'm on the correct path, I'm doing good or I'm not. So it's like a must have. So wherever, whichever institution you are, yeah, Siddharth, you should take part in audits.
In my application to UK, in that same very question column for audits, we used to have a weekly audit, trauma audit in Cyan every week, every Friday, where all 4 units would sit together and discuss the trauma cases. I put that as the audit experience from India, and that counted, and that actually had weightage on the application. So sometimes we don't do things which are formally labeled, but we actually do them.
Yeah.
So just give it a thought as to what the columns are, and you actually would have that experience. You just need to put it in that right spot. Like audit is something that we do, but it's never labeled as a formal audit, but we do have our HOUs, mentors comment on the fixations that we have done. That is what a crux of an audit is.
Any other questions? Did you talk about the good standing certificate from MMC?
No, not yet,
Yeah.
but Prashant has a comment.
Yeah.
Prashant, yeah.
Yeah, Prashant, go ahead.
Yeah, as long as you're moving to the next question, I saw something which is one question which has been repeating in the chat box, is that after the subspecialist your fellowship, how do you get into the market of doing your specialty work, right? So this is something which I'm going through right now, like just after your fellowships, few years trying to develop your practice into a specialty practice. So it's challenging. It's not like you'll go and everyone's not going to refer to you your patients. So there are 2 things which I've learned. Number one is you should always try to keep an open mind about different cases. Even if I want to focus mainly on shoulders and mainly on knees and mainly on sports and maybe joint replacement, but if a patient walks into my clinic, they're booking for a low back pain, I'm not going to refuse them, because what happens is once they have a good experience with you, they are going to tell other people that, okay, this guy was at the least you can do is have a good conversation with them, because that builds up your bond with people. So don't start saying no to people, especially in private practice. Accept all kind of patients. Number one is at least make sure that you face-to-face time, give them time and develop your bonding, because ultimately word of mouth doesn't matter where you go, word of mouth is the strongest way in which you can grow your practice. Once they know you're interested in shoulder and knee, over the period of years, they are going to come to you, especially when they know that you have a good CV. I mean, you're a faculty, and once they know who you are, they will come to you. But it will take time to develop. So initial years, accept all the patients, at least in the clinic. Second thing is, don't operate something which you are not good at. it's so essential to know, don't do discectomies if you don't have a spine fellowship, if you haven't done it in the past. Do traumas, fine. I mean, at least in KEM, we have enough this thing with trauma. So do trauma cases, something, be on call, do trauma cases, do something which you are good at. Try to develop more cases of your specialty on the OPD basis, not on the emergency basis. But at the same time, learn how to say no. Even if it's a simple, if you land in trouble, then in private practice, it's difficult to kind of recover from that. Not just that if you have done a bad case of not something of which is not your specialty, it will reflect, people will think you're not a good surgeon, even in your subspecialty. So accept everyone, talk to them in your clinic, be very selective on whom you're operating, at least, and refer it to people who are super specialized, because then they will refer. If I refer someone to Nandan, Nandan's going to refer the cases to me and shoulder if Nikhil is not available, right? So that's what that's how it goes. So initial years are important. You have to be cognizant. You have to be very careful in your selection, and of course, be nice to everyone.
Right. So Prashant, there's a question to you. What is the pathway to settle in the Gulf after MRCS fellowship? You can see the last question there.
That's I'm actually, I'm thinking of kind of writing, making a whole program or a session, or at least like a talk about this. A lot of people have been asking me how to settle in Gulf or UAE or Dubai, especially. It's pretty straightforward. Like, you got to give one of the entrance exams, which needs a preparation time of 2 to 3 months. But don't give exams without, like, for example, we have a Dubai Health Authority exam, which usually takes 2 months to prepare. So you prepare, you give the exam, and then there is a verification of the documents, which is for any other country. If you have a registered license of US or Europe, and you have worked there as a practitioner at any capacity, that will give you a consultant license, which in terms of pay scales is a little higher as compared to if you directly come from India, which will be a specialist license. In long term, it doesn't really matter, because it depends on number of patients you generate, you'll get paid. But initially, to get selected in good hospitals, it matters if you have a license in UK or US. In long-term goal, it doesn't matter. And soon, hopefully, someone will invite me to talk about, or I'll put up a program about how to get into Gulf, and it's that's for the future.
Thank you. Any other questions here from the floor? Any burning topics that come to your mind? So I think let's check online. There are no questions online either.
I think
Any
you should
closing comments
also
from any one of you?
apply for the MMC Good Standing Certificate. It helps particularly when you apply for fellowship programs, which give you an opportunity to do clinical work, like hands-on work. And this certificate helps you to get a kind of a local, like a approval from the local body to scrub in foreign countries also. So it's good to have this additional. If you send it along your application, it works. I did a clinical fellowship for a year in South Korea, so I needed that.
The good standing certificate.
Yeah.
Yeah, I think that good standing certificate is required by most of the
required.
societies whenever you're applying for.
So just it's an MMC application, very easy nowadays, and you get it very easily. Just apply. It's online process.
And they will certify that you are good.
Yeah. And that too quickly.
It's as easy as
you
it
don't have
is.
to wait long.
Excellent. Yeah. So any one of you, the delegates would like to say something. I mean, whatever you learned throughout the day, or whatever was good, whatever was bad, you're please free to, take the mic.
How
say
you
anything.
Found the program, if it
Yes,
should be repeated.
and whether we should include something more, something less, and whether you want to see your juniors or some of your peers do it next year or so.
Any aspects we missed out which you wanted to be discussed? So any scope for us to improve?
No one, then yes, I think we'll have the closing comments, because it's quite fast. Everyone's saturation point. Yeah. So I would just I always remember what my fellowship mentor told me. I mean, we could go on and on about everyone else's single fellowship, but just remember one thing in mind. He said that, Ash, I'm going to be with you for 10 hours a day when I work. Okay. And I'm going to be 8 hours a day with my wife. So I'm going to spend more time with you than with my wife. So you better be that interesting. So it's not only orthopedics, that you're looking at. That's what he said. So he doesn't want to see, okay, I come from India, I play cricket. oh, I am interested in music. So they want to see something else. So whatever you said, value addition. So if you have any social skills, if you have any, anything else. So they have an interview. The Southwest Wales Deanery had some interviews, and the guy who won that, he said in his CV that I'm the president of my local wine tasting society. And the whole interview went on that, just like Dr. Dipit said, the whole interview it's hijacked somewhere else. So it went on, okay, how do you grade the wines and when do you do it and what sort of season that you go on? Do you travel elsewhere? So everything. There's one guy who was a scuba diving expert, or he used to go on expeditions with the Royal Navy. So, his job was guaranteed because they're such interesting people. They said, we don't want a boring candidate or boring person next to us for next, 10 hours in a day. So, apart from curating your CV, also work on those facets and those aspects of your personality. So this is for UK. I don't know how it works rest of the world, but at least I can say that in UK, probably these things do matter. Your presentation skills, the way you, even if you are going for a observership or someone like visiting, it can work as a double-edged weapon. You start smelling of, just street food that you had some soya and you just pitch up there, they're not going to like you. So you have to go there, first thing in the morning, be very serious, be over prepared for every single thing. Some things are a taboo, like, smoking or, drinking in public. So initial period, when you get the fellowship, don't get too, carried away. Yeah. Okay. Do you want to close it?
No, so I think what we tried to do was, paint a very realistic picture of how life is or should be in the first few years after you finish your formal training and before you take up a consultant job or, you enter independent practice. It is a time of uncertainty. It has been like that for everyone. It will be like that for you, for your juniors. So don't get disheartened, but I think eventually everybody finds their way and you'll also find your way.
Thank you very much. Vada pav is there. We hope the rains are also there. So there's vada pav and there's coffee for people who are attending it physically. Unfortunately for the online guys, we'll have you over next time. Want to say something? Yeah. Oh, sorry, Dr. Chasnal wants to say something.
Yeah, so
she's a EC
big
member of the
thank
BOS.
you. Yeah, so big thank you to Dr. Fadnis, Dr. Nandan, and Dr. Nikhil. And they've really put up a wonderful program for the fellowship, and on behalf of the Bombay Orthopaedic Society, there's another round of applause.
Thank you. Thank you very much, Dr. Desai and Dr. Prashant. So we'll close the meeting. Thank you very much for being with us.
Thank you so much for having us. Thank you so much.
So we have forms outside. If you want to apply for the BOS membership, please do that. You get extra eligibility for the Rising Star and Student of the Year, which are the highlight in VIROG this year. So please do that.
Yeah, the WhatsApp group will be active for a few days where we'll be sharing. So we'll have a list of the fellowships that are available in the country from people who are obviously responded. We'll be sharing that with you. We are just arranging that alphabetically according to the emails and just making sure that the information is correct. So it will be shared on the WhatsApp group. Dr. Neeraj has shared something else. There'll be a link to a Google Classroom, which Dr. Nikhil has sent you. So just make sure it's not in your junk mail folder or so. So make sure you accept the Google Classroom, because these files will be very big and it will be shared as a Google Drive link. So actually, YouTube link will give it to you. This program will be on the BOS link. Yeah. Thank you. Dekho, बोलेंगे?